All right, good morning, everybody. Welcome. Glad you could make it this morning. Thank you very much for coming. I feel like I should have had, like the Elvis music when I came on. Da-da-da, da-da-da. But my big white outfit's at the cleaner, so I couldn't do that today. We hope you came here to learn something and to be aware, because that's what this fentanyl conference is all about. This is the beginning of a campaign for us. It begins here, and the education and awareness goes from here. We're glad you could be a part of the start, and welcome. For those joining us, and just so you know, this is being streamed. So if the camera's on you, please shoot them a friendly, and we'll go from there. So understand that the cameras are live and hot. Anyone who's joining us from outside New Mexico, welcome. We're glad you're here. It's a beautiful day in New Mexico. Please come visit us at some point. Okay, fentanyl. Wow. What a topic, huh? We know it's a problem in our community. We want to address that. A few things to take care of, a little bit of business before we begin. You've probably been in the resource room. If you have not, all things fentanyl back there, information for you, test strip, Narcan. If you don't know about Narcan, please learn about that. Get one for your medicine cabinet, because you just never know, do you? But all the information, there it is. All the information is back there. Also, we know that things like this can be a little overwhelming. If you need some time, there's a quiet area. There's peer support back there for you, and you can talk your way through it. Just tell us what you need. We're here to help you as well, all right? If you need bathrooms outside, to the right and to the left and across the foyer, there's bathrooms on the other side. All right, so as we start this, I want you to know that this was the brainchild of Lisa Cedillo White. We were asked early on ways we could help the citizens of Bernalillo County. What can we do? What's out there? What are the issues that are out there? This is the one that she came up with, that she knew was a problem, and this is what came out of it. And you have to understand that when we do things like this at the county, we're asked this all the time. What can we do? What can we make things better? How can we do that? And that comes from great leadership, and we have great leadership at the county. We're given the opportunity, and we're encouraged to come up with these kind of ideas and do this kind of thing. And the person who makes that happen, and we're going to hear from her right now, is the woman who leads the county. Great person, County Manager Julie Morgasbacca.
Thank you, Tom. Can you all hear me okay? So yes, my name is Julie Morgasbacca, and I proudly represent the county as the county manager. I love what I do, and this is why I love what I do, because we get to do things like this with you all to make a difference in our community. So on behalf of Bernalillo County and our awesome county commissioners, I'm grateful to see this large audience gathered here today, joining us virtually, that is united against the biggest single threat to our communities and families. And you all know what that is, fentanyl. I'm fairly certain that each one of us here today has our own personal and professional experience involving a friend, family member, neighbor, or client who fentanyl has affected. This wide span of hurt, loss, addiction, and damage caused by fentanyl and its pushers have affected our families and communities is also where our solutions lie. Our community, you all, us, we're taking this. We're going to do this together, and we're going to make a difference. Our community is the state of New Mexico, the Central Rio Grande region, Bernalillo County, the city of Albuquerque, as well as neighborhoods, hamlets, enclaves, and villages, urban and rural areas, traditional communities, and newer communities. Come on, everybody, let's reclaim it and all our families and our futures. We can do this. Lives need to be saved. Children need to be spared from this scourge. Our communities need to heal, and we need to rebuild. Our provider networks need political and financial support, staffing, and time to address this addiction, person by person in our communities, wherever they serve. And we all know COVID got in the way. We're getting it out of the way, and we're going to move forward together. And we're going to support our providers because we need them. They're the ones that are boots on the ground, that are serving our communities. And I know for a fact, we can't, at Bernalillo County and at the city, we can't do it by ourselves. And that's why we need our providers to help serve our community. So it's really a team effort at all levels and in all areas that transcend income, where you live, what you drive, your political leanings or party affiliations, as well as any image you may have of to be invincible. None of us are invincible. Avoidance, and that's other people's problems. It's not other people's problems. It's our problem. It's our challenge. And again, we're taking it. People seem to think it's just a passing fad. It's been around forever. And I will tell you, our sheriff's department came and talked to me years ago when I was a deputy county manager, I think back in like 2008 or so, saying fentanyl is coming. We need to be aware of what we are going to be facing. And I appreciated that talk. I appreciated that heads up, but here we are. I will leave it to the other speakers to dive into the program for today, because we've got lots of people, very intelligent people that know what they're doing, that know what we're facing, that understand the challenges, and they're here with us today, and we're going to learn a lot from them. Lisa, can you come up, please? I know you don't want to, but sorry. I want to recognize Lisa Cedillo-White. So Lisa's our deputy, don't make me cry, our deputy county manager for Bernalillo County. With help from Bernalillo County Behavioral Health Initiative, the City of Albuquerque, the Metro Crime Initiative, Lisa catalyzed today's summit, and she exemplifies the strength, the courage, the tenacity that we all need as individuals and organizations to combat fentanyl. And I will never forget the day she came and talked to me, and she says, Julie, we need to do this. And I went to our commission, and thank you for our leadership, because we can't do it without the support from them. The answer was yes, absolutely. And she hasn't stopped since then. It's been months. So I want to give a round of applause to Lisa. I wanted you to know who she is. And I want to just thank each one of you for being here, particularly the community resource providers in attendance and those who have had the courage to share their personal stories and experiences with us. You're going to hear some hard but really beautiful, heart-wrenching stories. And I truly hope meaningful connections can be made and we can all help each other. At the risk of leaving anyone out, I want to thank every single one of you for being here, for saying yes, for saying you want to get involved and saying that you want to make a difference and that you care. That means everything. That means everything to all of us. And also, I want to thank the people around our beautiful state, in our city, and in our community who gave their time, who are going to give their time, expertise, and talent to make this a success today. You all are in for an incredible learning experience today. And again, I just want to thank you again for being here and for being part of the solution. So enjoy the day, embrace it, and let's stick together and somebody told me this, we've got this. Ryan White, we've got this. We're going to do it. Thank you.
Julie, thank you very much. You know, I guess I should have introduced myself at the top. Everybody's going, who is that guy? My name is Tom Thorpe. I'm the Communications Coordinator of Bernalillo County. So if you need anything from the county, you can always call me, and we will find you the appropriate person to answer your question. Okay. Now, none of this, and Julie mentioned it, I think you'll find a lot of people, a lot of commonalities in the room. We have it as well. None of this happens without partnerships. We partner very closely with the city on many activities, and that's very important because we're actually all one community. We all work together, and we all work for you. And we're very fortunate in that endeavor to have the city that works with us on many, many projects. I'd like to introduce for you and come up to say a few words right now is Bob White. You probably remember, many of you, he was a city attorney for many years. Now he's the Associate Chief Administrative Officer. Bob.
Can you hear me? On behalf of Mayor Keller and the City of Albuquerque, welcome and thank you for being part of this event. This is a moment of urgency, and I know there is a deep commitment in this room to meet this moment and work towards solutions for New Mexico and our community. Our theme today, Keep New Mexico Alive, is a reflection of the stakes that we face. Today we are going to learn from experts how fentanyl is devastating lives, livelihoods, and the fabric of our communities. Yet there remains hope. Just this morning, the CDC has shared that in some areas, overdose rates are declining. And that shows that efforts like this can make change possible. And that's important. Despite this enormous challenge, we can make a difference when we work together, which is exactly what we're going to do here today. Today we are going to share knowledge and education to equip ourselves with the tools to fight this terrible drug and provide aid to our neighbors and families in need of help. The city is very proud to partner with Bernalillo County and all the partners represented here today. We know that this fight can be won by working together. Growing partnerships will be the key to getting the resources the community needs and creating lasting change. The city and our partners are also in the middle of the second Metro Crime Initiative, convening the key players in New Mexico's criminal justice system to take responsibility and support each other to fix the gaps in the criminal justice system. There are many important overlaps between MCI and our work here today. Damon Martinez, APD's Chief Policy Advisor, will speak later about this today. We are at a capacity with 700 attendees this morning and many more watching online. This group exemplifies that we have the will, the resources to make our community safe from fentanyl and to save the lives of New Mexico families and neighbors. And to show that Albuquerque and New Mexico are not a place that is safe for criminals. We are a city that will act to bring justice to those who are pushing this deadly narcotic, and we will act together to get treatment for those who are in need. Thank you very much and have a great day working on this issue.
Thank you very much. You know, when we started talking about this summit, I'll be honest with you, there was a concern from the community. You're trying to criminalize this. And that's not it. Yes, there is a criminal element. We know that. He spoke about that. But there's the recovery side and there's the help side. And that's very, very much a part of this community. We cannot deny that, and we must encourage that, and we do. And part of that encouragement comes from the people who kind of have dual roles, and we have someone here. The people who work as the healthcare providers and the peer support, but also serve in government. And we have such a person here, the chair of the Bernalillo County Commission, Adrienne Balboa.
bienvenidos. I want to ask everybody to maybe pick up your shoulders next to your ears and then let them drop. Take a deep breath. I see so many important, all of you important faces in the room spending your whole day here with us. Because why? Because it's important and because we need to be here if we want to be able to do something about this, right? I want to take a second to honor our ancestors, honor our family members who lived through this, who are holding it every day in their families, all our care providers who stay up late at night when they're supposed to be resting because the care that they have for the clients and patients that they work with doesn't end at 5. And honor all of us that have lost somebody to this disease of addiction, directly to fentanyl, or to any of the plagues of disease of addiction that are in our communities. Deep breath. Now, we can't always just be in sadness. We have to find some joy. We have to share some love. And hopefully we'll get a little bit of everything today, a little bit of information, a lot of information, a lot of resources, and a lot of connections that can make a true movement to change and make the difference for our communities happen. I'm Adrienne Balboa. I'm currently serve as the County Commissioner for District 3, which includes the home that I grew up in my whole life and still live in Southeast Albuquerque. My mom, a loving nurturer, factory worker all her life. My father, a welder, a union steward, a hunter. He had 3 daughters. I was the youngest, the baby brat. He taught us how to change a tire, how to fix the air conditioner and change out the heater for the season. We spent all the time outdoors. Every Saturday during the summer, we had to go out and, with a butter knife, pick the dandelions by the root in our grass in the front yard that he cultivated for us. He cared about his family, and since he didn't have any sons, he taught all his daughters all the things that he would. I hunted with my father. I went camping every single weekend in the summer. But he was also, in his life, a heroin user. Started here in 5 Points at 15 years old. Then later, he became an alcoholic. And he lived in that. He died at the short age of 54 when I was only 19 years old. So I've shared this story a lot, and I've learned when I share this story to always start with the beautiful things about my father. Because I know once I say that he was a substance user, that's all that people hear, right? And then they have a vision of my father and of me and my life, right? And what that might have meant. But I can tell you I lived a beautiful life. And I shouldn't even have to say that, right? Because that's not what we're here to talk about. What we're here to talk about is this disease that plagues our families. I start with him because this is disease to drug and alcohol, and we see it change every day. The game continues to change. A new drug, a new mixture, a new cocktail. One pill can kill. We're going to hear about lots today. But I always also say that if you were born and raised here in Albuquerque, New Mexico, here in Bernalillo County, you love, not just know, not just care about, you love somebody that has suffered through the disease of addiction. And so part of what we're here today is to break through those silos, break through that isolation, take away the shame and stigma, so we could just all live here in the resources and the place we need to be, where we're connecting. We're not shamed by what our family member may have been or what you might think or judge us on, or our family members on. But we're here to say we're going to grow a future together. We're here to break through all that isolation and grow a future together that, like Lisa Cedillo White and the team came up with, that is going to keep NM alive, keep New Mexico alive. So I'm forever grateful for the vision and the people that brought this together. I'm so thankful for you all spending your time here today with us. Let's build this together, and I'm here for you as your county commissioner to do whatever I can. So thank you, and I want to learn from you, and I want to build this together. Thank you for being here today.
Thank you, Chair Balboa. A lot of the legislators, we asked some to attend, but they're all, of course, very busy. They have jobs just like the rest of us, right? And hopefully they're addressing issues just like this one. Congresswoman Stansbury sent a representative for us to listen to. She'd like to give us a message. Ebony Beatty.
Good morning, everyone. My name is Ebony Beatty, and I serve as a field representative for Congresswoman Melanie Stansbury. Congresswoman Stansbury extends her sincere regrets that she was unable to join you all for today's event in person, but has sent over a brief statement that I would like to now read on her behalf. Our communities are facing an interconnected behavioral health, opioid, and public safety crisis. Every day, our communities, our governments, our tribes and pueblos, and law enforcement are working together to stem the flow of drugs into our communities. Every community across New Mexico has been touched by addiction. And as someone who has lost a loved one to the fentanyl crisis, this fight is personal to me. We need to provide comprehensive resources for healing and addiction recovery. But the system is broken, and we need action now. This year, I was proud to secure over $18 million in funding for critical community projects that invest in the safety, well-being, and needs of our communities, including over $400,000 to get fentanyl off our streets and keep our communities safe. In June, I was also proud to vote to pass the Restoring Hope for Mental Health and Well-Being Act out of the House of Representatives, to strengthen over 30 programs to help address mental and behavioral health care, help our health providers treat opioid addiction, and expand recovery and support services. Statewide, only 12% of New Mexicans have access to behavioral health services. While rates of substance abuse and behavioral health needs have soared, we must address public safety, behavioral health, and addiction recovery in New Mexico with wraparound services and investments that holistically address the needs of our communities. I am so grateful for all of you here who have continued to work to support our communities and tackle the fentanyl crisis head on. In Congress, I will continue to work alongside our community leaders to deliver the resources New Mexicans need to get fentanyl off our streets, keep our communities safe, support our healthcare providers treating opioid addiction, and expand recovery and support services for New Mexicans. Thank you.
Hello, United States Senator Bernalillo here. I'm very grateful to have an opportunity to join you virtually for this important conversation on the misuse of fentanyl and the treatment of opioid use disorder, and give you an update on what we've been working on here in our nation's capital. As most of you know, addiction can impact anyone at any time. For some, it can simply start by getting injured and taking prescribed medication to alleviate pain. The sad truth is that many of us know someone who has been impacted by substance use disorder, some of whom have died from an overdose. It's unacceptable. Substance use disorder is a disease, like high blood pressure or diabetes. But unlike others, those with substance use disorder tend to endure stigma or blame. Now, faulting those with substance use disorder can deny them care, support, treatment. They need to recover and live their life to their full potential, and we all have a responsibility to help with that, which is why it's on all of us to educate each other on the devastating consequences that the misuse of fentanyl and other illegal drugs can have on one's own life and the lives of our loved ones. In order to better serve those suffering from this devastating use disorder, we need to approach addressing this crisis from a place of healing and treatment. Studies have shown that incarceration, as opposed to treatment, not only does not fix the problem, it exacerbates the disease, making everything worse. Focusing on behavioral health resources for prevention and increasing access to substance use disorder treatment and recovery resources across New Mexico and our country will better serve those suffering from substance use disorder and their entire communities. Here in Washington, I'm working with my colleagues to make overdose reversal drugs like naloxone or Narcan an over-the-counter medication so that anyone can get it without a prescription. Narcan is a life-saving drug that can reverse the effects of overdosing, and having it available to everyone is just the right thing to do. I'm also fighting for dedicated funding for recovery services. Far too often, those that suffer from opioid use disorder take great strides in treatment, only to find themselves struggling when they leave. Recovery services meet people where they are and help them improve their health and wellness to live self-directed lives. That is why I'm pushing for funding so that those that need it can access these critical services. I can assure you all that keeping Bernalillo families and New Mexican families safe is a top priority of mine, everyone working my office, and I'm sure every one of you in this room. I look forward to our continued partnership and working with everyone here to put an end to the fentanyl crisis in America once and for all. Thank you.
As we hear and as we found out, the support is there. Now it's about the knowledge and getting it out there. So let's begin this program. We're going to start with our keynote address. A gentleman who's come up from El Paso, Texas. If you didn't know, New Mexico is part of the El Paso sector of the DEA. That's where the help comes from there. Carlos Briano is the Public Information Officer and Community Outreach with DEA. He's been a teacher. He's been in the classroom, so he knows what kids are going through. He's heard it. He's seen it. Carlos Briano from the DEA.
Good morning. Thank you for inviting us. Thank you for the Assistant Special Agent in charge of the Albuquerque office for being here, and some people from DEA headquarters for being here as well. As Tom said, we cover the entire state of New Mexico, and from El Paso all the way to Midland, Odessa. That's the El Paso Division sector. And so DEA is here today to talk about the overdose poisoning epidemic. It's one of the greatest threats to our safety, to our health, and to the well-being of every single community in New Mexico, across the entire U.S. DEA is doing their part, everything we can to keep dangerous, deadly, illicit drugs out of our community, but we need your help. We need you to learn about the dangers of today's illicit drugs. As we will discuss in this presentation, some of these illicit drugs are so lethal that experimenting with them just one time can be deadly. Every day we see news headlines from communities across this country of those lost to an illicit substance, primarily synthetic opioids like fentanyl, made by drug cartels. Each of these headlines up here represents a human life lost. A mother, a father, a sister, a brother, an aunt, an uncle. In the past year, more than 107,000 people died from a poisoning. That's about 293 people lost every day. That's about 2 times what's in this room right now. According to the CDC, the majority of these deaths are from synthetic opioids like fentanyl. and the rest are from psychostimulants, primarily methamphetamine. In the El Paso division, as I said, is El Paso to Midland, Odessa, the entire state of New Mexico. In 2021, we seized more illicit fentanyl than the previous 5 years combined. This is approximately 2 milligrams of illicit fentanyl. It's considered to be the lethal dose. Some of you know fentanyl is 50 times more potent than heroin and 100 times more potent than morphine. The fentanyl driving this epidemic isn't just sold in fake prescription pills. Dealers are mixing it with other illicit drugs like cocaine, heroin, meth to make their product go further, to increase their products, and to drive addiction. In September of 2021, DEA took the very unusual step of issuing a public safety alert to warn the American public about the alarming increase in the lethality and the availability of fake prescription pills containing illicit fentanyl and illicit methamphetamine. DEA does not issue these public safeties very often. As a matter of fact, prior to this alert, the last one we issued was over 6 years ago, and it was a call to attention to the dangers associated with this new illicit fentanyl, as you mentioned, when it first started coming out. Locally, we issued a local alert in El Paso during Memorial Day, when 11 people were rushed to hospitals in a period of 36 hours. Some of the most common fake pills are made to look like prescription opioids like Oxycontin, Vicodin, Xanax, or stimulants like Adderall. These fake prescription pills are widely accessible and often sold on social media and e-commerce platforms, making them available to anyone with a smartphone. Let me ask you, which of these pills do you think is the real one? Can you tell? Well, let's find out. How about this picture? One is a real Xanax made by a pharmaceutical company, and one is made by a drug cartel, primarily Sinaloa or Cartel Jalisco Nueva Generación, known as CJNG. The fact of the matter, ladies and gentlemen, is fake pills appear nearly identical to legitimate prescription medications. So how do we tell them apart? DEA's stance is that the only safe pill to consume is one that was prescribed by a licensed physician or dentist, filled by a registered pharmacy, it has your name on it, and you take it as prescribed. Outside of that, it's not safe. Even if it's a pill your friend gives you for your headache or your pain, there's no way to tell whether it contains a legitimate medication or illicit fentanyl made by a cartel, or methamphetamine made by a cartel. Even if someone tells you it's Oxycontin, Vicodin, or Adderall, you can't take that chance. Assume it's fake. These drug traffickers, I'll mention them again, Sinaloa Cartel and CJNG, are preying on our dependence on pills and will market these products as legitimate medications when it's actually not a medication and contains no active ingredient in the medication or the fake pill. So we know medical grade fentanyl is made in a clean, controlled laboratory like this one. Very strict regulations, DEA regulates those. It's typically administered in micrograms in hospitals, nursing homes, under strict medical supervision. But I'm not talking about this type of fentanyl. I'm talking about illicit fentanyl made by Sinaloa Cartel, CJNG, in clandestine labs like this one. They're in jungles, deserts, warehouses, garages, apartments, Airbnbs. There's obviously no quality control in these clandestine operations. There's no telling how much illicit fentanyl will end up in one pill, or how much illicit fentanyl will end up in a supply of cocaine, of heroin, of methamphetamine. There's no regard in these labs for human life. If their poison kills another 107,000 Americans, that's just the cost of doing business. Drug dealers and those seeking these pills are using a whole new language to DEA and its law enforcement partners are seizing these deadly fake pills at record rates. In 2021, DEA as a whole seized more than 20 million fake pills, which is more than was seized in 2019 and 2020 combined. The number of DEA fake pills with fentanyl has jumped nearly 430% since 2019, which is a staggering increase. Fake pills have been seized by DEA in every state, in every city, and every community. If you don't think they're in your community, you're mistaken. A lot of people don't know that DEA has laboratories across the U.S. We have scientists, forensic chemists, pharmacists, pharmacologists that work in these laboratories, and they analyze the drugs that we seize. Of all the pills that we seized, DEA laboratory testing indicates that 42%, or roughly 4 out of every 10 pills tested, contains more than 2 milligrams, the potentially lethal dose of fentanyl. Remember, there are no regulation in these clandestine labs by Sinaloa or CJNG. It's literally being added to just binding materials using precursor chemicals. It's being mixed up in barrels with 2x4s, in mason jars, and pressed into pills. There's no telling if a pill contains trace amounts, no fentanyl at all, or a lethal dose, or sometimes twice the lethal dose. As we discussed earlier, 2 milligrams is considered a potentially lethal dose. But today, the average dose in the pills that we seize that are tested in our labs is 2.2 milligrams, which is over the lethal dose. This is up from 1.3 milligrams in 2017. The cartel, Sinaloa and CJNG, are selling these pills on social media sites, popular with students and young adults who like to share their stories and their pictures. But they've also become popular platforms for Sinaloa and CJNG, who use these sites to sell their illicit products. Drug dealers and those seeking those pills are using a whole language, different acronyms, texting, emojis on smartphones. These are probably outdated. I was a high school teacher. The moment I knew what my kids were doing, it changed. So these are probably outdated. But you get how they're communicating. You need to be aware of suspicious text messaging, social media messaging, Cash App posts. Those should spark an important, potentially life-saving conversation with your loved ones. You need to know that DEA works with social media and internet companies to provide them information on how they can understand how drug traffickers are operating in their space, but we can't rely on that. We have to start conversations about the dangers of these platforms with our loved ones, especially the young ones.
We are back with a tragedy for a California family that's shining a light on something that many parents may not know about, but definitely should.
Yeah, it turns out young people are able to find drugs on popular social media sites, including Snapchat. NBC's senior national correspondent Kate Snow is here with a really tragic story of that very thing happening. Kate, good morning.
Yeah, good morning, Savannah. This is a nightmare for parents. Dr. Laura Berman is well known for her expertise on love and relationships. She was a frequent guest here on Today. But on Sunday, she and her husband lost their 16-year-old son, and they're speaking out because they want every parent and every child to know the danger of buying pills on Snapchat.
It's a lethal combination, teens and 20-somethings stuck at home during the pandemic and drug dealers using Snapchat to push a deadly product.
I didn't intend for us to be on the news. I just felt helpless. All I was thinking about is that this couldn't happen again. And I was so furious and helpless.
For years, Dr. Laura Berman has offered advice on matters of the heart. On Instagram Monday, it was her own heart breaking. My beautiful boy is gone, 16 years old, sheltering at home. A drug dealer connected with him on Snapchat and gave him fentanyl-laced Xanax, and he overdosed in his room.
He asked his dad for a cheeseburger, and an hour later, I went into his room because we've been talking about an internship for the summer that he wanted to do, and he was on the floor and gone.
I'm so sorry. Sammy was a football player, a junior who was into business and just built a biosphere in his bedroom.
He was always doing little projects and full of intellectual curiosity and excitement for the future.
But Laura and her husband Sam also say Sammy was cooped up during the pandemic and bored. They say he wanted to experiment and found a menu of drugs for sale on Snapchat.
This big, colorful menu came up with some man with a Twitter handle who was promising to bring it by your house. Each different drug had a different color, the way a kid would love to see it. And Snapchat is for the kids.
Do you think your son knew he was ordering fentanyl?
No way.
No.
The DEA says people are ordering pills by common names like Xanax, but they're actually made of fentanyl, often manufactured in Mexico. Ed Ternan and his wife Mary have been keeping a tally of the fentanyl deaths they hear about tied to Snapchat, 20, including their son, Charlie. He died 3 weeks before college graduation last May.
They just are greedy and they want to make a profit and they don't care that our kids are dying all the time.
I'm sorry.
And it's just, every day is so hard. I just miss him so much.
They founded the nonprofit Song for Charlie to warn others.
Snapchat's not the only platform where these kinds of pills and other drugs are sold, but it is certainly the most popular platform among retail drug dealers.
So you think they're targeting young people?
Absolutely.
I think that if social media wants to pretend to be responsible, this is a great place for them to change their behavior. The big tech is not taking responsibility for helping the police find the dealer.
Snapchat expressed its deepest sympathies and said in part, "We are committed to working together with law enforcement in all instances where Snapchat is used for illegal purposes. We are constantly improving our technological capabilities to detect drug-related activity."
But when they see our son and can relate to him and see what happened to him, maybe it will sink in. And if it helps one kid, it's worth it.
Laura and Sam say that is the only reason they agreed to speak with us at such a terrible time. Ed and Mary are actively involved with many families who've lost children, and they say they want to work with Snapchat. They think they could help Snapchat better understand what's happening out there and make changes to make it harder for illegal drugs to be advertised there. Guys.
Kid, it's just such a heartbreaking story on so many levels. Any tips for parents who are watching or listening? Any tips to look out for?
And it's hard as a parent of teenagers. I can tell you the biggest tip is to talk with your kids. I did it yesterday about the danger of fentanyl and how it's often packaged or sold as something else. Laura and Sam also wish that they had known more about what Sammy was doing on Snapchat. Like a lot of parents, they didn't even know the passcode for his phone, so they're now waiting for Apple to help unlock it. But they told me that can't even happen until there's a death certificate. It's just so heartbreaking on so many levels, guys.
Last year, DEA launched the One Pill Can Kill awareness campaign. Please help us spread the word. Help us share the dangers associated with these illicit fake pills. Connect people with information and resources related to these fake pills, to illicit fentanyl, to illicit methamphetamine, in an effort to drive down these deaths. Partner with local, state, federal law enforcement, partner with prevention, partner with public health organizations. Help us elevate awareness of these dangerous and potentially deadly fake pills. 5 takeaways I'd like for you to take from this. 1, we need you to encourage people to only use medications that are prescribed to them by a licensed medical provider and dispensed by a trusted pharmacy. 2, protect your medications from being diverted. Secure your prescription medications, especially the powerful opioids, Clean out your medicine cabinet at least twice a year. 3, one pill can kill. Don't take this warning lightly. It only takes one fake pill with a lethal dose of illicit fentanyl to kill. 4, remember, cartels, Sinaloa, CJNG are preying on the opioid epidemic and prescription drug misuse to flood our country with mass quantities of these fake prescription pills made with illicit fentanyl. And last, please know that the men and women of DEA are going to continue its mission to target these most dangerous cartels who are causing harm in our neighborhoods and communities. We're also dedicated to reducing drug-related violence. But the best way to affect supply is to reduce the demand. One of the best ways to reduce demand is through education and awareness. If you scan this QR code, it's going to take you right to DEA's online resources. We encourage you to help us start and continue this important conversation. It's never too early to talk to all your loved ones about the dangers of taking a pill that was not prescribed by a doctor and dispensed by a pharmacist. It really does only take one pill, one time, to end a beautiful, beautiful life. Thank you. If you would like this presentation to one of your groups, there's my email right there.
Carlos, thank you very much. Wow. One thing, if this summit saved one life, we're successful, right? All it takes is one. Start the conversation now. That's what this is about. Before we go too far, a couple things. I mentioned the people who come and support us. I'd like to recognize New Mexico Representative Art de la Cruz has come to join us today. Hopefully he takes this to Santa Fe. We can be the example in this country. New Mexico can lead the way, correct? All right, for those of you, quickly before we break, if you've scanned for your food voucher, you say, hey, I'm not getting anything on my phone, that's okay. Take your submittal out to the front. There's a food voucher table, and they will give you the voucher for outside for the food trucks that are going to be outside. All right, we are going to take a quick about 5-minute break. Like I said, bathrooms outside, a little health break for you while we set up for our first panel.
Okay. Yeah. And yeah, you can put that anywhere on your belt or just as long as it's not next to a cell phone. Yep.
2. Check 1, 2. Check 1, check 2.
Panel 1 members, if we could get you up front and take your seat, please.
Hey, Tom, is no one sitting here then? No. Okay. No, that's nice. I'll be able to set stuff here then. Otherwise, I'll get loose. Hey, good morning. How's it going? I know, it's been what? Feels like 5 years. Yeah.
Check 1, 2.
All right. So I think we want to begin again, try to get us back on schedule here. Before we start, just one thing I do want to recognize. Jeremy Romero, Public Safety Advisor to the Governor, is with us today. Jeremy, thank you for joining us today. Okay, our first panel, frontline panelists. This is the public safety. These are the men and women on the streets. They're the people who see what's going on firsthand. All right? To lead us through this, you've probably seen him on TV. Dean Staley from Channel 13 is going to moderate this panel for us. Dean, have at it.
All right. Good morning. Can you hear me all right? We doing okay? Wow, there's some enthusiasm here. I like that. We've got it pumped up. A big thank you to everyone here. I'm really pleased to see the turnout. We've got some empty seats now. I know people are going to be filling back in here. A lot of people still taking a break. So I want to thank everyone for being here and showing interest in helping us solve this problem in our community. Bernalillo County and the City of Albuquerque with this massive coming together and all of the other partners to put this event together. So we're pleased to have you, and we're pleased to have our esteemed panel. I'd like to introduce the folks we're going to be talking to this morning. First of all, if you would, maybe just raise your hand or stand up so people can see who you are, get a sense of who's up on the panel. First of all, Dr. Danielle Duhigg, who's a member of Bernalillo County's Addiction Treatment Advisory Board. Dr. Duhigg is also the medical director for the Duke City Recovery Toolbox. Doctor, thanks for being here. Also, Dr. Brandon Warwick from the University of New Mexico. He's a board certified in medical toxicology, addiction medicine, as well as emergency medicine. We're glad to have you. Thanks for being here. We also have with us this morning Captain David Funes from the Bernalillo County Sheriff's Office, who served with the county for 19 years, one of the people who's been part of being on the front line of this battle against fentanyl addiction. Captain. Kyle Hartsock is the Deputy Commander for the Albuquerque Police Department. You probably recognize him. He spent a fair amount of time lately on television talking about different things in our city. Commander Hartsock has worked in criminal investigation since 2009, including time before at the Bernalillo County Sheriff's Office. So, Commander, thanks for being here. We also have with the Bernalillo County Fire Department Captain David Lujan, who oversees the EMS division, and that includes the oversight of 265 field personnel. Captain, thanks for being here. With Albuquerque Fire Rescue, we have the Deputy Chief of Emergency Services, Emily Jaramillo. We also have with us this morning Dr. Heather Jarrell, the Chief Medical Officer for the Office of the Medical Investigator. We have an addiction specialist, Dr. Sylvie Stacy, with the Metro Detention Center as well this morning. Also this morning, Kylie Scherder, the Director of Prevention and Intervention Counseling at Albuquerque Public Schools. A big job. Yeah. So as we get started, I'd just like informationally to share with you where our questions have come from. We, in large part, came up with the questions this morning from the public. We also have questions that came from our panelists this morning because they felt there was something specific that they wanted to talk about and share with you this morning. And our panelists, in some cases, also shared questions that they routinely answer about fentanyl in our community. So they sort of raised their hand and said, we should talk about this because it seems like a lot of people are asking that. So some of the questions may seem simple, but we really are going to try to drill down and get to the bottom of a lot of things. There's a lot of, I think, ignorance about this problem in our community. So forgive us if some of these questions seem overly simple. There's a wide variety of them. So I want to start with Dr. Danielle Duhigg. Dr. Duhigg, first of all, if you could just talk to us about the mechanism of fentanyl and how it affects the body. Why it's so much more powerful than some of the other opioids that we've talked about. And also the question that was put in front of me, is addiction in fact really a medical illness? Please.
Thank you, Dean, and thank you everybody for coming here. Such an important community event. So fentanyl was really designed as a stronger opioid, right? Opioids are a class that contain lots of different things that we're familiar with. Heroin, oxycodone, morphine, right? There are a large variety of these. And really, to the brain, they're all pretty similar. They differ in how strong they are and how long they last. And for a long time in medicine, fentanyl was a really helpful tool because it was strong, but didn't last too long. So we could use it for surgeries. We still do. We use it to treat people after serious injuries. The problem, of course, with anything that's this strong is when you have unregulated use, right? When we have versions of it that aren't made by real pharmaceutical companies that flood our communities. It's stronger than heroin, it's stronger than morphine, and part of the problem also is that, you know, when real pharmaceutical companies make medicines, they have quality control. They know how much medicine is in each tablet or each strip, and that's not the case here. And so while we can see that there's variation in how much fentanyl is in any pill, when somebody's using it out kind of on the street, they don't know that. As opposed to when I get a medicine from a pharmacy, I know exactly what's in it. How do they work? We have these receptors throughout our brain that we call opioid receptors. It's just the name that we give to them. And they're totally important. They're where our endorphins work. They are part of the mechanism in our brain that drives its ability to take another breath, what we call the respiratory drive. And they're also involved with pain. This is why opioids can be used as medicines, but this is why they have the risks that they have, why they make our brain essentially forget to breathe, which is how I describe it to folks. And unfortunately, our body gets used to them. And it gets so used to these medicines or these drugs, if we take them every day or very frequently, that we have withdrawal, which many people have experienced or seen loved ones experience, right? When we're taking something like fentanyl day after day after day, it actually suppresses our adrenaline levels. And then when we run out, we get this huge wave of adrenaline. And that makes us anxious, that makes our heart rate go up, it makes us sweat. And then our pain levels now are out of control. And this is why people feel so sick. And it feels like it's an emergency. People will feel like they're going to die when they're going through opioid withdrawal. The good news is, most of them aren't. It's not dangerous in that sense, opioid withdrawal. What's dangerous is feeling so, such a sense of, I need to do something now, right? Feeling so desperate that then people maybe make decisions that put them at further risk. And I think for a long time, for your second part of your question, it's been, you know, the idea of addiction has kind of been outside of medicine. And I think for a lot of us, we see the choices that people make, and we say, well, it doesn't really seem like a disease, it seems like choices. But what we understand now is that there's a lot of genetics behind it. There's a lot of our DNA. It runs in families, not by accident, right? But because it's an illness, because it's in our genes, because it's biological, there's definitely choice. Just like in diabetes, we can be at risk for diabetes, and there are lots of choices about our diet and things. But there's choice and genetics. And we call that a disease. Addiction is absolutely a disease. If it wasn't, we wouldn't have doctors and other healthcare and frontline providers who are addressing it. It's a chronic disease. We have medicines for it, and we have other forms of non-medicine treatment. And because we get sometimes other medical problems associated with it, whether we've overdosed and it's hurt our brain because we weren't breathing, or from getting hepatitis C, or other things, there are other parts of it that we need to treat medically as well. So it's definitely a disease. It fits beautifully in the chronic disease model. And the good news from all of that is that we have treatment, and treatment works. Treatment absolutely works. It works if you work it.
On that topic, Doctor, is the treatment for fentanyl addiction different than for heroin or opioids, other opioids?
It's a great question. I would say that for the most part, it's not. Again, because to our brain, opioids are opioids. Our brain doesn't really know what they're called or what their chemical structure is. It responds. We have 3 medicines that are effective in treating opioid use disorder or an opioid addiction. Those are methadone, buprenorphine, which most of us know as Suboxone, and naltrexone. And these are the 3 medicines that work. Lots of science behind it. We know that when they're done the right way, they're safe, and they are effective. So we don't really treat it that differently. Sometimes we might think about ourselves differently. I use fentanyl, I don't use heroin, or I use oxycodone, I don't use fentanyl. But the treatment is pretty similar. How much withdrawal you go through and how hard it is to tolerate, that can be different. between the different substances. And that means that we maybe need to have a little bit more care and a little bit more patience and attention. But otherwise, the treatment really is the same. It's the good old treatments that we've been doing now since the late 1960s, and that we have a really good track record with, that we understand well, and that are safe and effective.
Doctor, on that point, is methadone as a treatment, some people talk about it just being a replacement, a sort of a new addiction. Is there a downside there?
So no, it really goes back to the whole definition of what is an addiction. And we have a medical definition. And I like to say that's when our relationship to a substance is getting in the way of our relationships, our safety, how we fulfill our roles or not. That's what an addiction is. So if I'm using fentanyl every day and I'm not fulfilling my roles and I'm not being safe and it's worsening my physical or my mental health, that's an addiction. If I get on a medicine like methadone or Suboxone or naltrexone and I'm taking those every day, and because they are controlling my addiction, I'm able to get a job and I'm earning back my family's trust and I'm safer and I'm getting my Hep C and my blood pressure taken care of, that's all upside. It's not replacing an addiction with an addiction. It is a similar type of medicine, but it goes back to that definition of addiction. Treatment is about being free from the problems that addiction treats or that addiction causes. And these medicines, when done correctly, absolutely help us find freedom.
Dr. Warwick, who among other things is a board-certified toxicologist, I have a question from the public, and that is, if someone doesn't use fentanyl or other drugs, should they worry about casual contact in public places like on a bus? Or, I mean, we've seen videos with officers exposed to fentanyl. Can you clear that up for us?
Yeah, thank you. This is an area where I've spent a lot of work on at the national level. And I'm just going to start my answer by going back to what Dr. Duhigg said. And fentanyl needs to get to the brain to cause you to become unresponsive, to make you stop breathing or for death. So while it gathers headlines saying, hey, this little tiny amount of fentanyl is enough to kill you, that small amount has to get into the brain. So me looking at fentanyl doesn't get into the brain. While there is some absorption that can happen through the skin, we've studied this going back to the early 1970s, and specifically Janssen Pharmaceutical, and we now have multiple companies that have a patch. What we know is that it takes hours, realistically a day or more, for that to be absorbed through the skin. Now, if you're injecting it through a vein, if you're smoking it, and like you would heroin or or snorting it like you are cocaine, that's getting into the body, that's getting into the brain. So the casual contact really that you get, the amount that you have to have, as I wrote in the position statement by the American College of Toxicology and American Academy of Toxicology, you have to essentially leave your hands, both of them, completely covered in a liquefied version of fentanyl that's been made to be able to absorb through the skin for hours, even to get to a therapeutic drug level, and that's just not realistic. And so in that, the position statement that I and my other colleagues wrote really became a foundation that would be later released by the White House involving more than a dozen medical and law enforcement organizations. I've also been a consultant for the Canadian government, setting a lot of their policy guidelines for how the Royal Canadian Mounted Police do this. And with that also comes access to knowing cases where somebody has gotten ill. There have been several that hit the TV, of people claiming an illness, but the illness they were not experiencing is not opioid related. I've also gone through scientifically looking for cases, published, unpublished cases, and presented them this fall, and I have identified 0 cases to date of an opioid directly causing illness. Who's become a friend, National Drug Coordinator of Royal Canadian Mounted Police, describes it as if bad guys ever had kryptonite for cops, they found it in fentanyl. So with that, one other thing is if you were to come in casual contact with it, it would be wash your hands. We've all got hand sanitizer up here. And remember, hand sanitizer is good for COVID. It's good for bacteria, virus, but it doesn't destroy, it doesn't neutralize, it doesn't kill fentanyl. So just soap and water is how I would get it off my hands.
Before we move on, and this may sound elementary, but I'd like to ask you, how exactly do people use fentanyl? How do they get it into their bodies typically?
Great question. So I think the most common right now that we see is depends on the form that it's coming in. And in Albuquerque, we're seeing it come in the counterfeit pills, and we're seeing it primarily in our heroin supply. And so people beginning usually will get the pills and they'll ingest it just like any other pill. And I think that because we're so used to taking an acetaminophen, an ibuprofen, an aspirin for a headache, or an antibiotic from the doctor for a pneumonia, is kind of having that pill feels almost safe. So to people, so they're willing to, and we're kind of accustomed to doing it, and there's that feeling of safety. When what happens in the body is not all the fentanyl is absorbed or goes to the brain, we'll put it, that's an easier way to describe it. Medically, we say bioavailable. As they need to get a little bit more, their friend comes along and says, hey, you know what, if you crush and you snort this, or you smoke this, it goes to the lungs, gets absorbed fairly rapidly, goes to the brain rapidly, and that is oftentimes what gives you that euphoric effect. And we're able to get more of the drug to the brain, and so they start making that switch. And then after a period of time comes along, they're like, man, I'm out of money, I'm working really hard, my family doesn't want to do this, and then their friend, and in Mexico, and in the country, family members too, comes along and says, hey, you know, if you inject this, the drug goes even further than it does in the lungs, and they make the conversion to injecting. So those are kind of the ways that we have that people are abusing or misusing it. But I've never had a case, and if anybody else has, I would love to know about it, where somebody is actually abusing, misusing fentanyl by just putting the powder on their skin. I have had the fentanyl patches where they cut it up and they'll suck on it and things like that, but I've never seen anybody or heard of anybody putting just the white powder on their skin, because it just doesn't get absorbed fast enough.
Doctor, thank you. This question for Captain David Funes. Captain, a longtime lawman with Bernalillo County. When an emergency call goes out for an overdose, does law enforcement automatically respond to that, and if so, why?
Yes, sir. Law enforcement does respond to all overdoses, and the purpose for that is for scene security. A lot of the times when there is an overdose, it is the family or friends of the person who was overdosed that is making the call. And when we arrive on scene, sometimes those family or friends are frantic, of course, and they don't want to leave the side of the patient. We respond to ensure that the scene is safe and secure and provide an area where rescue or emergency medical personnel could render aid. We're not necessarily there to take law enforcement action, and there is laws, Good Samaritan laws, that protect both the caller and the person who has overdosed from being arrested for possession of drugs.
Captain, thank you. And let me just take a moment to ask all of our panelists, if you feel like there's something more you'd like to add to any of these answers, please do. I would love for this to be more of a discussion than an interrogation, so feel free. Captain, I have another question for you. Officers are often the very first people to show up in the case of an overdose. Are all of your deputies trained in aiding overdose victims?
Yes, sir. Primary mission of the Sheriff's Office is to preserve life, and part of that is getting trained on basic first aid, and all deputies are also trained in and equipped with intranasal naloxone for opioid overdose, and they're trained to administer this naloxone until rescue could show up on scene and actually take over their treatment.
All right, Captain, thank you. Commander Hartsock, where does fentanyl rank with other drugs in terms of use and prevalence in the metro?
You know, what our officers and our detectives see is why we can't always say overall what percentage of the drug use market is fentanyl. We could definitely say its popularity is on the rise, much more aggressive than any other drug in Albuquerque. And we attribute that to a few things. One is this drug, and the doctors and the DEA spoke about it as well perfectly. It's not like our other drugs. The barrier to use this drug just by appearance alone is so much lower, so much easier. It's not heroin burnt in a spoon, loaded into a syringe, injected into our arm, which for a lot of people can cause just a psychological barrier where I'm just not going to do that, I'm not going to try that. These counterfeit pills look pharmaceutically manufactured. In a lot of cases they are, and they're as easy to take as an Advil. You might even think it's an Advil. I can recall even a time on an operation I was doing, I was pretending to be a drug user buying fentanyl online, and we did buy the fentanyl, and later on the drug dealer actually, it was a girl, she checked in on me to see how I liked the drug. And I told her earlier, this was in 2018, yeah, I just took it with like a shot. And she actually she was really concerned. She tried to call me on Snapchat, and I was like, nope, not answering your call. She was worried I took this pill the wrong way, that it was way more powerful than I thought it was, and that I was more loosely just popping this fentanyl pill and drinking alcohol. And she was actually concerned about what would happen and started asking me what my fentanyl history was. So it was a really enlightening experience that I wasn't used to seeing from drug dealers and this type of drug. So its appearance alone, I think, just makes it so much easier for people to maybe try and stay on because it can fit in with a prescription from Walgreens or CVS to the untrained eye.
Captain Lujan, who in our community, and I'm talking about demographically speaking, in your experience, who's using fentanyl?
Well, what we've found, obviously through our report writing and our statistical values, is we found that fentanyl, it doesn't discriminate against anybody. We're seeing it through different races. We're seeing it through different socioeconomic populations. When we look at our numbers, they can be a bit misleading for us. The only way we're able to evaluate these things is through our Narcan use. So it typically is, it's not necessarily specific to fentanyl. It's just opioids in general. So anytime that our crews go out and administer Narcan, we chalk that up as a potential fentanyl use. It could be heroin, it could be morphine. But we're seeing it across the board. We're seeing it, what we call our north region, which encompasses the North Albuquerque area, North Albuquerque Acres area. We're seeing it down in the south region, the South Valley. We're seeing it up in the East Mountains. So it crosses all boundaries at this point. We're not necessarily specific on, was it fentanyl, was it heroin? It's the way we document these things was Narcan administered. And just as Captain Funes indicated, sometimes our deputies arrive on scene and administer Narcan before we do. So we go in and make sure that we document that appropriately. Sometimes we're seeing the calling parties actually administer Narcan, and it's one of our goals is to try to document that in that capacity. So just know that it's not specific to a particular race. It's not specific to a socioeconomic population. It is across the board.
Captain Lujan, thank you. I'd like to ask your counterpart, your colleague at Albuquerque Fire Rescue, Deputy Chief Jaramillo, what fentanyl-related trends is AFR seeing in the metro?
Hi, thank you for that question. Just to reiterate what the captain said, we've seen similar trends. I did write some of our data down just because I think the numbers are pretty telling. And where we noticed this is about 6 months into the beginning of COVID. I had a conversation with our medical director, Dr. Kimberly Pruitt, about how we were so focused on COVID, and we were noticing increased calls for overdose and increased calls for death related to overdose, and that nobody was really talking about it back then because we were so preoccupied with COVID. So a lot of these numbers we pulled from the past year, and in the past calendar year, from October 21 to September of 2022, we responded to roughly 1,600 deaths. And of those, 942 were obvious. This is an increased rate in obvious deaths that we're seeing at Albuquerque Fire. A lot of this is anecdotal. We obviously don't always know why somebody dies, but we are seeing these increased obvious deaths. One of the alarming trends that we've noticed in the past, I would say 3 to 4 years, is that we have more people dying in that death rate age 59 and under. So of that roughly 1,600 deaths, we had 842 were 59 and under, and 753 were ages 60 and up. So with that age group being so young, and with the increased fentanyl in our community and our increased overdose rates, we're seeing higher death rates related to fentanyl. The other alarming trend that we've seen is related to pediatric exposure to fentanyl. And so in that same year of data that we ran, we gave Narcan 68 times to children under the age of 1. And 23 of our calls for the same age group under the age of 1, our providers on scene declared in their charting that that was an overdose. So, that's pretty alarming to us that young children are getting into their parents or their caregivers' fentanyl, and we're seeing that in our responses. To further break down the pediatric rates that we're seeing in our community, we gave out Narcan 730 times over that calendar year, which is higher than we've done in the past. But you also have to consider that we have Narcan more readily available than the public. So those rates are probably much higher than we're seeing in 911 because people are administering Narcan and not calling us. So we expect those rates to be much higher than what we have. But of those 730 administrations, 157 of the administrations were to youth ages 0 to 20. And so that breaks it down to 22% of the time that AFR administered Narcan last year or over the past 12 months, it's been to somebody under the age of 20. And so we really feel like not only is it alarming that we're seeing higher rates of death related to fentanyl in our community, but particularly the rates for pediatric.
Chief, thank you. Captain Lujan, can you speak to us about the difference between the increase in fentanyl overdoses versus heroin?
Yeah, so again, in our report writing system, we're actually building, because again, we're seeing this more often, we're building where if there's some indication that we know it's fentanyl, we actually have our crews go in and check that box versus heroin, just because we want to see what that discrepancy is. Basically, kind of reiterate what Chief Jaramillo was talking about. For our department, from basically January of 2022 to present, we've given Narcan 216 times. Understanding our demographics are slightly different because we serve the unincorporated area of Bernalillo County. So for us, that's actually fairly high. With that being said, I can't be specific on the numbers because of the way we have to redact that information, but we're just seeing a higher increase in fentanyl use with administration of Narcan. So at this point, with just kind of having the raw data, basically it's about a 20% increase in fentanyl use with the delivery of Narcan. So that's where Bernalillo County is seeing that.
Deputy Chief Jaramillo, what is AFR doing to manage, to react to the issues we're seeing related to fentanyl?
So aside from the obvious, we respond out if a call comes in through 911 for somebody that's overdosed. We've really embraced harm reduction as well. So we have a community paramedic team that was established by Mayor Keller the first year of his term. It's called the HEART team. And we have a harm reduction program within our community paramedic group of firefighters. And we've included several programs with that. One of them is that when somebody does overdose, we provide follow-up after the overdose with our community paramedics. That includes following up with the family and then also referral to a peer. We had 2 peers on our team that had lived experience recovering from addiction. We subsequently lost our 2 peers, but now we are able to refer our clients to work with peers within the ACS department in the city. Another harm reduction program that AFR has implemented over the past year is Leave Behind Narcan. So each of our field responder, each truck carries a Leave Behind Narcan kit. And when we respond out to an overdose, we are able to educate the family and friends that are there on scene with the individual that overdosed. We leave Narcan behind, we show them how to use it, and we provide materials that if the family member wants to seek out treatment options, we can help refer them to that. And so we're really looking at it from that harm reduction standpoint of we've responded out to you for an overdose, we want to help your family in the event that this happens again. And so that's something that we've had a lot of success with over the past year. And then another important piece of that is just collaborating with all of our partners that are up here, as well as a lot of the other departments that are represented here.
Chief Jaramillo, thoughts about how we can improve, what we can do better, what more we can do to battle fentanyl?
I think our biggest ask is just increased awareness, especially with youth and use among youth. And so the more that we educate our community into the dangers of it, the importance of Narcan, and just that will help, and just helping to destigmatize it as well. We see a lot of, when we respond out to a family where their child may have ingested fentanyl or some type of opiate, they're afraid to share that information with us. So they may say, they may call it in as a seizure for their child when it's really an overdose, and then we have to use the process of elimination to effectively treat that with Narcan. Because the first thing when you respond to a 1-year-old is not, I need to give this kid Narcan to get him breathing again. And so if the family can disclose that to us, we can treat them quicker. So the biggest thing that we would like to see is awareness and education for the community, and then also just increased access for treatment. This state and the city could use much more access for treatment.
Can I piggyback
Please.
on that? One of the main reasons to put on this summit was to increase the awareness that was just talked about. And I think all of us, we hear heroin and we think like, that's got risks, right? I think that there are a lot of families and a lot of parents and a lot of aunts and uncles out there who know to talk to young people about heroin, and maybe through the opioid epidemic have learned to talk to them about some pills. Part of what we really want to do is increase everybody's vocabulary about blues, right? These pills typically have a blue hue, so they're referred to as blues. I think we all need to be talking about blues. We all need to be talking to our kids. The question that came up about, how is it used? I wonder if we could put the image back up. We wanted to share, for example, with everybody images of things to look out for, right? Because again, if we see a syringe, we think maybe somebody was shooting up with this. But in your household or in your community, if you see foil that's crunched up, foil that has burn marks on it, like tinfoil, that has brown smudges or dark smudges on it, foil that smells bad, this should be as alarming to you as finding a syringe in your community or your household as well. This is really what we need people to be talking about, and especially to youngsters. Pills can't be trusted unless we know where they came from. And little things like foil mean much more than just foil. That's really what we need to, I think, talk about. And I think it's linked to kind of the same question about these trends, right? People tell me, I get the benefit of talking to the real experts every day, which are patients and people who are living with addictions. And a lot of them tell me that it's hard to find heroin these days. The marketplace is changing. All the heroin, or almost all of it, was coming from the Sinaloa cartel that we heard about earlier. They just changed their product. They switched it from heroin to fentanyl because they don't have to deal with growing seasons to grow heroin, right? They just make this stuff year-round and bring it up into our communities. So we will continue, I think, to see less and less heroin. The prescribers, we've tried to really take care of our part of overprescribing opiate pain pills, the legitimate pills. But now it's the fentanyl pills. So we all need to talk about blues, and we need to look for signs other than just syringes.
Doctor, thank you. Some great counsel there. Commander Hartsock, I'd like to ask you, staying in this vein, of this sort of the basics here, how are people in our community buying fentanyl?
I mean, the traditional way to buy drugs is still around, right? You know a guy who knows a guy, and you can just connect with him, right? But the days of just driving down kind of maybe a drug house street, pulling up to the front, knocking on the door, those are going away, right? That's really, really high risk. What you're seeing now, and I'll just show it up on my phone and you can zoom in, but here's what social media is going to show, is here's just a bag of the blue pills, right? And if you can't read it just yet, it says tap in, right? Tap in is meaning, hey, hit me up, get some of this, I got you. What you're also going to see is just, and you saw it on the DA presentation, but here is a literal menu of drugs. I'm at Coors and Paseo, I'm mobile, here's a list of everything I have, I can just come meet you. And instead of having to know a guy who knows a guy, now you can just get on social media and virtually any of the platforms, by the way, Facebook Messenger, Snapchat. This guy even says, I'm also on Instagram. I mean, he is marketing like it's an Etsy store selling crafts, but he is selling drugs, right? That you can get these things. And to point out what the doctor said too, what we also see vastly moving is the use of emojis to describe drugs. Does anyone know what this emoji is on every phone in this room? Whether you have an iPhone, an Android, Samsung, you have this in your list. Does anyone know what this, like why did Apple design this emoji? It's used for fentanyl drugs, but anyone know why they actually designed it?
Metro?
Yeah, it's the Metro. It's the train, right? The Metro is a common term to describe underground trains in certain urban areas. It's the Metro. But when we see it, we know this means this person is trying to sell or advertise the fact they have fentanyl pills. They do this with all the drugs. Cocaine as a snowman or a snowflake, right? Marijuana, although now mostly legal, was a tree, right? It was called trees. So we see entire advertising posts for anyone who has access to their cell phone to get virtually any drug they want. The barrier is really low. And we also see that feed into our violent crime trends as well.
Commander Hartsock, tell us, how is fentanyl linked to other crimes in the community? It's clearly part of creating other issues for us.
Absolutely. One of our biggest crime categories for our homicide rate, which has increased year over year for the past 3 years, is robberies. And it's not the robbery of the Allsup's clerk or the Walgreens, it is the robbery of a drug dealer or a gun dealer. Or it's the robbery in the reverse way. They're pretending to be the drug dealer and they want to rip off the guy who has the money to come. Because both parties know this is inherently illegal what we're doing, there's a low likelihood that police are going to get called or intervene in this. This is not a legitimate business to start with, which opens it up for people looking to take from others with violence. And we see a lot of these turn to everybody's armed. Everyone brings guns to these things. So our second biggest category for motivations and murders right now in the city of Albuquerque is drug deal robberies. The #1 drug of choice that we see in virtually all of these robberies is fentanyl by a large margin. Doesn't always associate with user, but I can tell you fentanyl pills, they call them boats if you got 1,000 pills. They say, I want a boat of fentanyl, right? And I don't mind sharing these terms with you guys. I think everybody should know these terms. So that means, hey, you're going to bring 1,000 pills. That's a lot of resale value I can get. There's also a certain amount of I took from you, right? It's respect, it's disrespect. So there's lots of these motives that come in, and these robberies can turn very deadly very fast. And a lot of families have lost their children to these types of robberies. And I want to point out APD's Victim Services Unit right here. Will you guys stand up real quick? These women, this team is just growing. They work inside our homicide unit and our CID. But I hope this is the only time you get to meet them. Because if you have to see them again, it's most likely that someone close in your life has been killed. That is who they work with day in and day out, and I'm proud that they're here to learn more about fentanyl. But we see it tied to many crimes. And I also want to comment, too, on the pharmaceutical versus this. You know, our country, I think we shouldn't ignore it, also went through a span of 10 to 15 years where prescription medication was overprescribed. Right? I think the DEA led the charge into a lot of that, and to pharmacies overprescribing legitimate pain medication. That yes, that might get curbed now, but it left a void. And I'm seeing the DEA nodding their head, which makes me feel good. I'm saying this unscripted. The void is getting filled. So I think that's important to acknowledge as well.
Commander, I want to just go back at this for a moment. So if we're talking about 100, it's just a rough number, 100 murders in the metro.
We have 102 right now,
Right.
if you want
Well, I
to
hate
use a real number.
I don't want to
yeah.
bring it up. How many are we talking related to fentanyl? You're talking about robberies, you're talking about drug deals.
So if they have high blood pressure, we'll treat their high blood pressure. If they have diabetes, we'll treat their diabetes. And really, fentanyl use is no different. If they have an opioid use disorder, it's our responsibility as healthcare professionals to treat that. So we always try to ask those questions in a non-judgmental way and get information that is going to be helpful to us to be able to treat them as effectively as possible right off the bat. And what we're finding is that about 21% of the patients that come to us are reporting fentanyl use. So 1 out of every 5 folks who are arrested and come through the walls of Metropolitan Detention Center are reporting fentanyl use. So another challenge is just the sheer volume of patients that require frequent follow-up to monitor for that withdrawal symptom and to get resources to make sure that they're started on treatment.
Doctor, you're among these folks on the front lines of this epidemic. How does fentanyl use and its detox differ from other substances?
So what the experience of myself and my colleagues has been is that withdrawal from fentanyl tends to be somewhat more severe and longer lasting than what we see with other opioids, such as opioid pain pills or heroin. And at this point, there are no published medical guidelines as to how it should be treated differently. As Dr. Duhigg mentioned, right now we're treating fentanyl use very, very similar to the way that we treat use of other opioids. But as medical providers, we like to practice what we call evidence-based medicine, which is making treatment decisions based on clinical or scientific research that has demonstrated that it works. And so we're seeing that fentanyl acts somewhat differently than other opioids, but we don't yet have solid scientific evidence to support treating withdrawal or treating the opioid use disorder any differently than we do for other opioids.
Doctor, can you share with some of the common experiences that you're hearing from fentanyl users when you talk to them, what their experiences are?
I'd say one of the most common ones that it's always striking when I hear it is that patients increasingly are not fully aware of what opioids that they're using. I've had many patients who believe that they're using heroin and are pretty shocked to learn that we've identified fentanyl in their urine. And with so many analogs of fentanyl becoming available and the actual product that they're using constantly changing, it's almost like even if they tried, they couldn't necessarily know exactly what it is that they're using. And that, combined with the fact that it is often mixed in with other illicit substances such as methamphetamine or other types of opioids or Xanax, patients are often using multiple substances at the same time. They're not able to provide a really accurate medical history such that it presents a challenge to healthcare providers to really tease out what may be going on when they're presenting with either symptoms of intoxication or withdrawal.
Doctor, thank you very much. We have another massive institution in the Metro, Albuquerque Public Schools, that is dealing with this fentanyl crisis. We have with us Kylie Schroeder, who's the Director of Prevention and Intervention Counseling at APS. If you would, can you tell us what effects from the fentanyl epidemic you're seeing now in the schools?
So this is really interesting because I'm going to answer that question by telling you all what we're not seeing. What we're not seeing is we're not seeing students in the bathroom taking fentanyl. That is not what we're seeing. We are not seeing students overdosing in our school. It's very interesting because what we see is indirect more than direct. So when we say we're on the front line, we're not on the front line with visually seeing students using. What we're seeing is the emotional impact of family use. We're seeing, unfortunately, we often don't even know students are using until we get a call that a student is in the hospital in a coma or has passed, and we don't always know the cause of death. It's anecdotal. So therefore, it's not like I can give you statistics on how many students have died from a fentanyl poisoning or overdose. But the emotional impact of family use we see with our students. We have, you know, it was really interesting. I talked with one of my counselors last week, and she was meeting with an elementary student who was very, very dysregulated, very upset. And why? What's going on? He said, well, the fentanyl got my uncle. So there's this discussion that it's like the boogeyman for kids, that they don't understand, but they know that there's this thing out there that is taking away from them people in their family, people that they love, people that they care about. So we see problems with attendance, we see behavior changes, we see all the things that we see for other reasons also, but it's the impact in the community. It comes to our kids. Our kids are, even if they're not the ones using, it's the family members, and it's the impact of the family on our students. Just yesterday, I got a phone call from one of my counselors at one of our high schools who didn't know who this student was, but had been notified that he had purchased 3 pills at school. Okay, so we know that there's access and we know that it's happening. It's just not out there like THC use. And I'm just going to put that out there because that's what's happening in the bathrooms. But with fentanyl, this student bought 3 pills, took 3/4 of 1 pill, and it put him in a coma. And the thing is, my counselor, one of the programs that I support is called Crossroads. And Crossroads we have master's level counselors who have additional training in substance use and misuse. And the counselor, my Crossroads counselor at this school, didn't know that student. It's not like when students get busted in a bathroom or using on campus, then our Crossroads counselors are involved and they become aware of these students that are using, and then they use harm reduction and they meet with students. But what's happening with the fentanyl use is we don't find out until after something has happened. We don't have the ability to know. She didn't know this student because they were like, well, we don't know what happened, but he got a hold of these pills on campus. So what we're seeing is it's a mix. You know, we're not set in the front lines per se seeing it happen. We know it's happening, and we need to, you know, they're raising this awareness and having the conversation in the community and having parents not be afraid to talk about it. All those things are connected, and just being up here and being a part of this is pretty amazing. I don't know about you all out there, but just hearing the knowledge up here and what everyone is seeing is, you know, I'm horrified at when I got that call yesterday about this student being in a coma. Of course, as a parent, I can't imagine what that would be like. And the interesting thing is that they tested the 3 pills, and the 3 pills had varying doses or amounts of fentanyl in it. And he unfortunately took the 3/4 of the one that had the most in it. So that kind of supports what everyone's saying, that, you know, trying to educate our kids, but we have to go about this. It's really different with fentanyl than it is with the other substances that teenagers and, you know, are using. We're trying to identify how to do that, and raising awareness and having families and communities not be afraid to talk about it is something that is definitely high on our list for what we need to do.
Please.
If I may add something to that, while she was speaking, it made me think of another kind of concurrent issue that we have in our community is just when we talk about accessing healthcare and education, we have other issues with health literacy and with language barriers and how people access their healthcare in our community. And so when we're talking about educating our community members in Bernalillo County and in our city and in our state, I think it's also important to understand that we have to tailor that message so that it gets out to the entire community, because just like Captain Lujan said, this is something that touches all quadrants of our city, but we also have to make sure that whatever education we're putting out and how we're educating our parents and our children and people is that it doesn't fail to educate you because of the language you speak or your immigration status or any of those types of things that might be a barrier to accessing healthcare or that education.
Dr. Wark, you had a thought?
Yeah, I just wanted to say thank you for that. It's been, and extending on this, I think one of the things that we see at UNM's addiction clinic, we have a STAR program where we treat teens, young adults. One of the things that is really striking to me is that our teens find it to have easier access to methamphetamine, to fentanyl, than they do to alcohol and even to cigarettes. I have more teens drinking hand sanitizer than I do like drinking bourbon or whiskey or beer as their source of substance use and its availability. And I think with Commander Hartstock, it points out how pervasive and easy the selling is through social media. Also, by the time you get to law enforcement, it's a friend of a friend to distance themselves. But these are oftentimes family members or their actual friends that are providing, and they're selling, they're using together. Also, the price of fentanyl has dropped dramatically during the COVID epidemic. I think there was a day 5 years ago where it was $1 a milligram is the historic price of oxycodone. We went into the epidemic, I want to say about $20 a pill. Now, I haven't heard anybody buying a pill of fentanyl for more than $5 for a long time. I'm hearing reports that people are paying as low as 50 cents for the pills now. And to me, 50 cents, that's enough for a kid, usually a high schooler, but middle schooler with just lunch money is enough to get addicted. But looking at the numbers on how much fentanyl costs to manufacture and to put together, there is still more money in the fentanyl, the counterfeit pills, by a long margin than there ever was in heroin or there is in methamphetamine. The drug dealers have room to go down in their margins by another factor of 10, which is particularly scary to me. And again, I think this is a place to share knowledge with people. I'm not trying to scare people, but these are numbers with my 10-year-old that keep me up at night. But I think it's great that we're working together and coming together with law enforcement, with medicine, with the city, with all of you also to try to impact this.
Dr. Wark, thank you. Commander Hartsock?
Yeah, and I appreciate the insight to the schools. And a question I get asked a lot, and I've been investigating internet crimes against children with child exploitation for nearly a decade. When we talk about the drugs on here, I get asked a lot, what can parents do? What software can I download? What firewalls can I put in place? And I'll tell you, there is no better recipe than just talking with your kids and understanding them, and understanding the cadence of your child or your sibling or your cousin or your loved one, right? When something is off in their life, you should be close enough to them, ideally, that you can kind of detect it and dig into it. It doesn't mean it's fentanyl. It could be something else. But you want to try to understand what that stress is in their life, because I've talked to high schoolers and middle schoolers about when they're going through their apps, there's nothing really out there that can prevent them from seeing something that scares them, or seeing something that really just might interest them. And their brains at that stage of development, it's gonna pique their interest. They might want to learn more. The only question is, are you gonna let the app and their friends teach them, or are you gonna help guide them through it? So communication with your kids is always preferred. Yes, you can unlock their phones and go through their text messages. You can do that. That can come at a cost with your teenagers. It can, right? And you might win that one battle, but you might definitely lose the war of trust. But if you have trust with your kids and you have those conversations, you'll actually get to the deeper roots of why they were interested in it in the first place. So I also can't encourage that enough. But use your school counselors and resources. Use your community members to help build up that trust and that knowledge base. And don't be afraid to learn their apps as well. The best thing I did with the teenagers in my house, I just joined Snapchat and started talking to them on it. It's not that scary. It's actually pretty fun. You can do goofy filters on your face and snap, there's all kinds of stuff.
Settle down.
Yeah. One thing I'll tell you about Snapchat, they told us recently, they are taking a pretty hard stand against drug dealers on their app. If they see fentanyl in a user's account, and we see this, by the way, in our investigations, Snapchat just kills the account. They just send a message to the user and they say, you violated the terms of use, goodbye. And most of the fentanyl dealers aren't going through the arbitration process with Snap Media out of California to restart their account. But I'll warn you guys right now, the app we're seeing is now Telegram. And most of you might not have even heard of the app Telegram, by the way, but I'm glad you're hearing it now. It's a messaging app. It's not based in the United States. They're not subject to any of our legal orders or search warrants. But most of the party groups are now using Telegram to advertise parties, drugs. We've seen them now shift. So we can get mad at Snapchat, we can pile on them, sure, but the second they move them off, they just move to an app that's actually harder for law enforcement to track. So it's kind of one of those, be careful what you wish for, you might get it.
We only have time for a couple more questions. I just want to take a moment to thank Ms. Schroeder for, as someone who's a product of Albuquerque Public Schools, and I have a 10 and a 12-year-old in APS right now. I want to thank you personally for your efforts in prevention and intervention in those schools. I know it's a tough job, and we appreciate the work.
Thank you. You know, I do want to say that APS, yes, I'm going to put a plug in for APS for the school district. It's amazing because we have 13 high schools and we have 13 dedicated crossroads counselors at each of those schools. There are districts across the country that don't have that, in this state that don't have that. So I'm very proud of the team that we have, of the knowledge. They stay up to date on everything. They keep collections of things that come across to educate other people, other staff members in our schools. And I am just so impressed with them and the fact that we have them as a resource and that they are so connected and that they are there to help. So I just had to put that in. Thank you for that.
Thank you. Dr. Warwick, I'd like to go back to you. We have just two more questions here. An important question, what can I do to help my community? Everyone here wants to help. We want to change this. We want to fix this. Tell us what you think we can do.
Sure. I think number one is the fact that you guys are here, and I want to applaud you for showing an interest and for allowing us to raise awareness. Second is, I want to also thank and appreciate all the people in law enforcement who are, and including the retired people, who've dedicated a tremendous amount of their career to trying to control the drug problem. I think it's time that medicine has steps up. We are more engaging in treatment, and we have those accesses. Interestingly enough, I think a lot of the people who have a substance abuse problem have a fairly decent idea about treatment. For families, I just want to put a plug in for Al-Anon. It's a nonprofit organization. It's on the Alcoholics Anonymous, Narcotics Anonymous family of things, but to support family members, because I think that's a lot of my questions from the public is, how do I get help? How do I navigate this? And I think that's a good resource that's a low cost. I just want to say at UNM, we're engaging in clinical trials and research. If anybody has a loved one, anybody has a member, a family member, friend who wants to, we've got a clinical trial paid for by the federal government or sponsored by NIH or specifically NIDA, National Institute on Drug Abuse, where we're looking for people to enroll and given a choice of either buprenorphine or naltrexone, and to do that. And I think it's important that federal tax dollars come to New Mexico and that we are part of the answer at a national level on how, because our population of New Mexico is not that of Boston, Massachusetts. It's not the same as New York City. We have a problem here. And so we're very interested in engaging and working with those people as well.
Doctor, thank you. We got one last question. I'd like to bring it back to the individual now. For anyone here, I have a friend or I have a family member who's addicted. What's the best thing I can do?
If I may, so encourage them to seek out treatment, and encourage them nicely. All right, you may be scared, and that may come out as anger, but they may misinterpret that, right? So I love you. I want you to get better. Encourage them. If they need a ride either to a meeting or to a clinic, please help them out. And I would really urge you, we talked about these 3 medicines, methadone, Suboxone, and naltrexone. I would really encourage you, don't tell anybody that any of them are bad, right? Even if they didn't work for you, even if you have your own views about them, we want all doors to be open. We know that all 3 of those save lives. So the best thing we can do is encourage anybody who's willing to get that treatment, any of those treatments, to get them and to stay on them. That's the best thing that we can do.
And if I could just fundamentally emphasize, Dr. Duhigg, is approach them with love, caring, help them make that phone call. That is so hard. There's so much stigma to make a call to an addiction center because I now am an addict. I'm that junkie who's on the street is what's going through their mind. And be like, no, you're not. We're going to get this so you don't become that person, but help them move along. But we can't enable them to keep coming back, but you really help them with those phone calls, really do a lot of positive reinforcement when they're moving in that direction.
Doctor, thank you. And with that, I'd like to thank everyone here. A fantastic turnout. It's great to see so many faces here. A big thank you to our esteemed panel, not just for sharing all of their years of education, also their decades of experience. And most of all, I think their dedication to rising to this challenge to try to solve this problem in our community. We thank you so much.
Thank you.
Also, before you quit applauding, Dean, thank you so much for doing this. You all know Dean Staley on television. He gives his time to come out here because, like the rest of you, he cares about his community, and I think that's very important. Okay, a couple things before we're going to take a break again, a little health break for everybody, stretch your legs, do all that kind of stuff. Before we do that, remember the resource room in the back. There is a wellness room back there. If you maybe find this a little overwhelming, need to sit down for a little bit, a little quiet area. There's also peer support, people to talk to, so please take advantage of what's back there. Also, please visit the tables. A lot of information for you, a lot. So if you really want to learn about this, it's available. And after this, a lot of these folks will stick around, I'm sure, for a few minutes. If you have questions for them, please seek them out. Get your questions answered because that's what this is about, learning all you can about this. Thanks. About a 10-minute break. Thank you. Again, we want to thank all of you for coming and visiting us today, being a part of this event, learning all you can about and getting information, learning about fentanyl. Okay, this is our judicial panel, which is very interesting. Before I go too far, though, I did want to mention that Zochitl Campos Biggs from Teresa Ledger Fernandez's office is here. So again, the eyes and ears of the lawmakers are here, and that's what we want. Speak to your lawmakers. Speak to those in charge. That's how we get things changed, right? Okay. Heading up this panel again, someone from the community. We've asked another one of the anchors here in town, Danielle Tedesco. She has a very big interest in this. She has a child like many of you and many of us. So she wants to learn about this. She got involved, and that's what it's all about. So Danielle, I'll hand it to you.
Thank you, Tom. First, I want to start with how many of you have already learned so much today, right? Jaw-dropping information in that last panel. And as he mentioned, I have a 9-year-old at home, and I've already annoyed her with the discussion when the rainbow fentanyl came out, and so she's going to be very annoyed with me after today. But we've got to have those conversations. So we have the judicial panel, and let's take a look at who has taken their time. Very busy people we have here today. We have Bernalillo County District Attorney Raul Torres. Give a wave for us. We have Matthew Chavez with the Public Defender's Office here. We have Shayna Long. She's with the U.S. District Attorney's Office. That's Judge Cindy Leos in the blue. We have Judge Jennifer Wernersbach. And we have Judge Alma Christina Robertson. And we have the Chief Judge for Metro Court, Maria Dominguez. Thank you for joining us. I want to start with DA Torres because we had the discussion with law enforcement and what they're seeing out on the streets, what they're encountering, and then they bring these cases to you. What are you seeing?
Well, I think what you're seeing inside the criminal justice system and across law enforcement is the steady replacement of fentanyl in the place of methamphetamine, heroin, cocaine, and other drugs. In the last probably year and a half to 2 years, we have seen the real explosion of the very potent and highly cheap fentanyl pills that are flooding the marketplace. And what that is doing is not only having a profound impact on our public health system, leading to skyrocketing levels of overdose deaths in the community, but also having a significant impact on the dynamic nature of the drug trade and drug trafficking here in the community. For our part, we focus on trying to do 2 things at the same time. Number one, working with our federal partners to identify high-level drug trafficking organizations that are engaged in not only selling narcotics, but a lot of violent crime in the community. But number 2, trying to identify lower-level property offenders, people with substance abuse disorders, people who are arrested for possession of a controlled substance. And if there is no history of violence or other extensive criminal history, what we try to do is move them either into our pre-prosecution diversion program, which we've tried to grow by about 200% in the last 2.5 years, and also work with our stakeholder partners to engage in drug court. Unfortunately, we have an underutilization of both pre-prosecution diversion and drug court right now inside the system, and so that's the area where I think most of our frontline prosecutors are spending most of their time, is trying to figure out how we can get some of these lower-level folks with substance abuse disorders out of the criminal justice system into a therapeutic framework and into a place where we can help them recover, get their lives put back together, and stop having contact with the criminal justice system.
I want to follow up because you say an aversion to it from the person themselves?
So what we're trying to do is to divert people out of what is the mainline traditional criminal justice system, which there is certainly a place for that in the criminal justice space in terms of using incarceration to deter different types of criminal activity. But what we recognize is that substance abuse disorders are best dealt with up front by access to treatment, access to counseling, therapy, and alternatives to incarceration, because we have lower recidivism rates, we have better health outcomes, we have less contact with the criminal justice system. They consume fewer police resources, they engage in less criminal activity, and it not only saves lives, it saves money, and it improves the system across the board. But it's very difficult to try and get people into a diversion program given the current structure of our system. And so we work a lot at the policy level to kind of think differently about the incentives that we've created in that system, but also what kind of additional resources we need to have so that when people are there and they're in custody but they want help, we can provide that help and make this a safer community and help them regain control over their lives.
Matthew Chavez, Public Defender's Office. I want to see what you're seeing from the people who you guys deal with on a daily basis.
Thank you for that question, and it's really good to see so many familiar faces here. It's an extremely important issue. It's, the Public Defender's Office is on the front line of this, just as Raul's office is, and it's affecting everyone, even our employees' families. It's extraordinarily sad and troubling to see. It really has taken over. What DA Torres has said is it's really, we're seeing a replacement of traditional drugs with fentanyl, and of course we hear it directly from our clients, and they're asking for our help. I mean, that's the number one. Their number one concern is to get better, to kick this habit that they have and get their life back together. And so we feel that we are the tip of the spear on that. We provide an enormous amount of services. We connect people with services in the community, and we take this very seriously. And so our appeal is to better fund the system, because we have social workers that drive our clients around Albuquerque, and they're trying to find a bed. They're trying to find an available bed for one of our clients that are severely ill, and they can drive around for hours, going to all the familiar places, all of our service providers. There's just not enough, and so we really need to see a dramatic increase in the services for folks that are addicted. And so that's our mission. Our core mission is to defend the constitutional rights of our clients, but dovetailing with that is we don't want to see our clients again. We want them to get help and get free of this addiction.
We heard in the last panel from the Office of the Medical Investigator that a lot of these people may not even know that they have had fentanyl. Are you seeing that with the clients that you see?
Yes, and I mean we might even be a few steps back because there are other fentanyl issues. There's I don't know if folks have heard of Trank, the fentanyl cut with horse tranquilizers. I think it's xylazine. There's also benzo dope, which is fentanyl cut with benzodiazepines. And so it's really evolving over time. The shifting sands on this are very hard to track. But yes, I mean, our clients, they've fallen victim to the same things that we heard about earlier this morning, thinking that they're taking one substance and they're actually taking fentanyl, and they overdose, and it's really ravaged those communities.
Let's go to Shayna Long with the U.S. Attorney's Office. I would imagine that you have a much different goal. Rather than connecting people with services to get out of addiction, you're dealing with maybe the bigger cases, the bigger criminal charges.
Yeah, that's correct. And I want to thank everyone for having us here in this important discussion. So the role of the U.S. Attorney's Office in all of this is, if we're doing our job right, is we're focusing on the large-scale drug trafficking organizations. So we have a very experienced group of prosecutors who are dedicated to organized crime. We employ all sorts of long-term investigative techniques wiretaps, and other sorts of fun stuff to try to infiltrate and dismantle drug trafficking organizations. So with that, the goal is that we're not trying to target the street-level dealers as a drug case. What we're trying to do is work our way up the chain to the people that are making money and benefiting off of other people's addiction. So that is the goal. And in terms of, we have some hurdles and some trends, and we'll discuss that in a little bit probably, but ultimately, if we're doing our job right, we're getting the people who are profiting off of addiction. We are seizing their assets, so the cars and the houses and the bank accounts, because a lot of the drug traffickers that I've interfaced with in my career, they know they're going to federal prison. Like, there is an assumption, once you get to a certain level, you know you're probably going to get caught if we can get to you if you're not in Mexico. So really the question is, how much of their stuff can we take? And so that is where we put a lot of resources in terms of seizure of drug proceeds that were placed into homes, vehicles, baseball cards was one of my recent seizures. So that's really kind of an important aspect of this discussion with what is one part of this ongoing crisis. Obviously, I think everyone here today knows we're not going to prosecute our way out of this crisis. So we're doing what we can in our limited resources to work up to the people that are most responsible and, in my view, criminally culpable. But of course, if there's demand, supply and demand works in every community and every type of capitalistic society, and that's true for drugs. So we can dismantle and take down, and when the demand is as high as it is, it gets replaced. So that's one aspect. The other thing that we've been really focused on, and Alex Ubaez is our U.S. attorney, he's here. I told him he should Sharpie this out and come sit here, but he didn't. But the other aspect is violent crime. So I think everyone in this room has been touched by violent crime, probably closer than you would like in your community, especially for those of us who are from here, where we feel like it didn't used to be that way, and it is now. And so we are trying to put what is really limited resources into, and as DA Torres mentioned, the most violent offenders. I will state that even the most violent offenders, the people with the drugs and the guns, typically hand in hand, a lot of our non-drug related offenses are drug related. So a lot of times people are high on drugs, or it's over drugs, like Commander Hartsock mentioned. So drugs is kind of the theme that I think cuts across all levels of criminal justice. It depends on kind of how you look at it and the type of case. So I would say it touches on everything, but really it's large-scale drug trafficking organizations and then our community's most violent offenders. That is what our goal is in prosecution.
You talked about local traffickers, local seizures. How much of that is local here in the metro, and how much of it is out of the state, out of the country?
So we are a hub of a lot of things. The Balloon Fiesta is one. The other is lots of drugs from Mexico. So Phoenix and El Paso, it's a very common route to come through Albuquerque. So one of our focus is we try to focus on what's impacting our community in the role of drugs and violence, but it's also to work out and have a regional impact. That is really important, and international. So we are heavily involved in trying to extradite defendants from Mexico. That is a large part of what we do, to try to bring them to the United States. That could be a separate summit on its own, right, in terms of the complications that can present. But we certainly try to focus on our own communities as well as the regional impact. I would note that our rural communities are really underserved at every level, but especially in terms of what's happening with fentanyl. And so that is something that trying to work these long-term investigations in the rural communities is something we're trying to focus on as well.
Let's go to Judge Cindy Leos. We know that this is exploding now. We're seeing huge exponential growth in the prevalence of fentanyl in our community. What are you seeing, and how long have you been seeing it, even with, I think it says, a young adult court?
Sure, thank you. So I want to, first of all, thank you so much for having me present at this summit. I think it's so important that we're really opening the discussion and bringing in so many people that are seeing this on the ground floor. So I am, along with Judge Montano, run a diversion program here in Albuquerque called Young Adult Court, and it's for young people 18 to 25 years old with pending felony charges. And we started this program in 2017, so we've been around for about 5 years, and we've had numerous graduates and a very low recidivism rate. So we're not seeing a lot of our graduates pick up new felony charges after they've completed this tough program. So in 2019 is when we first started to become aware that fentanyl was out there, and it was early 2019. And it was brought to our attention by one of the young people in our program, one of their family members, mentioning that this person was using. Unfortunately, at the time, the drug testing that we were doing did not specifically test for fentanyl because we were unaware of it. And lo and behold, we started adding that test to our urinalysis test, and we were finding that some of our participants were indeed using fentanyl. So we changed our program, and we started routinely testing for that drug. Unfortunately, what we've seen in the past 3 years is that what was seen in 1 or 2 participants is now seen in a lot more. And so what we're seeing trending with the young people in our community is tracking with what we're hearing today at the summit. It's a major problem. And so, you know, we're trying to, and we'll talk a little bit about this later, about how we're specifically addressing that addiction within young adult court. But just being mindful that it's being used out there was our first step.
Let's go to Judge Robertson. I have a question about childhood addiction and what you're seeing.
Thank you. So drug use has certainly become much more dangerous now. I have some numbers actually that I would like to share. In 2010, there were 518 deaths among children because of overdose, 518. In 2019, there was 492. In 2020, that number jumped by 94% to 954 deaths. In 2021, it was 1,146. And so certainly we're seeing a rise of fentanyl use in children's court. And there are some survey studies that seem to show that during the pandemic, drug use didn't become more prevalent among our children, but certainly those overdose rates are incredibly frightening.
Can you distinguish between which overdose deaths were like a baby that had somehow accidentally obtained that and like teen use or even elementary age use?
So these numbers are teen use.
They're teens, okay. And so tell us more about what you're seeing in the family court system.
So in family court, we deal with delinquency, which I think is what the public is more familiar with, but the majority of the cases that I hear are abuse and neglect cases. And from those, the majority are neglect cases, and these are cases where parents are dealing with addiction and are no longer a safe place for their children. And it is heartbreaking to see a baby taken away from its parents. You know, this is a critical time for bonding between children and their parents when they're newborn, and they miss out on really important emotional development, physical development even. These are babies that are waking up in a stranger's arms. These are babies, that are used to seeing and hearing and seeing certain people, and that's just gone. It is extremely traumatizing for newborns and babies, but it's also really hard on older children. You know, they understand that their parents are addicted, but they don't always understand the complexities of addiction, and they internalize that, and they think that it's their fault, and they think that their parents don't love them enough. And that's far from the truth, because, I see it in court, parents are trying, these adults in their lives are working, and the love that they have for their children is really undeniable. And sometimes, we see successes, and parents are able to get to a safe space, these parents that are dealing with addiction. And it is really the highlight of my day, my week, my month. But sometimes after what's a really long time in the eyes of a child, their rights are terminated. So drug addiction, fentanyl is certainly tearing apart families.
Let's go to Judge Jennifer Wernersbach. Forgive my ignorance. Tell me what drug court is and how that works.
Sure. Thank you, and thank you also for having me. I'm very excited to be part of this conversation. It is breathtaking how quickly fentanyl has taken over what we are seeing in drug court as the most typical drug that we see. But drug court essentially is a diversion program as well. It can be entered into sometimes while your charges are pending, but typically after you've pled to charges to divert from a sentence. And it involves 4 phases. It is meant to be about a year, but it can be much longer if you're not earning your weeks in each phase. And it involves treatment, community service, group therapy, medically assisted treatment like methadone, Suboxone type substances if necessary, working with people to get housing vouchers, rides around town, getting to treatment, really helping people to get on their feet, get stable, learn how to become sober, and then help them integrate back into their lives with all the stressors and triggers and things that come with that, with this new knowledge of how to hopefully do it sober.
How has fentanyl changed drug court?
Well, I will say, like I said, I think now we're seeing when people are testing positive, it's almost always involving fentanyl. Sometimes other substances too, but almost always fentanyl is in there. And I'm sure this has been talked about already, but it's cut into so many other drugs, as we've talked about, that people don't even know sometimes that they're taking fentanyl, and so they're getting hooked in a manner that they're not even fully aware of, which makes it really difficult to meet their treatment needs. It's very hard for clinicians to tell, when they're reaching signs of overdose or more risk, because the people themselves don't even know exactly what they're taking, how much they're taking. It's hard to manage how much like methadone or Suboxone dosage is safe, because fentanyl is so much more addictive and you need so much more to maintain that high. It's very tricky to get a right dosage in that regard. Clinicians are very afraid there's a lot more overdosing and risk of overdosing, and trying to, intervene in a timely manner is really tricky because there's so much unknown about it.
Can you talk about how successful drug court is and how often you're seeing the same people?
So we do have a low recidivism rate as well. If people graduate drug court, I believe our recidivism is less than 5%. That said, I've seen a couple of people who've done it, back in the 90s, say, or the early 2000s, who continued, tried to get sober, but got back into it, and they're back in our program. But, I've seen some people really succeed very quickly, and it does have to come from within. I mean, we impose these treatment strategies and counselors, but there really is something that comes from within each person, which makes them successful at this time in their lives or not. And not everybody's ready for it, even when it's imposed upon them. And so we try to create those incentives to create that change, but it's not always successful. But when it takes, it does take, and our program is quite successful for the people who graduated.
Let's talk to the Chief Judge for Metro Court. That is Maria Dominguez. Thanks for being here. Tell me what you're seeing with our criminal justice system here in the Metro.
And thank you for having me. As many of you know, the Metropolitan Court is probably the busiest, or is the busiest court in the state of New Mexico. We handle all misdemeanors, anything less than 364 days, as well as all preliminary hearings. Every case that felony or misdemeanor for the most part, is initiated in Metro Court. So we touch almost every aspect at the very beginning of the criminal justice system. So that's why I feel that Metro Court and along with the justice partners play a key role, because we can intervene early. But what I've seen is, again, like Jennifer or Judge Morgasbacca and Judge Leos have said, the increased numbers of positive for fentanyls for the individuals that we have on probation and pretrial services is just skyrocketing, where it's the main drug right now, rather than meth or THC, which is legal now, but as far as the drug testing. So we are testing, and of course that's something that Judge Leos mentioned, is making sure that we're appropriately testing. So we have seen that increase. Also, we handle a great number of arrest warrants and search warrants, and I would have to say in the last month, almost every arrest warrant or search warrant that I've handled involved fentanyl. So it is a huge problem, and we need to do what we can. I think we're already kind of behind the game, but we all need to collaborate, work together, work through these problems, and that's what I see.
I think this summit is a great first step, right? That our community is doing that maybe other places in the rest of the country are not doing, which is surprising to me. But are there other things that you're seeing other parts of the country do that you think we should try here?
Yes, absolutely. I've been doing a lot of thinking about this and research, and there are opioid intervention courts already throughout the United States. The first one started in 2017 in Buffalo, New York. There are already guiding principles for an opioid intervention court. And the way to think of that is, rather than having a new type of court, it is considered an emergency room drug court, where intervention is done at the beginning, and the focus, and when I say the beginning, is upon arrest or prior to arrest, where the focus is on saving that person's life. That's the bottom line, making sure that they can live. It's not about where their case goes or, anything else. The priority of that individual and the purpose of them being there is to make sure that they will survive to see another day.
We had heard from the last panel the connection that law enforcement is seeing with fentanyl and violence. I want to talk to DA Torres about that. What are you guys seeing as far as these cases being connected?
Well, I think one of the most common things that we see on the streets is the prevalence of young people drug trafficking and firearms in, combining in unpredictable and pretty dangerous environments. And that's not unique necessarily to fentanyl, but the fact that it is so addictive and the fact that it is so cheap and its distribution brings such high profits to these drug trafficking organizations. Look, if you're in the drug game and you're out dealing fentanyl or anything else and you're worried about getting ripped off, you can't necessarily call the cops when that happens. So what happens? You arm yourself, right? So you're going to show up late in the night with no police around, and someone's got a lot of drugs and someone's got a lot of cash, and usually both parties have guns, and that is a very dangerous mix. And so one of the things that we try to emphasize when we focus on things like pretrial detention is the presence of a firearm. For example, we place a heavy emphasis on whether or not the parties are armed when they're, if they're getting picked up for a drug transaction, because of the connection between the presence of a firearm and a lot of these gun-related homicides. But beyond the violence that happens sort of in the context of drug trafficking, there is a lot of dangerous behavior by people once they're under the influence of fentanyl. A lot of people become victims of sexual assault or domestic abuse. They engage in domestic abuse. And so you have to understand that there are a lot of potential violent dynamics that are associated with the use of any drug, but a drug this addictive this cheap, this readily available, and this profitable is going to present a real challenge for any community and for any law enforcement system.
So we are seeing fentanyl and firearms going hand in hand, and Shayna had mentioned that as well. I want to talk about the partnership that you have with the U.S. Attorney's Office in bringing those cases to that federal level.
Yeah, our office has the biggest and longest standing relationship with the U.S. Attorney's Office, where I used to work, in specifically focused on the nexus between drug trafficking and firearms, or being a felon in possession of a firearm. And so we take a lot of the cases that involve serious violent offenders, people with lengthy criminal histories, and we send them over to a unit of, they're actually prosecutors that work for us, work in the district attorney's office, but are cross-designated as special assistant United States attorneys, so we have the ability to go into state court or federal court. We tend to take them into federal court for those firearm offenses when we know that we are going to have a greater certainty of both their detention and longer sentences imposed on the back end.
Shane, do you want to add to that, Shayna?
I think in terms of, so my last job was intake of these cases in terms of the focus being drug trafficking, and I'll say that I think the partnership between the DA's office and the U.S. Attorney's Office in Albuquerque is really important to having that level of communication to make sure that, I mean, listen, New Mexico, everyone knows, sorry, but New Mexico knows that the state courts are maybe, we have some issues in terms of sentences and detention and whatnot at the state level. The federal court, we do have higher success rate in detention. We have some pretty significant mandatory minimums. And so it's a matter of us working closely with the DA's office to make sure that we're using those resources and actually trying to select the people that are going to have the most community impact. I mean, if we're doing it right, that's what we should be doing. So having that long-standing effective relationship, I think, has really helped that, and the people that are doing the work and reviewing the cases do a very good job of making sure that they're flagging those type of offenders.
I think one of you, maybe it was Shayna, had mentioned that fixing this crisis is pretty limited as far as the judicial system. One of the judges, I'd love to hear from you guys what you think that a solution can come from your end.
Well, I'm happy to jump in and plug young adult court a little bit more. So as DA Torres mentioned, you know, one of the things we need to focus on is diversion. And so it's okay. You want some of my water? That's always my worst fear, is I'm going to choke like that. Are you okay, Jenny? Okay. So we have to recognize that incarceration certainly is something that's always on the table. You know, when we're talking about drug use, but incarceration should not be our default every time when someone is using. So in young adult court, it's a treatment court. And so we are offering treatment. And so when someone is using drugs, fentanyl, instead of just immediately defaulting to incarceration, we default to treatment. And as Judge Wernersbach talked about, we divert to inpatient treatment, outpatient treatment, sober living arrangements, detox. We get them support in the community with case management services. We partner with multiple community providers, including UNM, Adobe, CNM, YDI, because we're still dealing with a very young population. And, you know, before we even consider what the appropriate diversion would be for any particular participant, we actually look at that actual participant. And we treat them like the individual that they are, that we all are. And we also recognize that they are young, and that the neuroscience shows that the human brain does not fully form until we are 25. And if we all look back to our, you know, our teenage years going into our mid-20s, we all probably made some decisions that we wouldn't make today now that we're older. And that's not an accident. That's just not because we're foolish. It's because our brains aren't fully formed. We don't understand risk. We don't understand that there's going to be consequences yet because our brain hasn't fully formed. So in young adult court, like the drug court model, we look at diversion. We look at how can we get people services in the community. That doesn't mean we won't incarcerate. We absolutely do incarcerate our participants sometimes. That would be when it's not just drug use, but there's something else going on. Maybe they were arrested on another charge. Maybe they're not complying with the program in other aspects. Or maybe there's just no option but to send them to the detention center to do ATP or the addiction treatment program and then get them into inpatient care. So we need to be progressive in the way we're approaching it, because the way we've been doing it is not going to work. And so programs like Judge Werner's drug court program and my young adult court is the way we're going to move forward through this.
And Matthew, you had mentioned that you also help connect your clients with those services. Can you tell us more about that?
Absolutely. So I couldn't agree more with Judge Leos that, I mean, first of all, we can't incarcerate. I think it was Senator Ben Ray Lujan set us off, framed the issue really nicely this morning by saying we the research has established that, incarcerating people that are addicted does not help. It actually exacerbates their circumstances and feeds into the roots of addiction that lead them to use drugs and then possibly commit crimes or whatever it is that flows from that. And so we're sort of on the back end of that. Our clients walk in the door, we meet them at the jail. They're already kind of in a bad situation in their lives. They've hit rock bottom. And so at that point, we do what we can, and we have an incredible team of social workers and attorneys, staff, paralegals, and they connect folks with services. Our social work director, Casey Quirk, is brilliant. I'm sure a lot of folks in this room know her, and she's an incredible person, and that's what we do. So we do that for breakfast, lunch, and dinner every day. We try to help our clients get free of their addictions, and that is our priority. And so I just want to say though that someone mentioned something about rural New Mexico and the lack of services and the lack of options, and that is absolutely correct. I spent 5 years in the 12th Judicial District. There's a lot of really great leadership there and really dedicated public servants that are doing their best, but the resources are really lacking. And there was 2 jails in that district, 2 county jails, and at the time that I was the district defender there, neither of them had any significant addictions treatment in the jail, which I think is absurd. And coming here to the 2nd district, it's a little bit better, but we still have a lot of work to do, and I think we should really dedicate ourselves, redouble our efforts to increase those services.
We have lawmakers listening. We know the session is coming up in January. What needs to change? What would you tell them from anyone?
Okay, I'll take the lead.
It's a lot.
We need more resources. We need to, as I mentioned when I was last speaking, sometimes our only option is to incarcerate someone until we can get them a bed. And that's not ideal. We know that there are drugs circulating at the jail. And so even though there's a thought that if you send somebody to jail, they're going to get clean, that's not the reality of this situation. So we will incarcerate people, like I mentioned, because we don't have any other options. We have a 3-month waiting period for a residential treatment program. Or the particular detox program we want to send them to. They've had problems with this particular participant has had a problem in the past and they can't get in there. There's just so many roadblocks that are frequently thrown up when we're trying to get somebody into the appropriate treatment. So if I had to ask for something, at least for my program and for the courts in general, I would say we need more resources generally.
Chief Judge, maybe you have something to add?
And I agree with Judge Leos. We do need more resources. And along the same lines, we need immediate access to resources, and less red tape, of course, and less bureaucracy, because we need to be able to divert people into inpatient treatment immediately rather than 3 months from now. And then also, the issues of transportation. How are we going to get that person from the jail to the treatment center and ensure that they're there? So just the most basic of resources, as far as we need more treatment, more inpatient treatment, and the availability to have access to them immediately.
DA Torres, what does your office need?
Well, I think it's beyond resources. I think everyone here, I haven't met a judge, a district defender, a district attorney, or a cop, or a substance abuse provider or a social worker who's ever said they've got enough resources. That's not in the nature of the work that we do. I think we clearly need more inpatient treatment facility. We need outpatient treatment facilities. We need to have a warm handoff from the people who, who are not going to stay in jail, but, we have made no serious efforts to try and provide housing or transportation or the kind of supports that they need. And yet, and here's the difficult part, so I'll say the difficult part out loud. You need resources and you need accountability, okay? There needs to be more accountability across the board in the system. I mentioned the fact that I've doubled the capacity of the pre-prosecution diversion program in this county. And right now the acceptance rate is less than 30%. Why? If the prosecutor in this jurisdiction is offering to divert somebody out of jail and into treatment, why aren't they accepting that treatment? It's not a resource problem, it's a structural problem. And it has to do with the incentives that we create inside the criminal justice system. And so I am all for more resources so long as accountability for all of us is included in that.
And if we could just add, I am a drug court judge. I also sentence other people who may or may not be in drug court. And I will say that it's not always the defendant who's not willing as much as the state or the attorneys, particularly the state most frequently, who is opposed to diversion because they feel they want jail. So I think there's a lot of miscommunication about what these programs do. I hear Mr. Torres saying he's tried to increase that participation, but I haven't seen that in the line attorneys that appear before me on a daily basis. So.
Judge, in the last quarter, I have 150 open diversion offers that haven't been accepted.
Interesting.
And I mean, I don't know how to elevate that for the court to see it, but I want the community to know that there are people we are trying to divert from this system and trying to get help that aren't getting help. And it isn't the fault of prosecutors, and it isn't lack of resources. There's a structural problem in this system that needs to change.
Well, so what do you mean by that? Spell it out for us.
Well, we hear a lot about law enforcement and prosecutors being unwilling to participate in a diversionary framework that takes nonviolent people and offers to get them treatment and help. I can't explain why those offers are rejected, but I think part of the issue has to do with the lack of predictability about what will happen inside the formal system in Bernalillo County. And I live in a jurisdiction that, despite the fact that we subsidize participation in these programs, despite the fact, and most of you may not know this, I was the first jurisdiction in this state not to require the admission of guilt for a substance abuse conviction. The only prosecutor in this state to do that. And yet the enrollment for pre-prosecution diversion in this county trails every other county in the state. Why? And I wish I had an answer, but I don't have an answer. But what I can tell you is it's not for lack of willingness to participate in that kind of framework.
Judge Morgasbacca or Judge Leos.
If I could just jump in, there's a distinction here that I think is important to point out. So what DA Torres is talking about is the PPP program that's run through the DA's office, which is very different from the programs that Judge Wernersbach and I do, which is run through the court. So I can tell you from my perspective at young adult court, right now we have about 35 participants. We have about 8 people that are in the screening process that have to basically work hard to be inducted in the program. And I'm sure that Judge Werner's box numbers are pretty close to what we're seeing at young adult court. Now, that's different from the PPP program that DA Torres is talking about. Like I said, that's run through the DA's office. That has nothing to do with the court. I can tell you from the court's perspective and from my perspective with young adult court, we are always scrambling to get buy-in, to get more people in my program. Always.
We just hit the time. Tom, do you want us to keep? Okay. Why don't we open it up to folks out in the audience? If you have any questions, we have him with a microphone ready to take those.
Hi, I just want to agree with the judges. From being a convicted felon myself, many years prison does not work for anyone that's addicted to drugs. The lifestyle, anything that, it's just like a network of more and more resources. Instead of correcting us, it's like you're doing us a favor. So if we could get more people that, like myself and other women and men that are here that are recovering addicts, to give hope, because there is hope. We do change, and if the system would just stop seeing us as a number or as our past, and start seeing us as a member of this community, then other people would actually want to change. But when this door keeps getting shut in your face when you're trying to change and you get out and you have a felony and it's like you can't even get a job, what else do? You got to survive.
Thank you for sharing your story with us. That takes a lot of courage to stand up in front of this group and do that. We had another question over here.
I'm still a little bit confused, Mr. Torres. Can you explain a little bit more about what you mean by structural? Because there seems to be a bit of a difference from where the courts are at and you're at. So please, can you elaborate more on structural and what that means?
Well, take a couple of the programs that you have. You have programs like PPD, which are pre-prosecution diversion, which Judge Leos correctly points out does not involve the court. It's an offer from the district attorney's office to go under what is essentially extended supervision in our office, access to treatment, regular drug testing, things of that nature. It is generally considered to be the earliest, the least consequential, the most supportive alternative program for people suffering from addiction issues. When we first tried to expand that program, first we were told people wouldn't enroll because they didn't have money. So we paid for it. Then we were told people wouldn't enroll because they had to admit their guilt of possessing a controlled substance. So I eliminated that. And yet the acceptance rate for enrollment in that program still is not broken 30%.
When
Now,
you say acceptance rate, acceptance by who? By the client?
The defendants.
Okay.
The defendants themselves. So what I'm trying to tell you, which is difficult for people to hear because it's contrary to the narrative, because usually the narrative is it's prosecutors and police officers who don't support diversion. And what I'm telling you in this county, that is not the case. What I do not understand, and I'd love to have an explanation, I don't have an explanation for you, which is if I'm offering to get someone into treatment and into a program that will result in their sobriety, their exit from the criminal justice system, putting their lives back together, and no felony charge, why is the acceptance rate under 30%? In other jurisdictions in this state, for example, the southern part of the state, they have acceptance rate 60, 70, 80% in that same program. So what is it about Bernalillo County that there is an incentive created in not accepting an offer of help from a prosecutor who's willing to extend that offer? Because you're exactly right. I'm not trying to send people who have substance abuse issues and who are not violent to a place where they're going to get worse, they're not going to get treated, and they're going to impact community and harming people. That's not why I became a prosecutor. But everyone needs to have the facts and understand that there are a lot of us who are trying to do this diversion work, and we're not getting a lot of assistance
And they're
from other parts
choosing
of the system.
jail instead. Or
They're
prison
choosing to
instead.
just move forward with their case. And in most other jurisdictions, they wouldn't make that choice, but I don't know why they're making it here.
Danielle, one more in the back.
Can I just jump in real quick while I want to get to the questions, but one of the things that I didn't touch on that I think is important from the federal system that we have largely overlooked in this district is we don't really have a reentry program set up for people when they get out of federal prison. And so while we have much more success in securing long terms of incarceration, I think your point is a very good one, which is, what are we doing? I mean, people are released as they should be released, and what can we do to help better position them? And we have federal probation officers, and we have supervised release. But and Mr. Ubaez agrees with this, as prosecutors, we have a role to play in the reentry, and so we're working on it. It's not set up yet, but I think that's an important point to make sure that we are providing what we can do to help that reentry, to kind of help stop the cycle. And so more to come on that. Welcome your opinions and thoughts. But I thought that was important to your point. So I didn't mean to cut into the question.
One more question.
Hello. Yes, I have a question. So again, I am a recovering addict and have felonies as well. Why, since we have peer support in the community now, why don't we have a panel of peer support workers or people that have been there, done that, and get ideas from us if we are working as a community? I see a lot of people up there, but what about the people that have broken the addiction, have been through the system? Get ideas from us so that we can help our community get back to where it needs to be, or just have us help other people. We are willing to help. Wraparound programs. Why is there not something in MDC, the prisons, like 30 days before you get out, helping people put a plan of action together, letting them get resources that they need, or where they're going to go, whether it be CCP, drug court. Let them get the resources so they can have a plan of action. They know where they're going. They know who they're talking to. They have the point of contact. They have the person they need to reach out to. That's what really needs to be put in those jails, especially MDC. And peer support workers are willing to work with our people to get them back on the right track. I can help you because I'm going to share what I've been through, how I got my kids back, how I put my life back together. And coming from peer support workers, we can help this community.
So if I could real briefly, I think that's an excellent point, and Young Adult Court has built in a peer support program, and you will see some of them around here today. They're actually present here helping out at the summit, and I couldn't agree with you more. It's one thing for someone like me to get up here and talk about what I know and what I've experienced versus somebody who's walked in your shoes and has lived that experience. So our Young Adult Court encourages our graduates to stay on as peer mentors. They do all kinds of things for our participants, whether it be a phone call, drive them to an appointment, help them with childcare. Just be there as someone that they can call who's had that experience. So 100% agree with you. We could use more of that.
All right. Thank you so much to the panelists for coming on. It got a little bit heated there in the end, but I think these are important discussions. Thank you to the audience for participating in that. You really helped out.
And thank you so much to Danielle for doing this. As you can see, this is not a one-answer topic, is it? We don't have one answer. You can't just take the pills off the street and be done. It doesn't work that way, right? Okay, thank you very much. You all very informative. Thank you so much. Don't forget the resource room. We are going to take a 30-minute lunch break. There are food trucks out on the plaza if you're interested, if you have a coupon, or even if you don't. Please come back. Our next panel is community members, community resources.
hello out there in our live stream. My name is Janessa Ruiz. I'm an engineer and firefighter with Bernalillo County Fire, on the floor today at the summit, doing interviews with some of our guests, our panelists, and just about anyone that we could go ahead and talk to while we're here. And I got next to me, go ahead and introduce yourself to our public.
Hi, I'm Raymond Polwiwold.
And so far you've been able to see this, be here during the summit, listen to the panelists, and get a feel for what we're trying to accomplish here at this summit. Can you give me a little bit about what so far you've taken away from everything that you've heard so far?
Well, first and foremost, I'm happy to be here and seeing the resources that are outside in the front room, but even more impressed about how the people came together today and seeing this large room filled about addressing issues in our communities around this fentanyl and opioid crisis pandemic that we're all a part of. But hearing the panelists, panel A, panel B, and looking forward into panel C is the information coming in. I was impressed and happy to hear the real talk starting to be presented by the panelists, but also now with the participants. Go ahead.
So what would you say is why would you say something like this is so important for the community to, one, understand that this is a problem, and two, that a summit like this has to offer? Why do you feel it's important our community knows this?
Well, I think that everyone is impacted by this, and that's what we're hearing, but I think sometimes to be able to speak openly and honestly about the real issues, because we're all connected with someone who's going through this. We're hearing the numbers rise, but this isn't the true number, I believe, in my thoughts. I think that there's a lot that still needs to be addressed in real ways, and by being able to take that courage now to be able to move in the direction that it needs to address this ugliness that is in our communities, this fentanyl. You know, we heard how it's taking our youth, our young ones, but it's also taking our elders. It's taking everyone. And, you know, it's just an ugliness that sometimes can be hard to really talk about in a real honest way.
And that's why I'm glad that we had our panelists come out. We've had individuals who have told their own stories come out and share with our audience, not just in person, but online, all the experiences that they've gone through. And I think once it's out there, now we could have an open conversation. I think something like that is so important, and we appreciate individuals like yourself coming out here and being part of this whole thing, because that's what's going to make the difference, is that we create that awareness and we spread that message of what we can do as a community to try to get beyond this. You know what? Thank you so much for joining us, joining me for this little interview right now, and joining our membership out here, for all those that are watching live right now. So we're going to go ahead and cut away. I'll be back in just a little bit with another interview. And again, thank you for coming out. For all those that are wondering, you guys could follow us on all our social media with Bernalillo County and associated entities, as well as joining us here today at the summit in downtown Albuquerque at the Civic Center. You guys can find it. We have food trucks and many things available. Not just that, but also the ability to come in and listen to our panelists and find out how we can overcome this issue of fentanyl addiction. Hello again, guys. I am back with another interview, and I want to go ahead and let my guest introduce herself. Can you tell our audience your name?
My name is Melinda Schultz.
And you are one of the guest participants over here. You're just coming to watch the panels, correct? So far, what has been your takeaway from everything that you've heard the panelists say so far?
I think that one of the biggest takeaways is how from all different areas in the community, whether it be judicial or whatever, that everybody's coming together to try to open the conversation and open a dialogue. Something else that impressed me is just the sheer number of people who are attending has really been a pleasant surprise.
Yeah, I believe I heard some initial numbers, and it was over 700 people had registered for this event, which I think is impressive. But, it really speaks more towards why something like this is so important, that the community not just becomes a part of and active in, but also why it's so important for the message to get out, which is really, I think, the underlying goal of all of this, is that we need to create and raise that awareness and connect people with those resources. But you being an attendee of this event, what do you feel is why something like this is so important for the community to know about or be part of, or for this to happen?
Well, I think there can be a lot of false information out there. And so coming together like this, hearing the same thing at the same time, is a greater understanding. You can't fix a problem or help a problem unless you have accurate information.
That's very true, and that's something that we need to get across, and that's why we have some of the greatest experts in the field that are from New Mexico, even from outside of our state, are coming over to talk about why this is such an epidemic and what we need to do to make sure that we could grow and move past this as a community. Is there anything that you want to say to the community, maybe some advice or something that you learned or felt was very important that anyone should know about what's happening right now?
Well, I think that it's just something that it's across the board. It's across the board. It's not just in one neighborhood. It's not in another neighborhood. It's not in one high school versus another. It's across the board. And we need to all come together because it affects the whole community, socioeconomic classes, everything.
I think you are absolutely 100% right. So if any of you guys want to find out any more information about it, you could look up any of the organizations that have come across our panelists or that have been here in these interviews right now. You guys could find them, and we're connected all through the fentanyl crisis to try to make sure that we work together and make that happen. So thank you guys for joining us in this live interview. We'll be back on the floor here in just a couple of seconds with one more person to talk to. See you guys here in a bit. Hello again, everyone. I am back with another interview and with someone who's dressed rather dapper today. Go ahead and introduce yourself to our audience if you could.
Hi, everyone. My name is Jorge Estrada. I'm with Bernalillo County Communication Specialist.
And, you know, this whole platform took a lot of entities to put together, right? This was not just put together by one township, one county, one anything. There's a lot of individuals, a lot of entities involved in this. Is that correct?
That is correct. It was all hands on deck. With everything that we're going through, we wanted to see how many people were involved and interested so we can get the word out there to everyone.
And something that I've been asking a lot of the individuals in these interviews so far is what has been your biggest takeaway as far as when you start hearing some of this stuff from the panels?
You know, a big takeaway for me personally is just a lot of people don't know all the resources that we have available to us. A lot of people who are present here today, you know, stopped and would ask a couple of us, hey, where can I get more information? And that's what's great about the room next door is you have resources. If you have someone who is battling addiction or anything with your own organization, talk to them. Get more information. Let's get the word out there. Take that home with you, and let's just make this a big thing.
And I think that's been very important to relay to anyone or that is suffering through this addiction or has family members that are suffering through this addiction, that there are resources. The help is just around the corner. And you're absolutely right. One of the great functions that is part of this summit is the fact that we have that resource room right next door. So it's not just panelists that are up here telling you their opinion and giving you really important information, but it's also organizations that are available and ready to assist you at a moment's notice. And even if you're not ready today, they can help you get ready for tomorrow or the day after, whenever you're ready to take that next step in battling this crisis. Why do you feel as though something like this summit is so important to the community?
This is just the beginning, is the way I look at it. The summit was something that was needed a long time ago. We're doing it now, and we're going to continue. We're going to go off this and do other resources that we can get the word out. So this was part of something big, and it's nice to be a part of that.
And I think the organizations that have been involved in this, whether they're the panelists or the resource room, have really gone all the way. They've definitely want to make sure that they are putting their best foot forward to make sure they can help any way they possibly can. You know, and I'll go ahead and let you close up this part right here. Is there anything that you feel as though some advice you could give our audience out there?
Absolutely. If you know anyone or yourself are battling addiction, talk to someone. Again, there's plenty of resources. Make that call. And again, we're here to help.
Well, I'm going to go ahead and cut off for right now. We're going to be back with another interview here shortly. Again, if you guys want to join us, we're over here downtown at the Civic Center in Albuquerque. If you guys want to come, anyone is more than welcome to come and be part of this event. You don't have to be attached to any kind of organization. You don't have to be suffering through this addiction. Even if you just wanted to come and get more information and know what some of this or what we're doing as a community to try to make this whole situation better. Again, that's downtown Albuquerque at the Civic Center. And so I believe we got food trucks. We got a lot of great information and great resources. So I'll be back in just a second with another interview. Janessa here, talking with another one of our, are you one of the panelists today? Yeah, one of our panelists today, Erica, I believe, right? Can you tell them a little bit about what you do, why you're on the panel today?
Absolutely. My name is Erica Beta. I'm with the New Mexico Department of Health. I am the statewide overdose prevention supervisor. And the reason why I'm on a panel today is really just to discuss the importance of awareness of increasing access to and use of naloxone across the state and the ability it has to save numerous lives, as it has already.
So as you've been here and hearing some of the other panelists go up and speak, what has been one of your biggest takeaways when it comes to just listening to what they have to say?
The biggest takeaway really has been that it doesn't take one individual to make a change in the community. It really does take a lot of individuals locking arms to make a deep impact and to combat this serious issue that we have going on right now with overdose deaths and fentanyl.
So what would you say is, why is something like this so important for the community to have?
Absolutely. Because individuals and families are heavily impacted by drugs and alcohol every day, and lots of lives are being lost every day because of overdoses. And if we can bring awareness to the issue and bring education to the public, then hopefully, just maybe, we can save families.
You know, and that's always the overarching goal, right? We want to make sure that no one has to suffer through this, and we want to make sure that people understand that they don't have to suffer alone. Not only do we have great organizations, but we have great resources and outreach organizations that could help connect people and get themselves situated in a much better place. And sometimes taking that first step is so hard. And I think something that you had mentioned just a second ago about how it takes a village, it reminds me of that quote, you know, it takes a village to raise a child. Right, but I think it could be the same thing. It takes a village to help an individual who's just, they feel as though they don't have anything else, that they're grasping at straws. There's no other direction that they can go. And I think it's organizations and entities like what you're a part of that's helping us to take that next step and making sure that we start battling this in a way that's effective and concise and meaningful, and hopefully we can get as many people the help they need and the treatments that they so desperately need to get to. So I'm so glad that you were here part of it and being part of this interview. We actually have a rose here for you for being part of not just my interview today, but being part of such a big difference and a big impact for the community. Is there any last thing you want to say to our audience?
Together we can be the change.
Absolutely. So this is going to be our last interview while we're on the floor right now. We're going to next time you guys see us live, we're going to be on the panelists are going to come up with the next section. I invite every single one of you guys who are interested in being part of this live, come down to downtown Albuquerque at the Convention Center. You guys are more than welcome. We're on the second floor in hallway A, B, and C, and you guys could come and hear her talk and speak on such important information. So as always, remember everyone, stay safe.
services for anything you might want. So it's a great way to get some information. All right, so our community panel is ready to go. And again, we have someone from our community joining us, very concerned about the community, who's going to moderate for us, Shelley Ribando from Channel 7. Shelley, it's yours.
Do they do it back there, or do I do it? Oh, there we go. Guess I'm not as loud as they tell me. If you watch our newscasts on any regular basis, you see how many stories we do on fentanyl and how it has so sadly affected so many people in our community. We had, even just last night, many stories in our 10 o'clock newscast, and listening to parents and just seeing the devastation it causes so many families. So I'm really glad to be here today, and I hope you enjoy this program. Looking through our panel of experts, it's an amazing group of people, so I'm honored to be here, and thank you. I'm going to go through and introduce everyone who's here, and if you just want to give a slight raise of your hand so everyone can see who you are. We're going to start with Dr. Snehal Bhatt. He's the Chief and Fellowship Director, Addiction Psychiatry Associate Professor, Psychiatry and Behavioral Sciences at UNM. Thanks for being here. We also have Margarita Chavez Sanchez, the Director of the Bernalillo County Behavioral Health Department. Gilbert Ramirez, Deputy Director, City of Albuquerque, Family and Community Services. Dr. Danielle Duhigg, Medical Director, Duke City Recovery Toolbox. Dr. Laura Rifka-Stern, Medical Director of COVID Response at the Westside Emergency Housing. Dr. Angeli Taneja, who is the Executive Director of Casa de Salud. Jennifer Weiss-Burke, Executive Director, Serenity Mesa Youth Recovery Center. Corey Lee, Executive Director of Crossroads for Women. Erica Abeda, Statewide Overdose Prevention Supervisor for the New Mexico Department of Health. Jessica Brooks, the Albuquerque Public Schools Crossroads Counselor. And Steve Decker, Chief Executive Officer for Heading Home. All right, let's start first. What we're going to do is I have some questions here, and I'm going to direct them to particular people on the panel. And if we get through a lot of the questions, we're going to open it up also to any of you out there who have any particular things you'd like to ask a member of the panel as well. Let's start first with Dr. Bhatt, Dr. Stern, and we're going to start with how you exactly would describe fentanyl to clients who ask, why is this a different drug? Exactly what is this? And how can parents talk to their kids about fentanyl in particular?
I can start it off here, okay. Snehal Bhatt here. So I think the first thing that I start out by saying is that while I may know a lot about it from a medical standpoint, the patient really knows, they're the experts, right, in their own lives. So I think even with the discussion about fentanyl, I like starting out just by asking them, tell me about how this has impacted your life. Mm-hmm. You know, what kind of relationship is there between you and this substance, right? Well, you know, just understanding more, right? Because oftentimes, right, and I think all of you guys in the audience can relate to this, that our patients just have so much more, right, than that, just that addiction, right? When I think about my patients, many of them have like trauma. They've been resilient. They've overcome that. So I think it's important to acknowledge that. And then with their permission, as I go into fentanyl, some of the big points I try to hit, one is that if you don't know what you're using, assume that it's fentanyl at this point in 2022. Because that's what's out there, as people have said, right? Whether, even if it looks like a blue oxycodone tablet, chances are it's fentanyl. And the other point I hit is that while fentanyl is an opioid, just like oxycodone, just like heroin, it is a far more potent, it's a lot stronger, and B, it's unpredictable, that it's not manufactured by a drug company. We don't know exactly what's in it, right? So keep that unpredictability in mind. And then really moving towards harm reduction as the third thing. So maybe kind of not using alone, having Narcan with you or people you're with, right, as a harm reduction strategy. And last but not least, I really try to hit the point that treatments work, our medications work. How can we engage you in treatment? What might be the barriers? What might be your fears that maybe we can address? And really taking that approach, I think, is the best way to go.
Okay.
Thanks.
And Dr. Stern, how about you? How are you helping the folks who probably are scared to even ask for the help? What advice are you giving them, especially maybe parents who are coming in and are confused about what they're hearing and they're concerned about their own children?
Sure.
I think the most important thing is to just keep dialoguing with your children and, you know, trying to find out. So many people get started on fentanyl because a friend gives them a pill and says, here, this will help you feel better, whether it's a lot, I've seen it with adults with chronic pain, and somebody hands them this pill, and then they're like, wow, that feels good, can I get another? And so they were already struggling, and I think with children, it's the same thing. I mean, when I had teenagers in the house, and you find pills in their backpack. It's really scary. And now with fentanyl, it's scarier. I don't know if anybody had brought up about rainbow fentanyl, but there are bags and bags out there of multicolored pills that, look almost like Skittles, right? That I think are targeted for children. So, ask. Have your kids, has anybody given you a pill? What have they told you about them? Try to engage and see what people are doing.
Okay. And Jessica Brooks, you're with APS, so meeting and talking to students every day, any advice that you're giving them, or even teachers, some signs to look for in the classroom?
Yes, thank you for this question. I am a crossroad counselor, and there are 13 of us within the district of APS, and our sole job at APS is to provide education, prevention, and intervention around substance use. And the 13 of us reside at the high schools, but we also work with our middle schools and our elementary schools too. So we have daily conversations, not only with our students around substance use, but also with our parents. And many of our guardians and our families and our caregivers that we talk to and work with daily, they're receiving a call from the school that their student might have been caught with drugs, paraphernalia, or maybe are under the influence. So many of the parents, guardians, and caregivers that we work with are scared. This is the first time that they've heard that their student might be using or involved in this activity. So we're opening up the conversation, helping them understand the risk that their student might be facing, helping them connect with services. We work with the UNM STAR Clinic, Serenity Mesa, and many of the other partners that are here today too. So we help them have that conversation, because this might be the first time that they've talked to their student or child about it, but we're always encouraging lots of conversation, early conversation, talking about some of those warning signs that they might see with their student. We also do prevention, education, intervention with our staff, all of our faculties at all of our schools, so they know what to look for as far as signs and symptoms of use.
Can you name a couple things really quickly if there's any parents out there looking for like the key signs maybe they should be looking for?
Sure. I mean, we look for change in habit and behavior. So a student that might be engaged in school has all of a sudden taken a drastic turn and isn't engaged, doesn't want to get out of bed, doesn't want to attend school. Maybe some of their passions and their hobbies, they've let those fall away too. So they're changing in behavior, changing in hygiene habits. So somebody who would get up in the morning and shower and get dressed, that child might not be interested in doing that at all or whatsoever. Change in friend group. So all of a sudden, the child might be hanging out with kids that you don't know, doing activities that are something that you're not familiar with your student doing. And when we work with parents, we instruct them to look for a variety of change in this behavior. It's usually not one thing. It's not that drop in the grades. It's usually a couple things that are going on. So we're looking at the whole picture, taking a look at the students, making sure that some of those habits that you know that your child is doing, if it's changed, that's worth looking into. That's worth having a conversation.
All right, very helpful, thank you. Next question, what are some of the dangers of actually combining the fentanyl with other substances, such as alcohol, maybe benzos even, or methamphetamine? Dr. Duhigg, we're going to start with you.
Thank you. The more intoxicants anybody uses, the bigger the risks, right? Especially if the other things that they're using also decrease the drive to breathe. I mean, that's usually what lands people in the office of the medical investigator and leads to the death. So combining benzos, things like Xanax or Klonopin or Valium, with any opioid, really, but especially fentanyl, they work together. We say that there's a synergy It's twice as much effect on not breathing. But other things happen too. So a lot of people are finding now that methamphetamine, for example, and fentanyl are being mixed. And they might have thought they were just getting one or the other, but then they find both, or we find both in their pee and have a conversation about it. And now that's not increasing the likelihood that they die from not breathing that mixture, but now, especially if they continue to use both together, now they essentially have two addictions that are working together. They're withdrawing from fentanyl, opioid withdrawal, and withdrawing from methamphetamine, the meth withdrawal. And it's not like, well, if you just have an addiction, you have kind of one addiction and it doesn't matter what flavor it is. Really, all the different addictions are different illnesses or different diagnoses. We treat some of them, some of our treatment for the different ones are similar, but there are also some differences as well. And I find in my clinical experience, people who are using both struggle a lot more to get off of either one than people who are just using one. And alcohol goes into that same mix. Alcohol, like benzos, decrease our brain's desire to breathe. And so mixing alcohol with blues or with fentanyl can be very dangerous. Even, mixing amounts of alcohol that weren't previously dangerous or weren't previously problematic for a person. We now add the opiate to that, and it's a totally different story.
And Dr. Stern, similar question, are you seeing this happen often when you're relating to patients? And
Yes.
Yeah.
And again, we see it that people don't know that things are being mixed, or they think they're on oxy, and we do a drug screen, it's negative, and we go in and tell them they're on, taking fentanyl, and they didn't know. We see a lot of people now with meth and opiate addiction, and the mixing is confusing to them because, they might be used to the withdrawals from methamphetamines, and then they're having other symptoms and they don't understand what those are.
Okay. I've heard from viewers, from parents who will contact us, they feel that this is so easily accessible now. Jennifer Burke, can you speak to that? How are people mostly getting it? How do they know the contacts, or are they just looking this up on social media? Where do they begin?
Well, I think we've heard a lot of talk this morning just about the different ways that people are acquiring drugs these days. And it's not like it used to be where you had to go to a bad area of town or you had to, find somebody hanging out on a street corner. Now, you can get it through social media, like the DEA was talking about this morning with Snapchat, and then the new app that was mentioned this morning that I've never even heard of. So, there's a lot of conveniences out there that didn't exist before. And so for our young people who are very IT savvy and very used to using that type of technology, it's nothing for them. Now, us as adults, we don't know half of the ways they're getting it. And we don't know what they're calling it because those, the emojis that they're using. I run a treatment center called Serenity Mesa, and we had our clients here this morning. They were sitting in the back, and so they saw Carlos's presentation from the DEA, and the first thing they said to me was, how does he know all that stuff? So kudos to you, Carlos. But they were like, oh, and by the way, those emojis are no longer being used. So you're right. There's new emojis out there, but they know. And I told him, I said, well, we're like 10 steps behind you. Like, we're trying to keep up, but you guys are the ones that we need to kind of learn from. And because it's so easy right now, we have an apartment program, so we put some of our clients who graduate our program into apartments, and we provide rental assistance. And we were visiting one of our clients a couple weeks ago, and there was a homeless encampment that was set up across the street, and there was young people riding bicycles with backpacks that were just going to these homeless encampments and selling them drugs right there in broad daylight. They weren't trying to hide it. They weren't ashamed by it or anything. They were just riding through, so that's, they're delivering them right to wherever they're at.
All right, thank you. And Margarita Chavez Sanchez, where do you think a lot of the kids in particular are getting it from? I know I've had other parents tell me that kids know the locker to go to between classes. It's frightening to hear that, right? That there's not some more control and how this is not being noticed. But what are you finding?
I think I really echo what Jennifer said and what's been said in earlier panels today, is that we tend to be about 10 steps behind, right? So by the time we found out about that locker, the locker's been cleared out and it's now at a different locker or in a different gym bag. And I think really in young people, it's difficult to navigate because I do Snapchat, but I can do a snap, and that's about it. I can't do all the other fancy stuff. And I think I'm technically savvy, but you know, my daughter can do a whole lot more on that. And I think it's really important to just recognize the value of having conversations, right? The value of having conversations with your children, with young people in the community. I think somebody said earlier in one of the panels, understanding when something's off, right? Having relationships so that you can understand when something's off. So now you have a space to ask those questions. Now, in the work that we do at the County Behavioral Health Department at the CARES campus, we are seeing access in a different way than maybe we have ever seen with previous substances. Our clients have to navigate ways to access heroin or access methamphetamine, but fentanyl, they can get immediately and they can get it much cheaper. And as we've heard, the potency is at a much higher level. And so for folks who have been navigating addiction and maybe they've been using heroin for many, many years, maybe they started using fentanyl unbeknownst to them, but now their tolerance has changed. And now their request for a substance has also changed because again, the way that their body is reacting to the new substance is completely changing the morphology of their whole body, right? It's really changing the way that they operate on a daily basis. And it's so much easier to access fentanyl than it has been for other substances in the past that I think that's why we're seeing such negative impacts in the community.
So many times people hear about Narcan being, you know, the magic that, you know, can you have it on hand at home and how do you get a hold of it? Will it always work? How does it work? How is it administered? Should every parent who has a child have it in their medicine cabinet? How do we get it? Erica Abeda, let's start with you.
Absolutely. Naloxone works by blocking the effects of opiates on the brain. It only works if there are opiates in the system and not with other drugs, just to make that clearly known. It's easily accessible in the communities, and we work hard to educate our community members on how to recognize and respond to an overdose and increase the access to and use of naloxone in our communities, because we think it's really important. Sometimes there's a lot of misconceptions that people who need naloxone are only individuals who have substance use disorders, or communities that are large only deal with overdoses. And that's a huge misconception because substance misuse impacts many individuals. It impacts large communities, rural. It affects tribal communities, large and small. There's no socioeconomic class that people, you know, only those type of people will potentially suffer an overdose. It doesn't discriminate against age or gender. I recommend every household have Narcan on hand, naloxone, because it's so important. You never know. Sometimes the thought is, well, only individuals, again, that are battling substance use disorder are the ones that need it. But no, it could be a grandparent. It could be someone who has been prescribed a prescription painkiller that needs to have that naloxone. Plus, you never know when you're going to encounter someone that is experiencing an overdose. And it's really important to have it. And it's so easy to administer it. I'd like to take this moment real quick. I have a visual here. A lot of folks, when they get it, and by the way, this is largely available in communities across the state. As a Department of Health, we worked aggressively to train out community members who then become Narcan hubs in the community. Our harm reduction program does the same. So it's easily accessible and in many cases free. And so when you have naloxone, you open it up, and a lot of individuals just simply get it out or try to pull it out like this. Just a quick note, tip. Because I'm all about the tips, opening it up and dropping it in your hand, because this little plunger is so easy to just click. And so it's easy, just place it in the nostril and press it. The really cool thing about this is, again, it works to block the effects of opiates in the brain. We highly recommend that you wait 2 to 3 minutes before administering an additional dose. And because of fentanyl and its potency, we acknowledge that it might require more than 1 dose of naloxone, and again, waiting 2 to 3 minutes. But this has largely become available across the state.
Thank you. Dr. Bott, if someone oh yeah, Dr. Stern.
Oh, and then,
Did you want to go first?
Sure, go ahead.
I just wanted to add, Albuquerque Public Schools has put Narcan in all of our high schools, so we do have that available for our, in the health office. Also, the Crossroad counselors do train staff members, administrative teams, and I'm at Atrisco Heritage Academy High School, where we have 2,200 students in the South Valley. And this year I've opened up Narcan training for our students because they know that they can save a life when they get home, when they go to a party. If they have exposure to fentanyl, they'll be prepared. So Albuquerque Public Schools is also fully prepared.
And to add to that, there is no harm for folks who use it, even toddlers, high schoolers. You can use it on anyone, and so it's really clear to make that understood, because some people might think, well, it may not work with my body or it might harm me. No, it's going to help, if anything.
Yeah, great to know, because that was
make
actually a question I had. Dr. Stern.
I just wanted to say that recently a friend of mine was prescribed some narcotics after surgery and was given a prescription for Narcan, but it cost $100. It was not covered by his insurance, and so he didn't get it because it cost too much. And so I really want to put out there, you know, the importance of having Narcan available for free or for a very reasonable price.
Okay. Yes.
And if I'll add, let me just get a show of hands. Who has Narcan in their home? That's great. Who does not? Okay, anyone who has your hand up, you can go into the resource room, go to the back wall where that wellness table is, and we have 200 kits available for anyone who wants to take it home. You can get the training immediately at the Department of Behavioral Health table, and you can go home with a free Narcan kit. So that can happen today, right now. Now, if you know someone else who needs Narcan, or if you use it and need another kit, the Department of Behavioral Health Services at the CARE campus at 5901 Zuni is a community distribution site. So anyone who gets a prescription who doesn't want to pay, right? Nobody wants to pay $100 when you can get it for free, right? Or if you know someone who is using, or if you need something to have in your home. My grandmother, who was undergoing cancer treatment, she was on opiates during her treatment. She took a pill, went to sleep, forgot she took it, woke up, took another pill, and she overdosed at home. And so very, very fortunate that my aunt was able to see what was going on quickly and call EMS, and they were able to come in on site and use Narcan on her and save her life. But if we had had that Narcan in our home, there would have been much less of an impact because that could have been available immediately. And so, again, I provide that little bit of a personal story because that's not the picture that we think of when we use Narcan, right? And so if you have any type of medication access in your home that is opiate related, there should be a kit there. If you work in the community, you should have a kit in your vehicle. If you work out with a population who's needing this support, Narcan is available to you. So another plug, right into that resource room in the back by that wellness space. We have Narcan kits available today, or you can come to the CARE campus for those at any time.
And that distribution site, real quickly, on Zuni, that's free and open to the public at any time?
It's free
to
and open
give that
to
away
the
on
public.
The news for some?
Yes,
Okay.
24/7, 365. We have staff on all shifts trained as trainers, and they will do a 3 to 5 minute quick training on Narcan, and you can take a kit home immediately.
Amazing information. We'll
And
make
to
sure to
that-
put that on the news, yeah.
Just kind of jump in. So I think really want to highlight a couple of points, right? One is we want naloxone out in the community. One of the things that I tell, right, sometimes I'll talk to a community member or patient and they're reluctant, but I don't need it. And my response is, it's like having a fire extinguisher. Hopefully you'll never need it, but if you ever do, you'll be really glad you have it. I've carried it in my car with me for the last at least a couple of years, and I've had the opportunity to use it on 2 different occasions, right? Just being in the community. A few years ago, we did this study at our clinic, right? So I work at the UNM's Substance Use Disorders Treatment Clinic, where we started training all of our patients on naloxone and giving them kits, right? As many as you need, use them, and we track them. And we followed them, and over several months, they reported, over 100 overdose reversals. But here's the neat thing, that in all except one case, it was our patients using naloxone on someone else and saving their lives. Our patients were in treatment. They weren't overdosing, but they had it, they knew how to use it, and they still had social networks, people they knew who were at risk. And right, and so it's a life-saving opportunity and also a way to empower our patients that you can be in this position to help someone. So we want to get this out. That's number one. Second, New Mexico has a couple of really good laws. One is a Good Samaritan law. So if you do use this on someone, you are protected legally. And we also have a standing order at the pharmacy. So you can go in there and pick up naloxone. The last thing I really want to highlight is the importance of calling 911. So say I overdose right now, and I, fall to this table, slump down on the ground, and Margarita, thankfully, is sitting next to me. And she uses this, right? I've got the kit here, and she administers it again. One thing that's really important is to still call 911. So the first responders can get here and give me definitive treatment, A. I may also have other things on board. Maybe I took a Xanibar 15 minutes ago that the naloxone is not going to do anything for. So they can help with that. And third, if I get connected with the first responders, they take me to an ER, I get connected with providers, that's my opportunity to get into definitive treatment. Naloxone's great, it just saved my life, but the next thing is that we want to make sure that I get into treatment. I get on one of those life-saving FDA-approved medications like buprenorphine, like naltrexone, like methadone, right? So by calling 911, you're also potentially creating that chance to get me into treatment, to change my trajectory long-term.
And let's talk more about treatment. Dr. Taneja, can you speak to how does one access the treatment? How long does someone have to, if they say, okay, I'm going to go in, I need the help? Is this a long commitment? Can this be done quickly? What can people expect if they're seeking the treatment?
Yes, I don't know if my mic is on.
Yeah, now it's on.
Okay, Anjali Taneja. I think treatment with medications like buprenorphine, which is known on the streets as Suboxone, methadone, these medications are incredibly helpful. Right now in the United States, 90% of people who could potentially benefit from medication-assisted treatment don't have access to it. There aren't enough resources in communities. There aren't easy ways to find out how to get treatment. There's a lot of stigma among families and communities that treatment is a crutch and not actually being off heroin, fentanyl, whatever other opioids. And that's something that we need to shift. We also need to shift how easy it is for people to get into treatment. We have heard all morning about emojis and social media and how cheap fentanyl is, and we are dealing with a problem that is only getting worse. Here in New Mexico, we had a zero wave before the pharmaceutical industry and doctors prescribing a lot of opioids. We had intergenerational heroin use, opioid use, way long ago. And then the next zone, or the next kind of phase, was pharmaceutical companies producing opioids, talking about how safe they were, how great they were for pain, doctors prescribing them a lot. And then we cracked down on that without opportunities, without enough opportunities to meet the moment on that. And so a lot of folks who were using opioid pain pills now moved to heroin, didn't know how much to use, didn't have easy understanding of it. And then we cracked down on that, and we, as a result of not meeting the moment with treatment and support and other things, have created, in some ways, this wave of fentanyl, and now a wave of fentanyl being mixed with a number of other medications, which are, or drugs, which are deadly. So our kind of like enforcement type attitude of a lot of where we're going with things is not working. It's only getting worse. And drugs are more cheaply available. We can talk about the cartels all we want, but we're not doing the work as we can as a unified community of providers, community of governmental agencies, to best meet the moment with treatment, love, support. A big reason why a lot of people use opioids is because they're in emotional pain. And what can we do to support them so they're not trying to escape that? A big reason why a lot of people use opioids is because it's just given to them. A big reason is they had a physical injury and now are stuck and they don't have a way to get out. We have to meet the moment, and during COVID, things have gotten astronomically worse. In the US in 2021, we hit the highest number of overdose death rates, 100,000, and 60 to 70% of those have fentanyl in them. I am grateful for the county and city and other folks putting this on, and this is a great awareness campaign, but we need to use this moment and this opportunity to make treatment as readily available by emojis, by texts, by we will go pick you up and bring you where you need to go, by love, by actually providing real treatment in jails and prisons. The State Department of Corrections has 0 medication treatment for people. We heard that in MDC jail, more than 1 in 5 people is coming in on fentanyl. We are not meeting that moment. We do have treatment options in the jail, but they are not meeting the need. We are not screening everyone, offering it. We need to find ways for treatment to be as readily available and as exciting, and also people showing each other that treatment works. I've worked with thousands of patients by this point in my career, with, maybe that's a little hyperbolic, hundreds of patients and many community members, and we ask them, what do you think would work? We have folks at Casa de Salud at our clinic saying, we need treatment in prison. We had folks there for so many years. Suboxone's $1,000 a film, and they're talking about how readily available it is. Well, let's bring treatment in, and then you won't have this black market there. We have patients stating, we need ways for someone to be able to text a number and get to a place immediately. We have in our current ecosystem no real way for someone to easily find help. There's a lot of acronyms for things that are available. There are a lot of clinics in which, and systems in which people are getting, as many people are getting turned away as are seeking help. We need to change all of that. So that's a little bit of a diatribe on that. But treatment works. The medicine buprenorphine, the medicine methadone, the medicine Vivitrol, all of those work. Buprenorphine is an agonist, so it helps the opioid receptors and is also a shield. It will block heroin, fentanyl, other drugs. Methadone is an agonist. These are excellent medications studied over many years with literally 50% or more overdose reversal rates, meaning people who are on these medications have a 50% less chance of dying from overdose. I don't know if there's any other medication out there that works that well. So that's really important for us to be able to move on fast.
Dr. Stern, thank you.
Thank you, Anjali. And I just want to point out that buprenorphine is an incredibly safe medication. It is almost impossible to overdose on buprenorphine unless you're completely opioid naive. So again, really important to keep it away from children and make sure if you're in treatment that nobody, that no children have access to it. People need to have safes for their medications, or if they're using, to try and do it safely. But buprenorphine itself is so safe to give, and there's just been, even within the medical community, a lot of fear about it, and the barriers that were put up in order for physicians and providers to be able to prescribe it were so high that a lot of them were turned off and were afraid. But really, it saves lives, and the risk with that is so low. So I just want to put out as well to the medical community, most providers need to understand this medication, it's safe, and it works.
All right,
Can I respond? Yes. One other part of your question was about how long should treatment be, right? And I think that's a question that a lot of people struggle with. Mm-hmm. We talked earlier about addiction as a chronic illness, and I think it's really important to continue to think of it that way. Right? When I have an infection and I get some antibiotics, the antibiotics cure the infection, and I'm good. I don't have an infection anymore. It's not a chronic illness. But like diabetes, like blood pressure, addictions are chronic illnesses. So really, we need to always be, I think, vigilant about it, no matter how well we're doing. The way that but you know, the idea of like, well, so do I need to be on a treatment forever? I think that's really overwhelming to people when they're approaching treatment. So what I say to people is I say, you know, how about we think about this for about a year? Let's try this for a year. A year is like long enough to change who you're hanging out with and learn how to cope with life's difficulties a little bit differently. And then let's revisit the topic, right? I'm not saying it's cured after a year. Usually a year comes by or comes around and we have the conversation and it goes like, you know, there's no way I'm getting off this treatment. My family trusts me again and like I'm doing really well and my health is good. And it's because of this treatment. Long-term use of these medicines that we keep mentioning, methadone, buprenorphine or Suboxone, naltrexone, there are no real long-term problems for our health. They don't hurt our body or anything like that. They are safe to be on long-term. So I think the other thing that can kind of be confusing if we're somebody who loves somebody in treatment is, hey, you know, you've been going to this clinic now for a year, 2 years, like, and you've been doing really well. Like, why don't you just stop? Like, you're done. And I think that message can come from a place of love, but it might not be the best thing for that person. It might be that you're encouraging them to get out of the treatment that is helping them do so well. And so just something to think about. Again, encouraging people to do something for their recovery long term.
Yes, go ahead.
If I can, sorry.
Oh, we'll take this question first. Go ahead.
Sure. I would just add, I think while all of this medication-assisted treatment is really, really critical, and we are strong supporters on the county side of all medication-assisted treatment resources, I think when we think about treatment, it has to be more than that, right? I think that there is a treatment mentality that's very, in some populations, very medication-centric, and that's even just on the physical health side, right? But just like needing a blood pressure medication to control your blood pressure, you also have to think about diet and exercise and lifestyle changes. So when we think about treatment in this conversation, we have to think about it in so many other ways, right? It's counseling. I think Dr. Duhigg mentioned, you know, the ability to just engage in healthy social settings, right? At our program, we participate in healthy parks and recreation, right, for healthy recreational activities, right? That's not something you traditionally think of as treatment, but teaching folks how to play basketball when they're bored, right? Or to engage with the right population. Those things are really, really important. And I'd be remiss if I didn't get on my cultural sensitivity soapbox as well, because I think treatment is also important. We must always think about people's generational and cultural trauma that brings them to that space, and how do we include culturally sensitive practices in that treatment as well. Is it important for me to meet with my curandera every once in a while? I think so, right? Is it important for me to participate in sweat lodges to help with my detox and help with my treatment? Is it important for me to get acupuncture and acu-detox, right? There's so many other avenues that really are important in that wraparound treatment that do nothing more but expand the reach that medication-assisted treatment provides. And so as the non-MD at this table, I just had to get on that soapbox and just recognize how important all those other aspects are of treatment. And above and beyond just the individual, it's working with the families, right? I cannot be successful unless my support system is also successful and their trauma is also addressed in that conversation.
You know, and earlier, Snell, you're jumping in. It's a great point, Margarita, right? We were talking about like prevention and talking to kids. And I think a big part of that is also strengthening those connections, right? Like there is actually data like that where they've looked at, for example, indigenous children. And if you strengthen their connection to culture, to grandparents, to language, that serves as a prevention against substance use, right? And I also think about it, for example, with my kid, like when he hangs out with his grandparents or learns his traditions, like that's good for his development. That gives him resilience that protects him. So I totally appreciate your point, and I agree with it, right? We want to treat the whole person, and we want to individualize it, right? That one thing, like, you know, may work for one person, but it may be totally against the other person's wishes or belief system, so we don't want to standardize it. And at the same time, if there are any like prescribers out there, right, in the audience, one thing I really want to emphasize is that, yeah, we want to add all of these things in, But we can't do any of it unless the person engages in treatment, unless the person stays in treatment. And what's the surefire way to get someone with opioid use disorder who's using fentanyl, for example, into treatment and get them to stay in treatment? Get them started on a medication, right? There is new data showing that as soon after you start someone on buprenorphine, the risk of dying from an overdose drops dramatically. So don't say that you have to see a therapist 6 times or go to 10 groups before you meet with a prescriber. If they have an opioid use disorder, get them on a medicine, get them started, start saving their lives, and then understand them, engage with them, understand them, and start adding in all these magical things.
I would like to,
oh, go ahead.
I'm sorry.
No, you're fine.
You know, we're talking about treatment, and I would feel totally bad if we didn't say some of the barriers to accessing treatment. And some of those barriers are stigma. We have come a long way as a state in addressing stigma and educating folks on listening with compassion and learning how drug dependency works and listening with non-judgment. But we have a long way to go. We have a long way to go. There are still folks that aren't accessing treatment because stigma still exists. It's real. And we need to do our part to link individuals so they can become ready to seek that change in their own lives and they can feel empowered to do so because they don't feel judged.
We touched on prevention, and with that comes education a little bit. Let's dive into that a little more deeply. How do you think it's best to approach the education angle of just preventing this from the start, right? Age to start, age appropriate, the kind of talks everyone should be having at the youngest age, and then on through, of course, middle school and high school. Dr. Taneja, do you want to speak to that first? Or anyone who'd like to speak to that?
I can speak to that
Okay.
a little bit. You know, and to kind of add on to some of the treatment discussion too, you know, we treat young people, so adolescents, ages 14 to 21, and you know, the access to treatment is just abysmal for that age group. It's almost non-existent. And so we work really hard, you know, with the providers that do exist in the community, but just to try and get our clients access to treatment, because it's very difficult, because nobody wants to deal with, you know, the attitude of teenagers, because it is really difficult to deal with that age group. But as you know, as far as just prevention, we do a lot of work with APS. We do a lot of work with the schools. I myself, as a mom, my son passed away of a heroin overdose when he was 18. So I know now the signs that I should have seen and the warning signs that I should have seen back then. I didn't know what those were then. And so, you know, one of the biggest things for us is really talking to parents and talking to teachers and schools and just trying to get the word out on what you can keep an eye out for, because, you know, catching somebody before they start using fentanyl, you know, catching somebody maybe with a mental health issue or behavioral health issue that they need medication for that's prescribed by a doctor is huge, because if you wait too long, they're going to find that medication on the street that's going to make them feel better, and unfortunately that medication is probably what's going to end up killing them. So I think, you know, prevention is key, and I can't emphasize that enough. You know, talk to your loved one, talk to your children, talk to your nieces, your nephews, your brothers, your sisters, whoever it is. Just keep, you know, really pay attention to those cues. And like was said earlier, you know, if the behaviors start to change, if there's something in your gut just telling you that something's just not right, pay attention to that, because it's almost 100% spot on usually.
I'd like to also add about the education component that the Albuquerque Public School Crossroads counselors do. We work with many of our community partners that are here today. October is Red Ribbon Month, which is a national event, and we have the DEA coming into many of our high schools and putting on different programs. We work very hard to bring in all sorts of different educational programming. The biggest part of our job as APS Crossroads counselors is education and prevention. So we go into the classrooms and do specific evidence-based curriculum based on the age group, but we also do assemblies, we bring in community speakers, we have resource fairs, we do evening events with our parents and our communities. So we're always looking to find different ways to address substance use and substance use concerns with our adolescents and teens.
And what do you think is missing, though? Perhaps at the elementary level? I know I have a daughter that just finished elementary school, and it was a wonderful school, but never was it mentioned that there would be any type of assembly or talk, like all the we talked about drug use at home. You know, kids would have things on the playground, and I'd explain the gummy bear situation, right? We were doing stories like that on the news about elementary school kids going to the hospital because of the gummy bears and, you know, them containing marijuana and such. But do you think this should start earlier than middle school, high school? Is there a plan to start doing that more?
Yes, definitely. I mean, we think that early education is key. And having those talks early on and continuing that conversation is important. Age-appropriate education is important. Many of our families worry that if they bring up that conversation with their child, that it might make them interested or seek behaviors to use drugs. And we dispel that myth. That's not true. That's reducing, we want to reduce the stigma around substance use. So talking early, talking regular to our students is important. Each elementary school has a school counselor. Middle schools all have counselors as well. And then, of course, in high school, we have the Crossroads counselors that do work with our elementary schools, but our primary focus is our high school first, middle school second, and then trickling down into elementary school.
Okay, thank you. Yes.
To just add a little bit to that, because I think it's a good question, right? And I think, honestly, we've been working ever since the days of DARE to try to figure out what is the school-based intervention, right? So for anybody who doesn't know, DARE didn't work. And we really haven't cracked the code on that. And so while I think it is important to have these conversations at the school, actually, if we look at the research that's been done, I think that points to how important the conversation at home is, and that it's actually maybe a little bit more important than leaving this up to the schools. Like, I was really surprised to learn that in surveys, teenagers say that they put more importance on their parents' views of drug use than they do their peers. I don't think they'd admit that if they were just asked. But in a survey, they feel safe enough to say that. So I think it is important for us to talk to our kids. And I think the way that we talk to them about it is super important, right? So essentially what this research showed is that when parents gave messages like, in our family we don't use, right? Or even if I've been in recovery, like, we're going forward, like, we're not using, right? Or we don't think that this is kind of what we do. The kids really internalize that message. I think when we talk to kids about, man, I used to get so high, and like I've learned from, don't do like I did, that generally doesn't work, right? Because don't do like I do. No teenager kind of takes that as good guidance. So I think it's important that we give the message. This is not what we do. This is, our family is like, we'll learn how to cope through other methods. The other thing is, and again, it comes from research, and this is a little bit of harm reduction, is, you know, we can acknowledge that as humans across the globe experiment with intoxicants. We can't find a community that doesn't. So how do we talk to our kids about that? It might sound funny at first, but really the guidance right now is, what we should say to our kids is, if you're going to experiment, right? If. We're not telling them go experiment. If you're going to experiment, wait till you're 19. And 19 sounds like, well, where does that number come from? It's totally based on statistics. If we start to use intoxicants before 19, we're much more likely to develop an addiction or a substance use disorder as an adult, compared to if we start to experiment after 19. Now, it's not like, you know, as long as I'm 19 or over, I'm never going to get an addiction. It's still a risk, but statistically, way less likely. So, you know, again, and I think we can give both of those messages. In our family, we don't use drugs, or we don't get high, or, you know, even if we did before, we're not doing that going forward. And if you decide to experiment, wait till you're 19. That's kind of the good evidence-based approach to reducing harms.
And just to add to that too, I think a lot of parents don't initiate that conversation with their youth because they don't know the subject matter. So really empowering you guys as parents to educate yourself on emerging drug trends. You guys are doing an amazing job already being here today and learning about fentanyl, learning about naloxone and different things. And that is so vital to having those conversations. Sometimes we don't, as parents, have those conversations because we're afraid of the questions that might come after, right? We don't know how to address it. And it's not even so much to tell them don't do it, but give them that this is because, this is the why, right? Because lots of youth don't want to hear, just don't do it, don't do it. They're curious, well, why not? Tell me. And again, if you don't know the subject matter, you're not going to feel comfortable talking to your youth. And there are so many resources out there on the internet that you could just Google. I say ask Sir Google anything, right? So ask Google on emerging drug trends in youth, how to have conversations. There's one Talk They Listen website that gives you some amazing resources and tools to equip you, to empower you to have those conversations with your youth.
Yeah, great advice there. Thank you. This next topic it's complex. So how do we address the intersection of the fentanyl use with our criminal justice system? Corey Lee, can we start with you?
Sure. I think first we have to address the criminal justice system. I heard earlier on one of the panels, the question as to why more people aren't signing up for specialty courts. Well, I think there are a lot of providers in this room who can say that navigating court systems is very difficult. And if you're navigating that, you're probably also navigating all of the requirements, right? So if you're going to a counselor, that counselor then wants you to do something else. If you're going to a methadone clinic, they want you to go to counseling. So if I am going to sign up for a program that's going to basically make it virtually impossible for me to exceed, why am I going to sign up for that program? I'm not, right? Also, it's education, not education for, it's education for the public, but it's also education for judges and prosecutors and public defenders. And not education through a licensed social worker. I mean, that's great. I love clinicians, you're amazing. But there should always be a peer support worker in the room providing that training, right? A peer support worker should always be at the table, no matter what is happening. When we are talking substance use, there needs to be a peer support worker there. Yeah. So, you know, we talk about the criminal justice system and the intersection of fentanyl and substance use. Well, when it comes down to it, it's how is the criminal justice system responding to substance use across the board? And I think most of us can say we might have concerns that the response is not as trauma responsive as it could be.
Thank you. You know, we talked about the stigma associated with all of this, and we hear it and we see it every day, right? But what about the social impact for the families using fentanyl and what that does to the family structure, their kids perhaps, who are a part of this activity daily and seeing things they shouldn't be seeing? Steve Decker, can you speak about that?
Sure. So Heading Home currently operates the largest family shelter in the Albuquerque area. And of those families, all but a handful have been directly affected by fentanyl. And the reason that they have found themselves homeless and in the family shelter is because of fentanyl use. Over and over, literally almost every day, we have staff who are reporting that they had to use Narcan on the site for a parent. We have heartbreaking stories of mothers who were found by their children dead in the bathroom because they were using and they were trying to hide their use from their child. Mm-hmm. The impact on families in fentanyl is far more than just the families that end up homeless, of course. The reality is, when we talk about there's not enough foster families in the state of New Mexico, when we talk about there's not enough law enforcement in the state of New Mexico, when we start talking about the lack of healthcare providers in New Mexico, we can look over and over again that what's happening is because the family systems are breaking down and those connections are being destroyed, that's what snowballs into all these other effects. The reality is, if we had a real solution to fentanyl, my family shelter would be empty, but it's not.
Oh. Thank you. Gilbert Ramirez, what about your department? How are you seeking out those who need the help, and what are you doing for them?
Thank you. So I've been a long-standing practitioner in the community as a clinician and primarily working with adolescents and their families. understanding the challenges that come with young people and or our communities seeking or looking to folks for support, you have to understand the window of opportunity sometimes can be really tight. And that one time that the kid's just talking about something they're doing, if you don't pay attention and or listen to that, it could close, right? And you have to take them serious. And I'm a parent of 2 children, and I know they ramble on and on and on, and it takes a lot of intentional focus for me to hear everything that comes out of their mouth. But they do want to talk to you, and engaging them and being able to break down those barriers for them to access that is huge. When we talk about the impacts, the social impacts on a family, you know, one of the quotes that I've always used with my young people and talking to them is that if you don't do the work to heal from the injury that hurt you, you're going to bleed on the people who didn't cut you. And I think you have to understand that statement, because families have to take on the impact of the individual who they care for who is battling this addiction. And they're bleeding on you, even though we didn't cut them. And those impacts are huge, right? We have the issue of the fact that emotionally, you're going to feel a range of emotions of anger, maybe being upset, worried, fearful that your loved one is going to die and not show up. There's financial impact in the family, right? If you were a breadwinner in the home, maybe your focus of your finances now to supply the substance you need to survive and stay well every day. You have relationship issues at home where now maybe the relationship with your partner and or your children is now fractured because there's instability in the house. You now have folks who no longer want to associate with you and are being isolated, right? So the social impacts on a family is huge. And that's where, you know, we as city government entities, providers, others who are doing this work, I mean, I keep hearing peer in it. It's so important to understand that one of the biggest psychological motivating factors for someone to change their behavior is the fact that there's someone involved in them who, 1, they trust, and 2, they can rely on. Now, whether that is a family member, a blood tie, a counselor at a school, or just someone who cares about you, it is so important, and that's why peers are so effective. They come from the life, they've experienced that, and they can walk you through it because they understand it, right? And if you haven't, then you can't walk that path with them. And that's the hardest thing around making sure we wrap ourselves around these families when you talk about the social impacts of fentanyl and or any substance on our community, is that how do we address those issues, right? You can also understand that if you're a parent using, you're afraid that, you know, the state will come in and take your children. So you're going to hide that, right? You're going to teach your children to hide that and not mention that. It's what you do to kind of keep your unit whole. Of course, as a family, as a department here, we want to increase access to services and treatment and also understand where the gaps in those treatment availability is. If you don't have insurance, right, treatment is one piece, and it can take a long time. But if you're having to make a decision between putting a tank of gas in your car or some food on the table and or a $35 copay 2 to 3 times a week because you have to show up for treatment, you're making a decision to not go to treatment, right? We saw this during the pandemic. Families didn't access services. And ultimately, at the base, understanding that there's a level and root of, I mean, fentanyl is a pain medicine, right? It's to address pain. Now, whether that pain is physical and or psychological or emotional, it's real. And when you start talking with young people who are maybe having issues of anxiety or depression, that's a huge piece. When we talked about what should we do at the schools, also understand that if your kid had an injury, a sports-related injury or otherwise, happened to go to a doctor, happened to get a prescription, you should be having that same conversation. You know, we might think, not my kid, right? This doesn't discriminate. As we saw with the statistics, from accidental overdoses of children under the age of 1 all the way through, doesn't matter race, gender, community, socioeconomic status. It's available. Now going back to what we have to do, because typically as city government entities supporting those services, it's what's visible. And what's visible, sadly, are population of folks who are the most vulnerable. Those who are unhoused, those who are on the streets. But please, by no means, don't think that those issues don't exist in people who have the fortunate privilege to have a home or an apartment or actually hold a job. It's across the board. But what we see is the community in front of us, and that's why it's so prevalent in front of our face. Now, we do have to commit to changing that. We do have to commit to filling some of those gaps in services. If you can't afford the copays, we want to provide the treatment without the copay. right? If the courts are working on programs but don't have treatment providers, we partner with them to make sure they know about our programs, who we're funding, and they can make those referrals. We're working with the county to fill some of the gaps in the other areas, and we can't do this alone, right? It does require all of us. So, I mean, back to the original question. We have programs. We need to do more to educate folks on how to access them. We have to continue to prioritize where we put the money to be able to make sure we bolster whatever is missing so that folks can have access to it, because that treatment does take a long time. You're literally trying to have someone develop new coping strategies to deal with something that they have learned another way to deal with. And that's painful, it's hard, and sometimes you've got to do it alone because you've pretty much alienated your support network because they don't know how to support you. And that is where the challenge is. I'm a social worker, I've got skills, I can navigate systems. Now, let's add a language issue. Let's add a learning disability issue. Let's add another medical issue, or any of those things, add another complex layer to the strategy on how you're going to get that help. Our job is to figure out how do we get it out, how do we let you know it's there, how do we make sure we have the partners at the table, and then how do we fund those services that are kind of missing to make sure they're available as soon as possible for folks, because again, when I started talking, the window can be very small, and a person might be contemplating that change right in that moment, and then it may shift and say, nope, no longer. You got to jump on that and make sure those connections are made immediately.
Thank you. And some of those coping strategies, Margarita, let's talk about the behavioral health department. What are you finding, state, city, you know, our state is so huge, but at the city level, the county level, and the state level, how far is the reach, and any new innovative efforts being made on how to reach people to help them with these coping strategies that were mentioned?
So there's a lot of work to be done, right, at all levels, from the federal level all the way down to the local level. And we are more fortunate here in Bernalillo County in the city of Albuquerque than the rest of the state really is, right, because we have some resources available where in rural New Mexico there is little to none. And so again, we're fortunate here, and we're fortunate with the support of the County Commission for the passing of the behavioral health tax to dedicate funding to services. We're fortunate to receive funding from the state through liquor excise tax to provide some resources, right? I think, again, we are grateful for that, but there's still so much work to do. We have been able to expand the services at the CARE campus to have a peer living room. I echo what Corey and others have said about the value of a peer. It's immeasurable, right? The value of a peer who has walked the walk and talked the talk. I can have a conversation with someone all day long and say the exact same thing and have no impact. And a peer can have a conversation for 5 minutes and hit it. And again, I think it's really, really important to recognize that. Now, nationwide, and even at a higher level in New Mexico, we have a provider shortage at every single level of that continuum. We are short on counselors, we're short on clinicians, we're short on every single prescribing providers. Even I'm short on substance abuse techs, right? All the way across the board, we are short on providers. And so we need to do a better job with what we have to get folks into that services, into that treatment, and really leverage our peers. Right? Our clients who are the success stories, who go into recovery and are doing an amazing job, we need to support them in becoming peers, right? We can't just say, oh, we're going to hire whatever peers show up our door. No, we need to encourage our clients and help them, pay for the certification for them, get them into those classes, get them into their hours that they need to get that certification. We need to do everything we can to support that. So I think really above and beyond, you know, what do we need to do? And that's not just build more programs. We need to build the workforce, right? We need to build that workforce because we can build programs all day. And if we have open beds because we have nobody to staff the beds to get people into, we're in no better place than we were before, other than we spent money on a new building, right? So I think we need to really work collectively. Poor Gilbert and I talk more than I think I talk to my husband because the city and the county work very closely to do this work, shoulder to shoulder. And I think we're grateful for the state leadership that is also in line with us. We're right as we speak, we're on a meeting this morning about a collaboration with the state to do better on this work. And so I think, again, really leveraging federal resources, state resources, build the workforce, and get out into the community to make sure that folks are not waiting 2 weeks to do a Suboxone intake, right? making sure that folks can get into a Suboxone intake tomorrow or today, right? We were, just before we started, we had that conversation about ASAP being able to do that, and I think that that's phenomenal because, to Gilbert's point, when that window is open, we need to take that opportunity and not say, hey, come back 3 days later and then let's talk about it, right? Much less 120 days later, right? So we really need to do a better job of making that accessibility front and center, and in order to do that, we need to build the workforce. So if anybody here is a provider or a peer or a tech who needs a job, I have a job for you. I'm just going to put that plug out there. But again, it's just really important for us to do all that we can to wrap around folks in every setting.
You know, so often we hear about Albuquerque, the greater Albuquerque area, having the drug problem, the fentanyl issues, you know, the larger cities, and then also having the resources, right? They'll hear about help, and even on the news, we'll talk about where to get the help in Santa Fe, Albuquerque, et cetera. What about rural New Mexico? You know, so often those areas are forgotten, right? And they need a lot of help too. Are you seeing a rise in fentanyl use in these rural communities, and what can they do, or what kind of stories can we do for folks watching from these rural areas? They just don't have a lot of access to care, and if they want access, they might have to drive 3+ hours to get it to a larger city. So what, anyone want to take that question? What's the answer for that, or what's your advice to them? In our, yeah.
I was at a panel a couple of weeks ago, and a man said, you know, there's so many people coming to Albuquerque. Can we figure out why they're coming and not do that? And it stopped me for a second. And I realized what he was saying is, I flipped the narrative. The narrative is there's not enough resources in small towns. Mm-hmm. And if we're going to do something, Albuquerque has lots of resources, and yet it doesn't have enough. But what we really also need is to address the lack of resources in small towns, whether it's affordable housing or whether it's MAT services. And I know that there's a conversation happening around that, but we need more conversation.
Do you think there's a particular group, you know, I know you touched on the homeless earlier, susceptible to fentanyl use, but as we also know, we can see this in any type of family, regardless of socioeconomic status. But is there a particular group in general, or even at the high school level, you know, maybe certain kids who are being bullied, or is there any particular group that you feel might be at higher risk that's not so obvious? Yeah, Dr. Stern.
No. I think the risk is everywhere and can happen to anyone. And I think it's really important that people understand that as well, that you know, we have this illusion it's going to happen to somebody else and not be in their family.
Okay, thank you. Steve Decker.
So I respectfully disagree a little bit. I think that what we see time and time again is that the people most likely to fall into the trap of addiction are the ones who have been isolated, whether because of a disability, a mental illness, physically isolated because they are in rural areas where they don't have access to services, or isolated because they are bullied. I think it's been said many a time that the opposite of addiction is connection, and that's what we see in the people who succeed and who beat it. When they talk about the peer workers, that's the impact. The populations that are most at risk across the board are people who are isolated. Why do we see such a rampant use in the population that are experiencing homelessness? It's because they are very isolated. Why do we see such a ramp up in the rural areas? It's because they are disconnected. And over we see that. I have employees whose children were isolated due to mental illness. It's the isolation that creates that biggest risk factor. And anyone can feel isolated, but isolation, I think, is a direct impact towards the addiction.
With family and community services, Gilbert, what are you seeing? Are you seeing a particular group?
Yeah, you know, I think it's important to remember that there are inequities in some of the systems that we've created, right? And when you have inequities in systems and access to care, you're going to have populations who are more vulnerable for risk. So let's just be real clear. You know, those things do affect you, and it also affects your ability to be successful in treatment. I may not have the same family structure and or financial resources that other families have to be able to be successful. We also know, at least in the world that I worked with adolescents, we've got to ship our kids out of state sometimes for detox. how does treating an individual by separating them from their family units and or community really support that when they return, right? It's a practice we've had because we don't have the resources for some folks, especially if you're taking advantage of like public services, right? So I do think that our goal, our mission has always been to really make sure that we are investing our funding into filling some of those gaps across that continuum to make sure people have access and that it's equitably accessible to all folks, not just certain populations, right? And we need to do better about educating our community on what's available, making sure that they know that they can access those services. And so we see it across the board in family community, everything from community centers and early childhood development programs all the way on up to some funding and support for area on aging and senior affairs, right? We cover that spectrum. And we know that at every one of those touch points, we have an opportunity to educate, provide information on access to resources, help families do that, but sometimes the work does get siloed, right? That happens innately in all pieces, and so we've got to make sure we're all communicating, all sharing that information, and then hearing what the community is saying as far as needed services, right? Which leads to like one of the collaboratives that we're doing, bringing a medical sobering center to the community. We can do better. You know we need that service. It's been identified, and we're going to partner to make that become a realization. We have no youth detox in the city that's a public service. We are working to reestablish that, right? These are missing services that we need to bring. And yeah, of course, we talked earlier about resources and maybe it isn't or just about, but we know there's some gaps in them that we could do better. And we're still trying to rebuild this system of care. I start talking at a system level. Parity in health and behavior health needs to happen. You know, statewide, we need to make sure that we ensure and provide the adequate coverage. If you're bleeding out and your arm is hanging out a bone, you're going to get surgery and have the appropriate treatment to care for that. Yet, if you're dealing with substance use or addiction, the treatment's different. Your path has to be prioritized in another way. You know, and we've long heard sometimes you can get that quicker through the prison system than you can through our community system. That should not be our narrative. Our narrative should be that we have just as good quality access and services in our community, and you don't have to travel through that system. And that's why not criminalizing this topic, these folks who need this help is so, so important. There has to be other avenues.
All right, thank you. In the school setting, Jessica.
What we do know in the schools is that all of our schools are affected by substance use. So we know that many of our adolescents are using for, no matter where they are within the city, our adolescents are struggling. So as we've heard here, many of our adolescents are struggling with anxiety, depression, trauma, stress. So substance use is in all of our schools. It's not just in one area. And that is one reason why we have crossword counselors at all 13 high schools.
All right, thank you. We're going to wrap up with a final question. If someone you know, a loved one, is struggling with addiction, with fentanyl use or drugs of any kind, what advice would you have for them? Jennifer Burke, as a mom, what advice would you have?
Well, I think, and I get asked this question a lot, and I personally dealt with it myself in my own situation, but, you know, I think part of it is what we've talked about today, is just having that conversation with your loved one. I know as a parent, you're scared you're going to say the wrong thing, you don't know what to say. A lot of us have never been there ourselves, or if you have been there, you know, you're afraid you're going to say the wrong thing and maybe possibly encourage use. Like Dr. Duhigg was saying, it's like, well, you know, I used or I didn't use, but, you know, you don't want to say the wrong thing, and then your kids suddenly think it's okay. And so I think from my perspective, it's important to have those conversations, and it's important to just tell the truth. Just say, look, I've never been where you're at right now. I've never had these same struggles, and I don't know what it's like, but I want to learn, and I want to help you however I can. So, you know, opening up that conversation just as simply as saying, like, help me understand, like, what can I do for you? Because I'm not really sure what that looks like. And then not judging them. I mean, they're putting a lot of shame and blame and judging on themselves as it is. And you don't want to add to that, because they're already carrying this huge weighted blanket, and you don't want to keep adding to that. So showing support for them, setting boundaries is really important. Setting boundaries for yourself and your household and your family, but set boundaries that you're going to stick to. Don't say you're going to do something and then don't do it. That's the worst thing you can do. If you're going to say, I'm going to take your cell phone away if this happens, then you better take their cell phone away when that happens. And don't set something that you're not going to follow through on, because you're just going to create more of an issue. But having those open conversations and just, educating yourself. I mean, like we talked about earlier, like there's, the internet has a ton of resources, there's a ton of information out there. Talk to trusted people that you know in the community, and just find out for yourself what's going on out there, because it's a different world right now. It's a different world than when my son was using. I mean, my son passed away in 2011, and since then, the drug world has changed tremendously, and the access to drugs has changed tremendously. And so even myself, I have to constantly keep researching and learning new things so that I can at least try and stay one step ahead of it. But having the conversation and just being honest with them, I think, is the best way to try and help your loved one. And then there's a ton of treatment out there. Treatment does work. We've talked about this. Treatment works. There's a lot of treatment options. There's medically assisted treatment, like we talked about. There's intensive outpatient treatment. There's 12-step. There's a lot of treatment available, and sometimes it takes a little of everything. So sometimes you may have to just try all different types of treatment, and then you're gonna, your loved one's gonna pull from that what they need, and we call it a toolbox. And then you bring all the tools in your toolbox, and whenever you need that tool, you pull it out and you use it. But those are critical things. And the other thing I would recommend is just self-care for family members and parents. Make sure you're taking care of yourself. Make sure you're seeking counseling yourself. This is a family disease. Make sure that you're going to Nar-Anon meetings or Al-Anon meetings. There's several meetings throughout Albuquerque for parents that are struggling with a loved one who's addicted. So reach out to those groups. Take care of yourself, because you can't take care of somebody else if you're falling apart yourself.
For people who literally want an instruction manual, there actually is one. I don't mean this to be like a commercial plug or anything, but there's an amazing book out there, and it's called Get Your Loved One Sober, Alternatives to Pleading, Nagging, and Threatening, which don't work, right? But this book is amazing. It just happens to be written by two people from a place called the University of New Mexico.
That's right.
It's used all over the world. It's in many languages. It's really approachable. It's all based on science. It's not just somebody's ideas. And it's literally an instruction manual to, how to set boundaries but still be loving, right? How to talk to people who are living with a substance use disorder, what things to respond to and how, and what things to not respond to, because that usually just leads to fights. So anybody who's looking for an instruction manual, that's the best one I've found.
Or some great advice.
I totally second that. Dan, actually, you took that out of my mouth, those words. I totally agree. And neither of us got any royalties from the book sales or anything, but it's been a good resource for a lot of my patients and community members, so I also highly recommend it.
Lastly, what would you say, though, about people who you want to give the advice, but your advice or your intervention is met with nothing but denial? Right? I mean, that's so hard for so many families.
It's very hard. But
Yeah.
I think, again, just trying to encourage them and give them some positive feedback. Just say, thank you so much. I'm really proud of you for sitting here with me today. I'm proud of you because you spent one day sober. They've got so much shame, and all around them they've had so much negativity. So, when I'm working with people and they come back the next day and I said, I'm really proud of you. You came back the next day. And they're like, oh, thank you. Nobody said anything nice to me. So, that's part of the kind of coming to them with love, is as hard as it's been for you, just to find something positive to share. Lets them know that you care in that way.
I think that's really important. And one other thing I want to add is at Serenity Mesa, we use a program called Nurtured Heart, and it's exactly that. It's focusing on the things that they're doing well in that moment. And as a parent, I wish I would have had Nurtured Heart training when my son was struggling with his addiction, because I was so much waiting for that other shoe to drop. I was waiting for something to go wrong, and that's all I focused on because I was so caught up and I was so wrapped up in his addiction. And I wish, that I would have seen the good things that he was doing and focused on those good things, because in that moment, that's what they need to hear is, oh, you came home on time tonight. Thank you for coming home on time, instead of just focusing on all the times that they came home late. So I think that's a great piece of advice.
How about a round of applause for our panelists? Oh, go ahead.
I'm sorry, is offering them not only help but hope. Change is possible and change is absolutely worth it, as is evident with all the peer support workers out there doing an amazing job. I'm extremely proud of you.
Yes.
Great, thank you so much. I do want to ask a question, though, and you kind of touched on this, and I mean, don't get me wrong, I was a doting parent, loved my girls to death. They would probably tell you I smothered them. You pay the bill on this for your child. Do you have the right to take it and look at who they're texting? Question. If you're a parent, do you look at your child's phone? Is that cool or is that not cool?
I would say yes, and you also have to set that expectation with the child. So, I mean, you have to say, okay, I'm willing to pay for your phone. However, these are the rules, these are the limits. And you set what you're comfortable with, whether it's checking their phone at random or whether it's checking it if you have suspicions or just having the passcode to it. I think you have to set those expectations up front so that you both understand what that agreement looks like.
And is it a help? Is this helping them?
I think it can be. I think it matters how you approach it, right?
Right.
I mean, best case scenario, you look at their phone with them,
Okay.
right? And you can talk about what you see.
I like that. All right. Great panel. Wouldn't you agree? Thank you very much. Thank you so much, Shelley Rabando, for doing this. This is a great thing. And we hope you're learning a lot out of all of this. We're going to take another 10-minute break. Please visit the resource room. They're still in there. Health break. And next up is family, individual, and peer testimonials. Great stuff.
I got us all water, yeah. Yes, thank you. Hold on, this is amazing. Yeah. Oh. Thank you. It's no Halo, New Mexico, right?
Have some free time after? Yep.
Yeah, let's do it, please. I want.
Yeah, I'll be back in town. I'm headed out to Houston for the weekend, and I'll be back next week.
You know, very personal to all the families that are losing loved ones, but it's he gets up here. I think so.
All right, we're going to get underway. We're missing a panelist, but that's okay. When she comes in, we'll put her right in, and it'll be no problem. All right, so this is our, if you want to call it, lived experience, right? These are the people that can kind of give us the lowdown, the realities here of some of this. So I will turn it over to the chair and county commissioner from District 3, Adrienne Balboa.
Thank you, Tom. Hello. Thank you for being here with us for this full day. And hopefully we're soaking in like sponges all the information, and hopefully most of all you all are connecting and making those needed connections. I know I saw lots of people, let's do this together, let's build this together. So please keep that coming, because that's what the whole point is, right? So again, I'm Adrienne Balboa. I'm the county commissioner for District 3. If you missed this morning, I have my own lived experience. I'm not going to share my story again because everybody already heard it, but I have my own lived experience. And in my day job, I get to be the policy director for an organization. And when we mostly work with communities trying to make change at the state legislature. And I always tell everybody, and for this case, it's even more true, that our lived experience is policy expertise. So while others are reading books and making up ideas and people are looking for models, places, you actually know what we should be doing. These folks up here know what we should be doing. The lived experience that our families experience, you know what we need. And that's what our county, our government, our city, our state need to hear from you so that we can actually do something about this. So with that said, I am so excited. I'm not going to talk much because all the expertise is right here in front of us. We have this beautiful panel of folks that have lived, and they're here to share the parts of their experience, their stories, their knowledge, because they want to save lives, just like we're talking about today. Let's keep New Mexico alive. And so we'll introduce everybody as we get to them. Well, actually, I'm going to name folks. We have our speaker, sort of like a keynote for this panel, is Nico Morales from No Halo, New Mexico. Yes, thank you. We'll also hear from Lupe Salazar, Viviana Sena, Tanya Tijerina, Kim Trujillo, Stacy Burleson, the ED of Women in Leadership, and Donald Hume with Presbyterian Community Health, as well as Brian Cerna. So I'm going to just be quiet and give it away to our wonderful speaker, Nico Morales from No Halo, New Mexico.
Thank you, Commissioner. A little bit easier. On October 14, 2012, New Mexico had the highest person on the planet. And I don't say that jokingly. His name is Felix Baumgartner. He was in the air 24 and a half miles, 128,000 feet. That's 4 times higher than your average plane. Some of you guys may remember this. It was a world record, Red Bull Stratus mission. This gentleman took the hot air balloon all the way up to the farthest place in space, and then he leapt. He jumped out of this balloon, basically, and free float all the way down to the ground here in New Mexico. There's a couple things that I think we can take from Felix to apply into the situation that we're here today. Felix had to use strategy and support to survive. Individuals who are using fentanyl, they need to survive, and they need support and strategy. May I ask just a quick moment, how many of you guys have been in a hot air balloon? Okay. How many of you guys have been on an airplane? A little more. How many of you guys have been in a car ride? Pretty much everybody, right? The lowest percentage that we had was in the hot air balloon. Alcohol and other drugs are like the hot air balloons. Unfortunately, New Mexico is very known for them. We see them all across the city. Balloons, they don't have any type of navigation. Hot air balloons, the reason my understanding is that they're here is because of the air cycle, the airflow that we have. If you guys have grown up here, you'll know that those hot air balloons, they rarely land in the place that they're supposed to. Most of the time, they're chased down by a responsible party. And it's somewhere out in the boonies. Sometimes we have the balloons land in our schools. I've even been in a neighborhood where the balloon didn't know what it was doing and landed in the middle of the street. I'm sure that you guys can recall, these balloons don't always make safe landings. Sometimes they hit power lines. Sometimes they hit people's property. And sometimes they hit each other. Felix Baumgartner, he wasn't in a normal balloon. He was in a one second, I practiced this term, stratospheric hot air balloon, meaning that it can go higher than anything else. I've taken high amounts of alcohol, taken high amounts of Oxycontin. I've also taken fentanyl. You see, last year, I had to have both my hips replaced. Some of the unknown consequences that I had to face was that surgery. And in that surgery, they let me know, hey, these are the drugs that you're going to be getting. I have lived experience with opioid use disorder. What that means is that I don't know how to use it outside of the medical treataway. When I use it, it gets used to an extent that causes damage to myself, to my family, and to the community. So when they told me I was going to be having this surgery, I had to figure out a strategy, because I knew that fentanyl was stronger than Oxycontin, what I was used to taking. I knew I wanted to survive this surgery, and I knew I was going to need some support. This drug, fentanyl, is not like any other drug. It's not like the normal hot air balloons that you see. It's like this stratospheric air balloon. The people that take it, they go very high. And it's very dangerous. You see, without the proper training, without the proper support team, and without the proper strategy, there's not really a way that you're making it back. As you guys saw, there's a small amount in here that have been on a hot air balloon ride. In our community, we have a small amount of people that overuse, overdrink, and again, we see them all over the place. What we're beginning to see is individuals in these higher hot air balloons. They're going to need support. They're going to need people on the ground. One of the common themes that I hear working with the individuals that I work with is, well, I saw my parents do it. I saw a guardian do it. I saw somebody that I admire and that I respect overdrink, smoke something, use something. So these individuals, they're not seeing the substance as being extra harmful because they're looking at the behavior. They're repeating behaviors that they have seen around them. We just finished October. You guys saw the hot air balloons. How many times in our community do we drive down the street and see somebody on their own balloon ride? These behaviors, well, they either get ignored, they get put down, or if they do get addressed, they're addressed with a malice, a stigma. I've been in my own hot air balloon. I stopped riding them. I decided to get on the ground and be part of the support system that these individuals who are now in the stratospheric balloons are going to need. I call you guys to action today. Are you riding in your own hot air balloon and pointing at someone else in that stratospheric one, saying, hey, you need to get out? Or are you on the ground preparing for the crash landing? Are you setting up areas so that property isn't damaged? Are you ensuring that if somebody runs into an electrical line, they have the things that they need to survive afterwards? Again, fentanyl is not like these other drugs and alcohol that we have. We cannot approach the survival technique the same way that we have with the other ones. My question to you guys today is, will you help individuals survive by putting together some sort of support and allowing them to be a part of the strategy instead of telling them what strategy to use? I'm tired of seeing all these hot air balloons. And I'm even more tired of people in hot air balloons pointing at those in stratospheric ones. Let's go ahead and get on the ground. Let's get our feet together, lock arms, find strategies, create support, because people need to survive. Thank you for your time.
Thank you, Nico. So powerful. I love that metaphor. We need Chase Cruz all over Bernco. So we're going to have, for this panel, you know, obviously we have some very sensitive we're first going to hear from Lupe Salazar. She's going to share. And then we have some videos of the stories. And then we'll have a strong close with Donald Hume. And we'll have a little bit of a conversation. So first, I'm going to let Lupe Salazar, beautiful person here, come and share the stage.
Hola, everyone. My name is Lupe Salazar, and I'm native from Española. I'm norteña, everyone. I am a daughter. It's important that I share. I'm a daughter. I am a partner. I am a mom. And I am a saya to 9 grandchildren. Due to the opioid epidemic that wasn't acknowledged, I am parenting all over again to 3 grandchildren. The youngest one arrived about 2 months ago. She's 3 months old now. And boy, I love her with all my heart, but it's been a life-changing experience. It's kicked me in the ass. Oh, can I say this like that? Okay. I cuss a lot. Due to the chains of stigma and the shackles of discrimination, our communities have suffered. And normally when I address communities, I'm addressing, Rio Arriba. I know that it's affected everyone, but that's my bubble space. That's my canton. That's where I come from. I'd like to share, and I'm a CPSW. I'd like to share 2 personal stories. They're very personal, but in order for us to have change, we need to talk about it. We can't stay quiet anymore because it's killing our familia, it's killing our sangre. And when they're gone, there's this hole that stays in family, it stays in community. And, we don't get over it. When people say, time heals, it doesn't. We get through it with community. I think of it as, it's right in here. It's right in the middle of your corazon. And when it's busted, it still needs to be. So it's like community is like that skin like on a drum, and it just reaches over, and we just continue because we have to continue. My first story is my granddaughter Moon. She has a different name, but I call her Moon. She is a survivor of fentanyl. She is a survivor of meth. The walls of stigma kept her from her parents. See, when she was born, my son, when the opioid crisis hit, there wasn't any more heroin. It stopped coming through, and it baffled me. I thought to myself, how can I know there has to be heroin or something similar like it in the pharmacy. How can we not pull that out? We're giving them methadone and Suboxone. How could we not do that? But we didn't. And fentanyl came into the picture. And so my son went from using, heroin to fentanyl. And I remember telling him, que bárbaro. I told him, you're not even loyal. I told him, you're not even loyal to your carga. And he would tell me, Mom, there's no more. Whatever we get, it has fentanyl. And so when Moon was born, to me, I thought to myself, this is going to, because he cried, for whatever reason, he has this connection to this baby. And I remember him coming to me and telling me, Mama, I need some preemie diapers. And I'm like, no, mijo, they're going to give them to you at the hospital. No, Mom, they told me that I needed them. That's where that stigma started. Mama, I need some preemie clothes. They told me I need clothes. And I told him, no, mijo, don't worry about it. She's going to be in the hospital. They take care of that. No, Mom. They told me I needed it. And so I thought to myself, I wasn't there, but I could only imagine, because I know where he was at, that they told him, you can't even afford a baby. And so I told him, well, just, come to Chimayo, because that's where my nonprofit is. And we'll figure it out, I told him. So when we went back to the hospital, she was already gone. But to me, my idea was, this is his pathway to recovery. I empowered him with the CPSWs. I empowered him with numbers. And when he got there, they wouldn't even let him in. My granddaughter stayed in the NICU here at the Presbyterian for 33 days before they called me. 33 days without having familia, without having someone to hold her and love her. And I'm not saying that the nurses didn't, but there's a difference. The moment that I saw her, I knew I wasn't going to let her go. And so 33 days later, I got a call from CYFD. Not a nice call, no. You need to go and get guardianship, emergency guardianship. They demanded, and that was on a Thursday. And on Friday morning, I was driving to Santa Fe to the district court office. I took my paperwork, and on Wednesday morning, I was on my way up there to get the paperwork because I was awarded guardianship. And on my way back, I'm calling CYFD because she's telling me, well, where are you, Lupe? Where are you? And I'm like, I'm on my way back. Don't go leave me, I told her. And so I got to Española, and I handed her the papers, and she tells me I'll fax them tomorrow. And I told her, hell no, you're not. You're going to do it right now. You're going to work that extra 15 minutes. I was like a perra jumping through loops, and you're going to do it now. I don't know if she did because of the phone calls I got. I called as a grandparent to the hospital. The loco, they didn't listen to me. I called as an advocate from my nonprofit. They still didn't listen to me. And I was like, well, what the heck, what the heck? So I had to go do my 2 overnights, and I saw firsthand the stigma in the hospital setting. And you know how shit rolls downhill. If it's going to start from the top with the administration, rolling all the way down to maintenance. I heard a doctor in there talking about the people from Española, and I was like, oh my God, the rabia inside of me. But, I was there for Moon. I wasn't going to get myself in trouble. And so I thought, I'll patiently wait, because she was laughing about how that mom, she doesn't even understand directions. And I'm standing there and thinking, maybe she can't read. Did she ever stop to think maybe she can't read? And so I thought, no, I'll be paciencia, Lupe, paciencia. And so I'm standing there, and then she's gone. And I'm like, well, where is that lady, the one that had the paño on her head? Because it was like one of those surgical scrubs or whatever. And they said, well, that doctor, and they gave me the name, she's already gone. And I thought, wow, man, that's a doctor. And if she's talking shit to the nurses, how are the nurses going to treat? And so when I was in that little section, because it's this little tiny section, I heard them, talk about how, did you see how they were dressed? And I was like, wow, man, stigma's deep. I'm sharing this with you today because, just like you said, people are struggling. And it is up to us. We need to shine that light. We need to be that example. It's not easy, but we need to do that. There is a pathway to recovery. I know there's a pathway to recovery because I see it all the time. I see it every day. Our CPSWs, they're amazing. And I thought to myself, when I saw the mom, I saw her driving at Barrios one day, and she looked 1,000,000 miles away. And, don't get me wrong, I didn't really necessarily, like her, but, I respected her. She's the daughter of my granddaughter. And I told her, what can I do to help? And she looked at me and she tells me, Lupe, I'm tired of the way they look at me. She tells me, I love my daughter. And I told her, I know you do. And she tells me, but I hate the way they stare at me. I hate the way they talk at me. She tells me, I know I'm sick, but I don't know how to get better. And I told her, I'll help you. But it's like, where does one go when there's so many people that are just stacked against you? You're never going to make it. You're never going to do it because you're just this, you're just that. That's why I'm here today, because if we share our lived experience, then we can look for hope. We can try and find some answers together. You know, one person can't do it alone, but a group of people, we can move mountains. So, you know, she tells me, you know, I couldn't even get updates of my daughter. She tells me, I didn't know anything about her because they wouldn't call, you know, my son's phone because it was his phone, even though he wore both of the bands. And I kid you not, he wore those bands till they were like just a little fucking little piece of string. And he would tell me, Mom, do I take it off? And I already had Moon, and I told him, take it off. And he tells me, but I'm afraid to take it off. And I tell him, don't take it off, mijo. There's no one's going to come and take her from me. I have guardianship of her, you know, to protect her, to keep her safe. But to me, it was like, you know, my son is not the first addict, and unfortunately, he's not going to be the last. But together, we can come together, and we can make sure that we give them the support, and we can talk to them, and we can listen. You know, sometimes some of the most amazing answers come out of our own mouths. It's just that when there's somebody there pointing fingers and mocking and ridiculing, and, you know, we're too scared to even open our mouth and speak. That's one story. You know, my Moon's thriving. She was born at 3 pounds. Now she is 9 pounds. The other story I have to share is, you know, it straight up has to do about fentanyl. You know, fentanyl, you know, came into our community and kicked us in the ass. You know, it has floored us. We have lost more people to overdose of fentanyl than we did to the heroin, as I understand. I need to share with you that as grandparents, we need to be visual. I hope I said the word right. We need to keep tabs on our grandchildren more than you'll ever know. I believe, and I hope that I'm wrong, but I believe that the new trend right now is the human trafficking for fentanyl. And I share this with you because about a month or so ago, my grand was friended by this girl. You know, she kept complimenting her and telling her how beautiful she was and how tall she was and how gorgeous she was. And my granddaughter, coming from the space that she was coming from, wanted this attention. You know, she wanted to belong. And on a Friday after school, you know, she left the school with this girl. They left walking. The counselor saw her. She didn't stop her. She didn't pull over and say, you know, what the hell are you doing walking down the street? Get in my car. She let her go. My granddaughter was traded for 50 blues, 50 fucking blues. So you can imagine what happened. He's out. You know, his mom has some pretty good attorneys at bat for him. I share this story with you because as grandparents, you know, we get these children and they're broken. You know, they're broken on the inside. You know, nobody wants to live with their grandma. You know, they want to live with their mom and dad. But if mom and dad can't, you know, we take them in because that's what we do. That's what people from northern New Mexico do around the state, around the nation. And so we do as much for our grandchildren that we can. And these phones have we give them these phones because we don't want them not to have. We don't want them to be the only one, because I remember my son telling me, she's going to be the only one, Mom, without one. And I was like, serio? She's going to be the only one? I don't think so, but we did it anyway. And the social media, the things that they have out there is crazy. Those Snapchats, it is crazy. I mean, there's kids. They're just little chavalos that are out there with those assault rifles, girls holding pistols, vaping, smoking. I mean, just doing horrible things. Only by God's grace and all the abuelitas, out in my area, I put a call out on the Facebook to the grandmas, and I asked them, help me find her. And they did, Somebody recognized a bathroom. Can you believe that? They recognized a bathroom, and that's how we were able to find her. Yeah, I know. There's so many young girls that go missing, and I see them, I see the posts on the Facebook and in the news. They're gone, and then, they're found. But if that's the case, if that's what's happening, then we need to move. I was at a meeting not that long ago in Rio Arriba. They were gathering data. I was like, what the hell are we doing gathering data? We already know we have a problem. Are we going to struggle like we did with the opioids? How many people have to die? How many people do we have to lose? How many families do we have to break? Before someone, pulls up their bootstraps and we move forward. I say we just keep moving forward. We can't wait for data. What does that even mean? What does that even mean? I am still baffled with that. When they told me that, I was like, I don't even know what the hell that means. But, I share these two stories with you because they're from my lived experience. I don't share it to put any shame on, on my family. I share it because if there's something that you can do, your neighbor can do, if there's, if there's a sign, if you see someone walking around, if you see someone driving around, don't wait. Act upon it. Don't just hold out and say, oh, that's a vecino. We don't deal with the vecinos. We are our brother's keeper. We need to look. We need to be visual. We need to keep watch. Because, once they're gone, we're not going to get them back. There's some families that never get back their children when they're trafficked. And, it's just, we have to try. We have to try harder. And that's, so I wanted to share, my call to action, because I like your word, is if we are not to be part of the problem, then we must be part of the solution. How do we come together? I know that Lisa told me this is just the beginning, Lupe. We're going to be moving forward. But yes, as community activists, as the jefitas, how do we move together? How do we move together and stomp out that stigma? Because if we can't do that first, we're going to be spinning our wheels. So thank you. I hope I didn't talk too much.
Thank you, Lupe. Thank you so much, Ms. Lupe Salazar, sharing. So, like I said, we're gonna, because some of these stories are obviously so personal, it was actually, Lisa had the great idea to let's record them so these families can be in their own power and share their stories. So we're gonna see a few short videos that, and then we'll be able to hear. We do have Viviana and Tanya and Kim here and Stacy here. And so you'll get to hear their videos, and then we'll get to hear from them at the end as well. So I'm gonna ask our IT to start the videos. Thank you. Thank you. I'm joined by Viviana Sena from Albuquerque, and she is currently dealing with the loss of a family member of her daughter, who she obviously loves incredibly. Thank you for being here today with Viviana and sharing our story, hopefully breaking some of the silence and bringing this reality of what we need to hear. So thank you so much. Tell me a little bit about Gracie.
Gracie, my Grace. She was this spark of energy. She was funny and charismatic, gorgeous. She made friends easily, so easily. And she was loved by many, envied by a lot. Smart. She was top of her class. You know, she was very smart. I thought she would graduate way up there, but, you know, she got in high school and things changed, friends changed, you know, they want to find who they are. And she was still up there in grades, though. She was always very bright, very smart.
Yes.
So when this happened to her, addiction and fentanyl and drugs, it was just like, I couldn't even believe it. But she started when using her senior year of high school. She was a cheerleader, a flyer, and she got dropped from a stunt. And she hurt herself. She hurt her back. And I took her to the doctor. They gave her ibuprofen 800, sent her to physical therapy, and she wasn't really taking her ibuprofens because she was like, they don't help me anyway. She's like, so she would go to physical therapy when she could, but because of cheer, it was hard for her to go as often as they wanted her to, so they cut her from physical therapy. And then she had a friend who was working for a pharmacy. And that friend, he's not a friend, but he gave her her very first Oxy when she was a senior in high school. I didn't know. You know, she told me this after the fact.
And that's part of the problem with pills is it's so like, you know, it's almost like, oh, a doctor gives you pills.
Yes.
And, oh, these are prescriptions.
And because they think, oh, it comes from the pharmacy. It'll be fine.
okay.
It'll be okay. And I think maybe that
In
was
her
her head. She was like, oh, it's from the pharmacy. I'll be fine, you know. So I didn't know about that. She graduated, you know, everything. We stayed in Vegas until the end of 2016, her last year. She did her one semester at Highlands, and then we moved here to Albuquerque. And when we moved here to Albuquerque, that's when things changed. She started working at this establishment, and one of the girls there was selling drugs for her boyfriend. And that girl got Grace and a few other girls, from what I understand, really, really hooked. Really hooked.
I know you on this journey. What do you wish you had known early on?
Drugs don't discriminate. Fentanyl doesn't discriminate. It will never discriminate.
And a matter of fact, they're targeting people that look like your daughter.
And that is so, so sad.
Horrible.
And it's, you know, no parent should ever have to bury their child. Because when you do, a part of you as your person, as your identity, is buried along with your child. And it's hard to get that person back. I'm fighting for me, for myself. I'm finding who I am now without her. You know, we used to be this square, my kids and I. Now we have part of that leg missing, and we're just a triangle now. But it was always us four against the world. I would always tell them that. It's us four against the world, guys.
Yes. We need to hear from our communities that have dealt with it, what's needed and how we actually combat this.
You know, the day that we found Grace and when we called to report her, because my daughter and her best friend and I found her deceased. when APD showed up and AFD showed up, there was no compassion for us. There was no compassion when we told him that she was a recovering addict, that she had been in recovery. There was no compassion for us.
I'm sorry.
And there was no compassion I felt. They chased me out of the room, so I don't even know if they even had compassion for my daughter. And I pray to God they did, because I don't know. But when they were talking to us, there was a few that did, that were compassionate. But I think because it's so much and they see it so often, they have desensitized themselves.
Yeah.
And I get that. But for the families,
need it.
We need it.
I know.
We need to feel like our child mattered. Yeah. And our child was somebody, not just this drug addict that you found.
No.
Or that some family called you about. She was much, 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 much more than just that.
Yes, Gracie was amazing.
Her addiction did not define who she was.
Yes, exactly. And I know how you felt. I shared with you about my father, and I remember for years the doctors and the times when he had like a kidney or a stroke failure, and they'd even almost tell us like, why do you keep saving him? And he was my father.
Because he's my father.
Yeah.
Exactly. They're your loved one, and you're going to fight no matter what. And that's what I'm doing. I'm continuing her fight. Because she fought. And she tried.
She tried.
And she didn't fail. She was human.
Yes.
But her fight has now become my fight. And her recovery is now my recovery. Yes. Because I am trying to recover broken pieces of my heart and try to put them back together and try to recover who I was and try to recover our lives, not only for me, but for my kids and my grandkids. A life without grace and some kind of normalcy for us.
Hello, Tanya, and welcome back. Now I'm joined with Tanya Tijerina from Albuquerque, who currently has a family member who is living with the disease of addiction to fentanyl. And she lives and works around this with her and her family every day. Thank you so much for being willing to share your story with us, Tanya, today. I'm very thankful to have you here. I'd love to just hear a little bit about your loved one. What are they like? What about them makes you smile when you think about them?
So I can start by saying that my daughter is a beautiful young lady with the biggest dimples and the biggest brown eyes and curly, curly hair. And she's just the most beautiful, sweet thing. She was never mean or ugly. She was never selfish. She was always the kindest spirit. And from the time she was small, people gravitated towards her. She loved music and she loved to dance. And, she started in the Albuquerque High nursing program that they have there, And that was her dream, was to be a nurse. And so she started that early, her senior year, with the hope of going on. She registered for college after graduation. She did those things. She was on the right track. I couldn't be more proud of her. And all it took was meeting the wrong person and for them to challenge her and to tempt her and for her to find herself in a position to where she thought it would be okay. Yeah. She had no idea what she was getting herself into. No. And that's just been such a hard struggle, but to see her fall the way she did and to see her in such a vulnerable, broken place. And I have sat with her so many times when she cries and she says, why me? Why me? And it's so hard to hear her speak those words. So I just think it's so important that us as parents know that they don't mean for this to happen either. It's not a life that they choose. It's not a struggle that they want. But it's so powerful that once they're in so deep, they really don't know how to get out. Mm-hmm. And it really is going to take a community of professionals, a community of families, a community of law enforcement to understand and to really address this differently. Because we can judge them. I've judged her. There's times when I've been yelling and screaming at her, why can't you just make a different decision? You know, she's a mom now. You know, you need to be a mom for your children, and there's so many times when I have unrealistic expectations. And that's me as a professional working in the field. And then I have to take it back and remind myself of what her struggle looks like every day, what her pain feels like, and that she is doing the best that she absolutely can.
Is there anything you talked about, like you didn't even know what it was? What do you wish that you knew along your journey, maybe earlier on?
You know, addiction had been in my family, so I knew what heroin addiction looked like, or I knew what it was like when somebody was abusing pills, but I had no idea what it would look like in my own home. Because you love them so much, you choose not to see the signs that are right in front of you. Yeah. And so even though I felt like I had the education and some experience, I really had no idea, truthfully, when it was right in front of my face.
Yeah, and where do people even get those kind of resources?
Yeah, I think that it almost feels like we're just so behind. You know, it seems like this train came through our city, through our state, and we weren't prepared for it. That's how I felt as a parent anyway, and that's what I still feel like. I feel like there's this runaway train, and we're trying to catch up, and we're trying to warn, and we're trying to, you know, provide education and services, but the truth is it almost feels like we're just, you know, touching the surface on what this looks like.
Yes. Yeah, and we're needing to find resources not only for the individual but for the families.
Absolutely. I know as a family member, even working in the field, you know, of behavioral health, you still feel all alone.
Yes.
And there's still such a shame or a stigma that goes along with that addiction when it's within your home. You almost feel like you don't know who to talk to. You live in silence. And that's why I'm so grateful for what we're doing today, because I feel like, you know, we don't have to be silent, and we don't have to be ashamed, and we don't have to feel alone. And I think that I know I can't be the only parent that's going through that.
No.
You know, and I think that parents need to know that they're not alone.
How have you guys tried to break the silence in your own family or for yourselves and your daughter?
Well, I think that I had the hard task of educating my family on what Narcan was. And not because I wanted to, but because I had to. Yes. And that's from the young little ones that are in our household all the way up to the great-grandparents, you know, having the conversation of what Narcan is, what it does, and how it could save a life. And that's not a conversation I ever thought that I would have to have with my mom, or with my grandparents, or with my children, with my younger children, to say, you know, if this happens within our home, this is what you need to do.
What would be a wish that you wish our city, our county, were doing this in front of our elected leaders, our governments, folks who should and can be providing the resources our families need? Are there thoughts that you have around what, or an ask of us or of our communities?
I would say to remember that they're people too. Because so many times we look at someone with an addiction issue as someone that's just sucking up the resources, a revolving door, someone that doesn't want help. You know, you look at them and you see something sad, but remember that they're a person too, and that they hurt, and they have sorrows, and they have dreams. They have desires, they just don't know how to get there. And also to remember that they belong to a family that loves them. Yes. You know, my daughter has 2 little girls that love her. They need her. You know, she belongs to a mom and dad. She belongs to grandparents. She belongs to this community. And so to invest in her, to help her through this struggle, is to help her children, is to help her mom sleep at night, is to help her aunts, her uncles. You know, it's to help her children get their mother back. And we should never give up on that. Never. Because we need her. As a community, we need her. You know, all of these young people that are lost out there, we need them.
Yes.
Just like they need us.
Oh, thank you so much, and thanks for sharing your story with the audience. Is there anything else you'd like to say that I haven't asked?
I think I would just remind people that we're in this together.
Yes.
And that no matter what, we may have this attitude of us versus them. That's truly not the world that we're living in anymore.
Oh.
You know, we have to fight this fight together and understand that that's the only way we're going to overcome it.
Thank you for being so awesome.
Thank you so much for having me.
Welcome back, and now we're joined by Kim Trujillo from here in Bernalillo County, Albuquerque. She also has her family story of living with somebody who is dealing with the disease of addiction to fentanyl. And we're here to hear about her and how she works through this with her and her family today. So thank you so much for being with us, Kim, and for being vulnerable and willing to share your story with us. Please tell us a little bit about your loved one. What were they like? What makes you smile about them?
What makes me smile is just what he was as a child, was just a very caring, thoughtful, brilliant child. I'm talking smart, just like off the charts.
Yes.
And so I had really high hopes for him as far as, you know, academically. I was thinking, oh, this kid's going to Harvard. You know, his dad's from the Boston area, so I had these dreams that were what is now unrealistic, because as smart as he was as a very young, as a toddler, he was showing signs of very oppositional behavior. And as you know, in elementary school, he was diagnosed with ADHD. And then as he got into middle school, he started dabbling with drugs. So it's been a tough life for him. It's been a really tough life for his family, and that's me, that's his sister, his grandparents, the whole extended family has really suffered as a result of him, one, having psychiatric issues, and then two, a drug addiction.
We hear that a lot, actually, about folks that might have a mental health diagnosis or might have mental health needs, and yet they're not being met, and so it often does turn to them self-medicating. Often is the way we hear talk about it, right? And has that been some of what discussions around your son?
Exactly, and I think even now that I'm working in a nonprofit dealing with people experiencing homelessness, we're hearing a lot of that there is that dual diagnosis, that yes, they have a mental illness, but they also have an addiction. And you know, it is strongly believed that it is self-medicating.
Yes.
A lot of people just need an escape from their pain or from their histories, from the trauma. So my son has experienced more trauma on top of, you know, there was some abuse from his father when he was young. And, you know, I will say that he was a tough kid to discipline.
Yeah.
And I think anyone that has someone in their family that's gone down that road, it's really tough on the family.
And so you've really been on this journey and could recognize even for quite some time. What would you wish for others that might be going on this journey, or for other parents that might be in the same place or beginning in the same place? What do you wish?
I wish that that there were more services for people like my son, and I will say that he's now getting services. He's 27 years old. He's finally getting services. So I had to fight for those.
Yes.
And sadly, a lot of people that you see on the streets of Albuquerque don't have someone to fight for them.
Yes.
They're out there, and if they're panhandling, it's to stay alive, sadly. It's to feed that addiction.
Yes.
And I'm very fortunate that my son, you know, we've found different services in Albuquerque, including Heading Home, that we're able to get him housing. They're able to get him medical care. They were able to get him a diagnosis. That's a big thing with people with addictions, is just trying to get them a diagnosis. So when when you take someone to Caseman Hospital, they give them a drug test. And when they determine, yeah, there's meth and or there's fentanyl in their system, a lot of times they're just released out of the hospital the same day.
Yeah.
Meanwhile, it took days to get that person there. In my son's case, it will take caseworkers, it takes the police department. The psychiatrist has to be on board to do these certificates of evaluation, and it's frustrating when you know, my son is traumatized. Cops have to take him in handcuffs to the hospital, and when the hospital says, yeah, there's meth in his system, and here's a place where you can go to get cleaned up, that's not treating the person.
No.
It's just further traumatizing them. So we've dealt with that, but I will say at this point, as long as my son is getting an injection for his schizophrenia, the rest is somewhat manageable.
Yes.
We can't stop him from going out every night to buy the blue pill. I do hear him doing that, and I do question if he's prostituting himself to get those pills.
Yes.
And my guess is he probably has, because I don't give him money to
get
purchase it.
Yeah.
How I manage the money situation is I send him groceries, I send him clothes, I send him toilet paper, whatever he needs, so that he doesn't have cash to feed the addiction.
Oh, and it's so hard. Thank you so much for sharing, because it explains both the desperation that folks are in to get some kind of thing, and that this is a disease. That's why I call it the disease of addiction, and that we have to treat it like that with a healthcare lens that's ongoing and compassionate and has care surrounding it. Thank you so much.
But I do think it's getting better. I mean, the fact that this forum is happening, that the city is recognizing this is an issue that impacts all of us. Because when we see people on the street, and it's heartbreaking, you know that mental illness is a huge component, but the drug abuse is too.
And all of those folks are somebody's son, daughter, yes.
Absolutely.
Loved
Or parent.
one. Parent, loved one.
Yeah.
Yes.
Yeah.
Thank you so much. And I just appreciate you're inspirational to me. So thank you so much for sharing. And is there anything that I haven't asked that you'd like to say? Or
I could talk about this all day long.
We're excited.
Just because one, I'm happy that this is being done. That we have to create awareness. We have to. We have to talk about drug addiction. We have to talk about mental illness. We have to talk about homelessness.
Yes.
Again, it impacts all of us.
Hello and welcome. I'm so honored to have with us today Stacy Burleson from Albuquerque. She also is dealing right now with a family member who is living through the disease of addiction, specifically the fentanyl, and she lives with this in her family every day. And so we're very thankful for you to be here to share your story with us, Stacy.
Thank you for having me, Commissioner.
Yes, it's wonderful. So please tell us about your loved one. What are they like? What about them makes you smile?
Well, it's my oldest daughter. Her name is Nicole. She's a really great mom. She's a really great person. She has a great personality. She has 3 kids. Her, like many other kids, just got hooked in with the wrong crowd, and she started using fentanyl, and it just really took her really fast.
Thank you so much again. You've been on this journey, sounds like, with your family, and what do you wish you knew early on in this journey?
I wish I knew early on in the journey when I started selling drugs how this really would affect a person's family, how it affects the whole entire family, and for generations to come. You know, when I sold drugs, I just didn't really think about or realizing, you know, they say a drug dealer ruins at least 500 families, and now I think about the damage that I done, you know. I wish I would have known about all the sleepless nights that moms were going through, that parents were going through. you know, just have them sitting up waiting for that phone call, what it was like. If I would have knew that then, I could have been more on the other side instead of, you know, pushing the drugs. I could have been fighting against the drugs, especially now that I have a child that's struggling with it. I wish I would have known in the future that this was, you know, was going to happen to her, or it was, you know, this was going to be affecting us the way that it is. But then maybe, again, things were supposed to happen this way, so then I could be fighting to try to help save, you know, other family member kids' lives.
Thank you so much. And I know that's like, you're coming from such a strong perspective. I'm sure it took a while to get there. What do you have advice or thoughts for families that are going through similar things?
My advice is to not give up, to educate yourself, to educate the whole entire family, to talk to your children, to let them know, you know, not to be taking anything from any person. We don't talk about pills. You know, pills are so normalized now, right? Because kids are, you know, you take a pill for a toothache, you take a pill for a headache, and then as our kids get older and they're at these parties, they, hey, take this pill. They just take the pill, not knowing that that one pill can kill them. So it really starts at home. We really got to start talking to our kids. We got to pull these drugs up on a PowerPoint, on something. We have to show them to them, and we have to let them know that it's dangerous. And if you take this pill, that you, more than likely you are going to die. A lot of people use fentanyl to just, you know, they want to get high. But also fentanyl is a sex trafficking drug also that a lot of people don't realize. And we need to be aware of that. And we need to be aware that that these drug dealers, they are targeting children. So fentanyl starts to look like candy, but more so fentanyl, they're using it to target women. So when women are out in the community, in the public, they need to really be aware of what's going on around them. You know, what looks different on their cars. There's something there that's not supposed to be there. Also, to not take roses. When people come up and hand you roses, don't accept them because more than likely they're laced with fentanyl. And also, another thing is the perfume samples, do not accept those from people because they are spraying that with fentanyl also. And so that has to do with a lot of sex trafficking that's going on too.
Wow, so much. And I know we've even, one of the themes for this is one pill kills. You talked about it, and we're facing what seems to be an ever crazy problem for our families. A lot of folks have talked about this shame and stigma. It looks like you've overcome some of that, and just know that getting out the message is the most important.
Right, right. You can't really have shame and stigma on a health crisis.
Yes,
this is now a health crisis, and it's going to affect everybody's family. So whether your family member gets hooked on drugs or not, that you may be affected by the crime. You know what I mean? We haven't even seen the crime that's going to come with the fentanyl, and it is going to come soon. So that's another thing we need to think about, and so it will affect the whole entire state of New Mexico eventually if it hasn't already. We need to get into the schools. We need to have what is it called when you bring them in the gym, and we need to show them this is the pills that are targeted to kill you guys, right? So you know, you guys, if you mess around with this stuff, you are going to die. You know, we have to just be straight up and honest with them and talk just like that, and just have these everyday conversations with your kids.
Thank you so much, Stacey. This is so incredible, and to hear a couple of things I heard you say, right, that harm reduction, I want to make sure our folks watching understand what we mean when we say harm reduction, and you're very clear and direct about, like, we need to say the things that are real, be very honest. Sometimes people would say, oh, you're teaching them how to do drugs better, but no, right, we're trying to save lives. If you wouldn't mind expanding a little bit.
Yeah, we're trying to save lives. So what we want to do is we want to show them, I mean, the drug is out here. Their kids are specifically being targeted. So we have to show them what it is. We have to let them know that they need to stay away from it, or they would die. We have to talk about it because we have to let people know. People who aren't on drugs, we need to, if we could start talking about them, hopefully we could not get them on drugs. And people who are on drugs, if we focus on harm reduction, we can slowly get some of these individuals off drugs because they are here now, right? Only thing we could do now is slow the flow of the drugs because the drugs are here now. So if we could start talking to people about them, we can save lives. Right now, we can't focus on blame. All we could focus on is trying to save lives, and we can save lives, but we definitely got to do more. We need boots on the ground. We need outreach. We need people out in the streets. We really got to do more than what we're doing.
Well, I'm so thankful for you sharing today. I'm so thankful for your work with Women in Leadership. You are building the next generation of powerful, strong women that are going to really help us solve all these health crises. Thank you for naming it as a health crisis.
I got one more thing.
Yes, please.
And so I am a returning citizen. I work with women who are incarcerated. So this is to the families. I know, we want our people who are incarcerated to have the best. We want them to have everything. But we have to stop taking drugs inside the prison. We know that the family's not the only ones doing it. We know there are other people doing it, but we know families are doing it. And to me, as a person who's been there, and as a person who are working with these women, we have to stop doing that. That is not helping them at all. We have to get more educated. And one thing that families can do that have women who are incarcerated, because most women who are incarcerated are on drugs. 95% of those ladies are on drugs. There's nothing in the free world you can't get in prison. And in order for these women to get home and stay home with their children, families, we have to take a different role. We have to be more advocates. And then you guys have to get educated. And then if you guys are struggling with drugs, you guys also need to reach out for help as well.
Thank you so much for that message.
You're welcome.
Wow. If we can, let's give one more loving round of applause for our families. We're going to close the speaking panelists, and then we'll have a few minutes to be able to hear from folks. But I'm excited. I've got to meet as the county commissioner. He serves on our addiction treatment advisory board. He is a long time. He has his own personal lived experience. And as a matter of fact, today is 30 years that Mr. Donald Hume has been clean and sober. So obviously we have lots to learn from him. Donald, you can sit there or come up here. Come up here. Yes, thank you, Donald Hume. He also works for Presbyterian Community Health, sorry.
If I can do.
Oh, you.
Ooh. Hello, everybody. My name is Donald Hume, and I'm a person in long-term recovery, which means that I haven't taken a drink or a drug for the last 30 years. And if I was using right now, I wouldn't be alive. This fentanyl epidemic, this fentanyl drug, whatever you want to call it, is different. It's different. I was an IV drug user for 22 years. And I used because it worked. It did exactly what it was supposed to do. Dr. Duhigg talked about it. Dr. Bott talked about it. They all talked about it. It took away the pain. It took away the physical pain. It took away the emotional pain. And it took away the spiritual pain. And I did not know how to deal with that pain. Our people out there, and I'm out there almost 7 days a week, because I promised when I got clean that I was going to help my brothers and sisters find another path. And so I go out there, and I feel their pain. And it's different than the pain that I had. It's the same, but it's different. I lived with the pain of the physical pain. I lived with the emotional pain. You know, we all of us deal with some form of trauma. And we all deal with that trauma in a different way. Well, I guarantee you, if you were to try a substance to deal with that trauma, and it worked, you would continue to do it. Because it worked. It's still working for some of those people out there. Not because it makes them feel good, but because it takes away the pain. And that's what we get to address. We get to try to find a way to help them live with the pain that they have. And it doesn't matter what caused that pain. You know, when I was growing up, they used to say, oh, it's because your mom put you on the toilet backwards. No, it isn't. You know, that isn't the pain that I was dealing with. You know, it's a pain that lives in our community. You know, it's the pain of watching all the stuff that happens. You know, it's the pain of parents having to both work to make it by, to get by. The pain of having to be raised by grandparents, as loving as they may be. You know? It's the pain of walking to school and your friend getting a ride. You know, it really doesn't matter what the pain is. What matters is it's painful. And what matters is that we, as human beings, have a responsibility to our people. And it doesn't matter what ethnicity you are. It doesn't matter your culture. It doesn't matter your belief system. It doesn't matter how much money you got in your pocket. Oh, it's empty. It doesn't matter. We have a responsibility to find a solution for the problem. You know, back when I was using, and I believe it's happening today, I wasn't an addict until I stuck the needle in my arm. The minute I stuck a needle in my arm, I became an addict. We got thousands of kids and young adults and older adults out there smoking blue pills, saying I'm not an addict yet because I'm not sticking a needle in my arm. And we believe that way. Why? Because of stigma. Why? Because of things that we've been taught, things that we were told, things that we believe that might be true. We've got to erase that stuff. We've got to find a way to bring our people back in, to capture their heart. I'm called the heart person a lot Because I believe that if I can touch your heart with my heart, we can save things. I work for Community Health, Presbyterian Community Health. We are the only successful peer support program in the emergency rooms in the hospitals to date. I've got the most amazing team in the world. And I'm going to tell you why. Because those individuals walk into the emergency room every day. And I'm not going to tell you the numbers because I don't know for sure. But I think out of all the overdoses that I've seen this week, which might be about maybe 10 or 15 overdoses, only one of them wasn't fentanyl. Of all ages. And they show up and they walk into that emergency room and they offer their heart to people. And they try to make follow-up calls to some of those people. And on the other line, they say, "I'm sorry, but my son passed away from an overdose 2 days ago." And my team calls me up and says, "Guess what happened?" And I get to be with them. I get to be present with them. And they show up the next day. It's not easy. This disease doesn't care who you are. It doesn't care where you came from. It doesn't care how much money you got in your pocket. It doesn't care about any of that stuff. What it does is it takes your soul and it takes your heart and it rips the souls and the hearts out of the people that love us. When I came up here today, I didn't know exactly what I was going to say. I knew that I wanted to mention my team because they're those frontline workers as well. You know, we saw police up here, we saw the EMTs up here, we saw docs up here, we saw nurses, we saw everybody. Now we see peers and family members. The ones that have had to walk this along with all the others. It's hard. You know, when I address professional staff in the emergency room, whew, you know, they lose hope also. They have to see people come in day after day, week after week, over and over and over again, and they lose hope. What we get to do, okay, I see you. What we get to do is we get to give those people hope again. by showing them the successes we have. I don't know why I'm here today, but I do know that my Creator allowed me to go through everything that I went through so that I could be doing exactly what I'm doing. There is no guilt, no shame for the path that I've walked. Thank you.
Thank you. What amazingness, right? Thank you, everybody, for being so vulnerable and willing and courageous. We're experiencing courage here, right? So I wanted to start. We have a few minutes. I wanted to make sure we have Brian Cerna here, and I know Tanya. When we had talked after we did your interview, we had talked about what are some of the signs, and I know Brian's here, wants to share from. What are some of the signs that families can look out for?
Sure. All right. Just here?
Yes, if that's
yeah. Okay. If this works. Hello? Is it working? Hello?
Can you get his mic on?
Adrienne, I'll just...
Okay.
Hey, everybody. I'm going to try to keep my piece short and sweet. I was an add-on to this panel. It's not because I don't have lived experience. I do. I'm the child of an alcoholic, and this model that I've been using to help family members who have a loved one with an addiction was developed by another child of an alcoholic, and I actually, so my dad was an alcoholic, my grandpa was an alcoholic, and you get how that goes. And I've had my own struggles with addiction. When I had my moment of clarity, and I'm just really trying to be cognizant of time, it came after doing a little bit of time incarcerated, getting out and having a really good friend of mine commit suicide 3 days after I got out of jail. And then I can't say I had a moment of clarity. But that was like a process of like something was cracking in me that gave me the clarity to figure out what I want to do with my life. So I wound up, my first job was helping families just like you all. Families who had loved ones with addiction, and that was way back in 2001. And I've been doing that since then. It started in Santa Fe. This is a model that they were talking about earlier. Some of the doctors mentioned it. But they didn't mention that it's here, right? There's a model here in Albuquerque that has been proven to work, and I know it works because I've been doing it, like I said, for 25 years. And I remember when we started doing it, it was mostly alcohol, then cocaine hit, and people thought, well, no, it's not going to work with cocaine, and then methamphetamine hit it. No, you can't. Methamphetamine's too evil a drug. Once you do meth once, you're gone. And, you know, this whole day feels a lot like that, you know. Fentanyl is different, but we deal with different every 10 years. I have no idea what the scary thing is going to be next time, but it might be just an aerosol released at a party. You know, it really could be that way. But, you know, that's to say, you know, we have this group in Albuquerque. It's called the Family Empowerment Project. Anybody can go. It doesn't matter if you have insurance. It doesn't matter if you can pay for it or not. We actually have funding to develop this pilot project. And, you know, there's one in Albuquerque. There's one in Santa Fe. There's one in Roswell run by Dr. Bob Phillips, who's hanging out here in a purple shirt. There's one in Rio Rancho. There's one in Peñasco, by the way. There's one in, you know, other places. And we're about to add more sites around the state. But what I really just wanted to say was there is hope, and it doesn't matter the drug. There's hope for people with addictions, for those family members. And, you know, I'm also a family member. I have an adolescent and a young adult at home, and I get to practice some of these things that I'm going to tell you with my own kids, you know, and I have to. Because, like everybody said, addiction doesn't care. Not only doesn't it care how much money you have, it doesn't care what your job is. Right? So a lot of times we wind up working with family members who are in our field, You know, they're social workers. Some of them are peer support workers. Some of them are just people in recovery who are now worried about someone else with an addiction, and those are the people we help. And what we do in our groups is we teach people, we give them coaching on how to handle situations so that they stay safe, that's still influential, and they can kind of guide behaviors. They can't control anybody else, but what we do in our program is two things at the same time. Is we try to strengthen family connection while keeping the family safe, financially, physically, and emotionally from the person with the addiction. And traditionally in American culture, it's like either you're enabling or you're putting distance between you and your loved one. You're kicking them out, cutting them off. It's nonsense. You can actually still have a relationship with your loved ones, and you should. And that's what I'm hearing today from the panel, is of course you should. And it's not all, and it doesn't mean you're enabling, right? And that's what we do, is we just work with families. Every family is unique. We help families determine, is this helpful, is this not helpful? And enabling, by the way, you know, just giving people practical tips. Enabling doesn't always mean you're being nice. Enabling means you're making it easier for the other person to use. And in some families, what I've seen over the years is that enabling behavior is actually being cruel, being very hard-hearted, and impatient, and just, you know, rageful. And, you know, when that happens, does that push somebody further into the addiction? Addiction is a disease of isolation. That's enabling behavior. And I get why families are like that. I really do. But so enabling is more complicated than people think, and that's one of the things that we help families figure out. I was sitting at the table this morning with somebody, and we just got it to talking, and she said that she had 2 sons on fentanyl, and you know, I just started talking to her about the program, and she said, you know, well, what I still do is I always cook for my hito, and I said, that's great, you should always cook for him. But she says, I have boundaries. I don't let him spend the night anymore. I said, that sounds smart to me, but don't ever let anybody tell you shouldn't cook for him. You should feed him, right? That's showing him love, and that's showing him, you know, what gets people in recovery isn't fear and desperation, it's hope and love. That's what people find in rooms when they go to NA and NA. That's what people find in programs, right? And what we try to do is help people find that, keep that, protect it, nurture it in a family while having boundaries. And you can do both at the same time. So that's, if you want to know more about that program, you can talk to me afterwards. I also did a video. We are next door. It's called the Family Empowerment Project. Family Empowerment Project. We're empowering families how to help their loved ones with addiction. And we've been doing it a lot of years, and we would love to help anybody who needs help with that, because I do know how heartbreaking it is. And so, thank you.
Thank you, Brian. And now I want to spend just a few minutes and let our panelists who were on video share a closing statement. Anybody want to start? Because I don't want to pick on anyone. Stacy, Kim, Tanya,
I just want to
Viviana.
say, you know, just don't give up on your kids, on your family members. Just be vigilant. You know, just talk to your children. You know, I know a lot of us say, not my child, but your child is come in contact with somebody else's child who may be on drugs. So, you know, sit them down at the table and talk to your family, and, you know, and just get help.
Thank you, Stacy Burleson. Works with founder and executive director of Women in Leadership. Kim.
I want to thank you for having me on this panel. It's an honor to share my story. I know we keep talking about the stigma, but if we don't talk about it, the stigma's never going to go away. And I like to share my story, and the minute I do, I find that a lot more of my friends and family and extended community are more willing to communicate and to talk about this. And the more we talk about it, the more we're going to be able to support people facing addiction and mental illness. So I think this is a good start to just have our community talking. So thank you again.
Thank you, Kim. Tanya.
I'd like to say that if you don't know by now, addiction impacts absolutely everybody. And if you're one of the very few that it hasn't touched your life yet, consider yourself to be blessed, because it's coming, and it's going to come for us all. That's the community we live in, so we can try to work together now, or we can wait till it's knocking at our door and we never even saw it coming. Let's work forward, not backward.
Yes, thank you. Vivian.
Well, I just want to thank you and everybody that put this event together, all the speakers. I share Grace's story in the hopes of helping others, you know, just in the hopes that when they hear her story and her struggle and see her picture, and they know that it can happen to anybody, anybody. I always thought, not my child, never. I never imagined it would be my child until it was my child. So I share her story in the hopes that if I can help somebody else reach out and seek help and get treatment, then I know she did that.
Again, thank you all for your courage, for being here today. And that's it. That's how we shed that shame, that stigma, break the isolation. And we heard so much of what needs to be going down. As we know, as we've said all day, this is just the beginning. We need to put resources in. We need to listen to all that's been said today. So we have one last, I'm going to let this panel go. And we're going to close out our session, but if we can have one more round of applause for this panel. Thank you. Thank to each of you. I'm going to call up go ahead, Tom.
No problem, Damon, I think, and Lisa, we can get you up here. We were going to take a break. We're going to forego that for everybody's time here. It was a great panel, wasn't it? I think we did really well today. And I think as they come up here, you know, I asked earlier, did we save a life today? Or two? Or three? We sure hope so. This is the beginning of the educational process in this. Get involved in your community and we can stop this and help people. Lisa Cedillo White, this was her idea, her brainchild of bringing everyone together.
Thank you. Thank you all. And good afternoon, good evening, going into the evening. My name is Lisa Cedillo White, and I'm one of the Bernalillo County Deputy County Managers, and my division is General Services. This afternoon, we've heard all about the dangers of fentanyl in our community. As part of the campaign to keep New Mexico alive, Bernalillo County and the City of Albuquerque have partnered with Media Matched, a marketing consultant, to create marketing in and around our community on the dangers of fentanyl. We will start the marketing campaign with billboards and the wrapping of city buses. Rainbow fentanyl is in states, it's found in 20 states in the United States, and including New Mexico. So at this time, starting, we will have, these are the signs that you will see on the dangers of fentanyl in our community. All families and children need to be aware of the dangers of the illicit drugs that may contain fentanyl. Fentanyl comes in many forms: fake pills, various colors, and laced in other illicit drugs. Our marketing campaign will also include social media. We heard all about social media, how our children are buying drugs on social media. As part of our marketing campaign, we'll advertise the dangers of fentanyl and promote treatment to those suffering from an addiction to fentanyl on all social media platforms, such as Instagram, Snapchat. Tomorrow, we'll start radio advertising on the dangers of fentanyl. This very evening, on channels 4, 7, and 13 at 10 p.m., our very first commercial will air on television, which will now be played for your viewing.
families are grieving after losing their daughters to an accidental fentanyl poisoning. Law enforcement officials confirmed that the high school student was cramming for an exam and purchased what they thought was legally acquired Adderall. The pills were laced with deadly amounts of fentanyl.
That's terrible.
Local authorities explained.
I heard about it at school.
I have too. What have y'all been hearing in school? Keep NM alive. It starts with a conversation.
Bernalillo County and the City of Albuquerque and our partners will continue to market the dangers of fentanyl in our community, moving forward with the Keep New Mexico campaign. So at this time, I'd like to introduce Damon Martinez from the City of Albuquerque.
So hello. I would like to talk to you about the Metro Crime Initiative, otherwise known as MCI. Last year, Mayor Keller convened MCI, and this year continues as the second year of it. MCI brings together community stakeholders, such as Bernalillo County, the courts, and community organizations on specific topics related to public safety. Today, let me speak about one MCI initiative involving fentanyl, which will be proposed at the upcoming legislative session. So, as background, in 2015, New Mexico changed the asset forfeiture law, which caused local law enforcement to forego receiving funds from criminal investigations. What is currently occurring is that federal law enforcement agencies like the FBI, DEA, are conducting criminal investigations. And local police agencies like APD are already participating in these criminal investigations. If the federal agencies seize assets, however, the local police agencies do not receive a share of the seizure because of the criminal state law. So in other words, money that a local police agency could be receiving is instead being sent to the federal Treasury. So at this upcoming legislative session, Representative Dixon and Senator Hickey will sponsor legislation that will allow the local police agency to receive a share of the assets seized in the federal investigation. The local police agencies will then be able to direct this money towards substance abuse. In other words, fentanyl education and prevention. The second issue that I want to speak to you about is last year, at last year's MCI session, there were 40 recommendations concerning our criminal justice system. So let me give you an update on 4 of those recommendations. Now, in the spirit of partnership, it became apparent that certain programs in our criminal justice system needed help. This year, the city and APD intend to provide $25,000 to the DA's office to assist with the pre-prosecution diversion program, $50,000 to the Metro Court for a community caseworker, $45,000 to the District Court for competency evaluation, specifically to help pay for one psychiatrist, and $40,000 to the Young Adult Court at District Court. The third thing that I want to speak to you about, finally, is that this fall, anticipate that the city will re-examine the nuisance abatement issue. The city is very proud of what the ADAPT program has accomplished. However, the city is interested in creating a more aggressive program concerning nuisance abatement and problematic properties related to drug dealing. The goal will be to abate nuisances completely. Thank you for letting me speak to you, and thank you for attending this conference.
Well, I know we're running short on time, but I wanted to one more time recognize Miss Lisa Cedillo White. She is the one who pulled all this together in a short, tiny amount of time because she knew how important it was. Yes, please. And last but not least, there is candles right outside. We are going to hold a candlelight vigil this evening for folks who can make it, for the families. So we'd love for folks to join us if you can. There are candles outside, and we'll be holding in the plaza, in Civic Plaza. But I wanted to let Miss Lisa Cedillo-White close us out.
Once again, we appreciate all of your time. We appreciate everybody that has been here all day. It's very evident to all of us how important our community is and for keeping our community healthy. So thank you all, and we will continue. Bernalillo County, the City of Albuquerque will continue the Keep New Mexico campaign, including other counties and other state agencies. So I want to thank all of our partners for being here, and thank you all for caring so much about our community, and we will continue to keep New Mexico alive. Thank you.
Thank you all. Hope we see you outside. Thanks to County Manager Bucket. We have some flowers for you too over here.